Good morning. Good morning. Welcome to day 2 of the Health 2.0 conference. How are we doing today? Sleeping. All right, we got one guy who's really happy. Fantastic. All right, so I'm not sure what happened last night that everyone's overslept. Maybe we emphasized too much that sleep was really important. And to release some dopamine in the morning, I'm going to start the day by saying, I love you. Yes? Aw, I know, see? Instant smiles across the room, instant dopamine right there. All right, so we have people from every corner of the globe, and we are starting our Day 2 conference. It's filled with amazing panel discussions and fire chats, bound to get some debates bouncing around. It's going to be great. And I would further like to extend our heartfelt thanks to our valued bronze sponsor, Dr. Ali Tanazli, the CEO of Lifespin GmbH, whose steadfast support and collaboration have played a crucial role in bringing this conference to life. I would love to start our first panel discussion. They are eagerly awaiting. So up first is the topic of genomic medicine, exploring the role of genomics in personalized healthcare. Our moderator for this session is Prem Iyengar, and joining him on the panel is Dr. Pedro Luis Gonzalez Sanz, Pallav Kandival, and Dr. Alexandra Filipovic. You're most welcome. Yes, your mics are on your chairs. Take a seat, and the stage is yours.
All right. Morning, everybody. Small crowd, so we hope that we make this as interactive as possible. We've got an interesting topic of discussion today, and of course, that's blended with an interesting panel also. I'd say it's one of the most diverse panels. We've got researchers, we've got practitioners, we've got entrepreneurs, and we've got technologists. So I'll start by quickly introducing myself. My name is Prem Iyengar. I lead the technology for life sciences practice across our pharma and medical devices domain at Accenture. I've been with the industry for close to about 20 years, primarily working on digital transformations, working on AI-led drug discovery, genomics, of course. It'd be incorrect of me to sit on this chair today without being involved in genomics in any way, shape, or form. And of course, I'll let the panel introduce themselves without much ado, but just to kind of give you an idea about what we're going to talk about today is, we're going to talk a little bit about where do we stand today as far as genomics and personalized medicine goes. We're going to talk a little bit about what the future holds and how do we really get there. We've got about a good 10 minutes set up at the end for question and answers, and we'd love to make this as interactive as possible. With that, over to you, Pedro.
Thank you very much, Prem. Well, my name is Pedro Luis Gonzalez. I'm a preventive medicine specialist working on personalized lifestyle medicine. And to do that, I use genomics, but not only DNA analysis, but I'm using nowadays a very precise tool, which is an mRNA analysis that is done uniquely in Europe, in the Sant Pau Hospital in Barcelona, and it permits me to know which, even years of anticipation, which one of the 320 biomarkers that it analyzes may be altered or not. And this gives me precision in our lifestyle plans because it gives me a very precise idea on where I have to look for with biochemicals. No? And I think that, well, we will talk about the future later, but I think this is the use I'm doing to genomics.
Pallav?
Yeah. I was waiting for your permission, Mr. Moderator. So yeah, hello everyone. Pleased to see some of us here. Myself, Pallav Khandelwal. I'm a second generation entrepreneur. I've worked my entire life, which is past 20 years, into pharma, supply chain management, right from warehousing logistics to distribution to retailing. Very recently started my own genetic testing company with a couple of friends. So yes, that gets me here on this esteemed panel, and we'll be looking forward to answering most of the questions and make it as interactive as possible. Thank you so much.
And Alex, just for clarity, you guys don't need my permission. And in case you were still wondering, I'm the technologist, he's a practitioner, he's the entrepreneur, and she's the researcher. Go ahead.
Thank you. Good morning, everyone. Nothing like a session of genomics to wake people up at 9 o'clock in the morning, I'm sure. So thank you for choosing to be here. My name's Alexandra Filipovic. I'm a medical oncologist practicing at Imperial College in London, UK. I'm also the head of oncology at PureTech Health. So I'll be wearing both my clinician hat and my biotech entrepreneur hat as we dive into this amazing topic this morning. I'm looking forward to a lively discussion, and please, we want to invite you to be engaged, so think of any questions that you might have for us going forwards.
Absolutely. So moving along, I think we should start a little bit with, we know personalized medicine is here to stay. It is the future. It's what we used to commonly refer to as new science, which was a combination of science and technology. What we want to start out a little bit is with, from your experiences, where do you guys think we are today with genomics and personalized medicine? Just to basically set up that stage for what we're going to talk about a little later. Alex, you want to start us off with that? You want to start us off with where do we stand today? Yeah.
Sure. I think it's really timely that we're talking about this, because we're really a decade into a renaissance of genetics and genomics, and I dare say that oncology has pretty much been the poster child for how this technology and the application can bloom in various different ways. So to start us off, really, I'd like to lay the ground of what we have today and how we use it in oncology and in drug development, specific to oncology, because really that's where I live. It really penetrated our practice about 10 years ago with the birth of next-generation sequencing, and we've seen comprehensive genomic profiling enter the clinics left and right. So we know that we use it for diagnostic purposes. We use it as predictive prognostic biomarker. We also have companion diagnostic in the pipeline that we use tremendously in drug development. So we use the results of genetics and genomics testing both for prevention, for diagnosis, for guiding treatment choices, for understanding better how or if patients are going to respond to treatment. And we have numerous examples of this in oncology. It obviously started with targeted therapies, and just to name a few, in solid tumors and hematological malignancies, probably the birth of all of this came with a BCR-ABL and Gleevec as what we call the poster child for targeted therapies in oncology. Then this followed with Herceptin for HER2, EGFR targeted therapies, KRAS, BRAF, PIK3CA, RET, NTRK, FLT3, CMET, and I can go on and on. So the portfolio of targeted therapies that were birthed on the back end of the gift of genetics and genomics has really flourished in the past 10 years, and it continues to. And then in 2011, we had the first immuno-oncology therapy approved, ipilimumab, and then that followed with the renaissance of anti-PD-1s and PD-L1s. And genomics and genetics has entered that space on a high horse. So we have tests such as MSI-High, tumor mutational burden, T-cell infiltration scores, IO360, and I could go on and on listing those tests that we use in clinic and that we're learning how to use in clinic. So whichever therapeutic modality we implement in oncology, genetics and genomics are very, very present. We test tissues, we test blood. So we have somatic profiling and we have germline profiling for prevention purposes and prophylaxis. And there are certain questions that these tests are able to answer, such as who do we treat and what do we treat with? And these questions, I dare say, are answered to some extent, but not fully. And then as we have been living in this era of genetics and genomics and oncology, we've also understood that there are some questions that we would love to have answers to, but don't. And it would be an invitation for seeing how we can get there going forwards. And those questions would be, even if a patient is responding to treatment, and certainly if they're not responding, when do we stop treatment? Because more is not always more. And then when do we switch? So for oncology, I feel those questions would be really important to address.
Absolutely, and that's an interesting perspective from a researcher's front, right? What we'd like to understand from you, Pallav, how is this getting translated from a commercial standpoint, since you're so much doing the on-ground testing, so as to speak, right? How does, where are we today with that, and how are we really utilizing this to enhance patients' lives? Not necessarily patients, just human life in general.
Yeah, wonderfully put. I mean, I like to ask question from all of you, this wonderful audience. Who all would want to prevent a disease rather than cure it? Please say hi or raise your hands. Right, everybody would want to prevent. Genomics and genetic healthcare gives us that technology, that edge where we can actually work on preventive healthcare. And having been said that, back in India, we've already started doing that. Doctors have rebranded themselves as preventive cardiologists, preventive dermatologists, preventive diabetologists, using these genomic and genetic testing. Once a patient understands their risk for future, they get to decide which healthcare to pick up, which healthcare science to go forward with, because back in India, we have wonderful people here, like we had some yesterday, who are practicing alternate medicines as well, like my esteemed panel. We have allopathic medicine practitioner doctors, we have Ayurvedic doctors back in India, who are actually working on preventive healthcare. So this is already here. And this is already changing how healthcare, personalized healthcare, preventive healthcare is being perceived. So I guess that answers the question.
Absolutely, and I think that's very well put. I think the crux of what you were trying to kind of say is prevention is better than cure. But I think the next stage of prevention is really prediction, right? So today we're more of reactive. We want to be more preventive, eventually veering more towards being predictive. And in that context, Pedro, you are practicing this today. What is it that you're doing today that is really using genomics towards personalized healthcare?
Well, yes, in reality, scientific wellness is a concept that was created maybe 15, 20 years ago, although it didn't have the result it should, because we didn't have the technology at that moment. You know? But I think that genomics, it's a very important field, and precisely today has been published in Nature, a US study, where they finally have concluded that at least there are 10 polygenic risk scores that are validated, taking into account the ancestrals and also the follow-up of the people. No? And this means that as physicians, we can create a good environment for our patients, explaining them that they have to do something about, no? But this is where I join my scientific precision with the holistic view, no? Because we live in an environment and in a world that is not ready for us to prevent, no? It is, all of them want to prevent illnesses, but it's very difficult because we don't have the food that we need, we don't have the lifestyle we need. Today, not everybody is here, but I think that they have done well because we are not ready to get up at 7 a.m. and have our cortisol level up during all morning. No? And we are just built up to have our cortisol level to get up and then steady in a low increase, go up until mid-morning. No? So this is something that we'll have to think also as a society, no? How we want to organize ourselves to be able to make use of all these advancements.
Absolutely wonderful point. And just to bring the technology view into it, because I just can't seem to shut up about it. One of the things that happened during the pandemic was that the rate of dropout during clinical trials drastically dropped. It was huge. So while we are pushing pharmaceutical organizations to be more innovative, be able to get drugs out faster into the market, they can do that only if they have the right set of patients to run their clinical trials. And this is where I think genomics plays a very large role, to be able to proactively identify patients for clinical trials. So rather than look at a drug and say, okay, now I need 500 people to do this, rather 5,000 people to be precise. You can proactively identify through genomics, through tests such as yours, to figure out here is a possible sample set of people that can be included in trials, whether that be oncology trials, whether that be Parkinson's, whether that be Alzheimer's. And cell and gene therapy essentially gives us the opportunity to be able to look at diseases that we today think that are truly incurable, right? The possibilities are enormous, and I think genomics has the answers to it to quite a large extent. We're just at the tip of the iceberg right now. We're just basically scratching the surface. And technology is there to kind of push that forward, whether we talk about AI. AI-led drug discovery has taken a significant turn with most pharmaceutical organizations investing very, very heavily in AI-led discovery. And the chat GPTs of the world have just enhanced that even further. But then pivoting more towards, so these are all here to stay. I think we agree upon that as a group. But what do we see as the future? And Peter, I'd like to start that with you. What do we see the future? How do we kind of marry genomics to personalized medicine? What's really the art of the possible? And this is where we'd like this to be as free-flowing as possible, because we're talking art of the possible here, right? Let's be a little controversial if possible. Go ahead.
Well, the future, I think it's bright. But again, we have to make thinking, deep thinking as a society, because what we need first is to validate all this. Just now I have mentioned this study that has finally validated 10 polygenic risk scores. But we know that there are a lot of companies, especially in the US and the Western countries, that they are doing risk scores based on DNA analysis since maybe 20 years ago, and they are not validated. So the first thing we have to do is to get as many people as possible to have their DNA tested. And this means assure them their privacy and their right to own their data. This is by one way. And the other thing is that we have to use artificial intelligence as much as possible. The mRNA analysis I use is based on artificial intelligence. If not, it's impossible to create profiles based on the polygenic expression of the genes and the mRNA they produce and the disease that they are based on. So I think that we have to make an effort as a whole society to be able to see the human being not as I would say a robot, that is composed of different parts, as by now is still the mainstream thinking in medical science, but to see human being as a conjunct of biology systems that are interconnected, interrelated, and transmitting a lot of information every second, and so be able to have all this data from inside and transform it in something that is actionable.
Absolutely, and I think that's an interesting point, right? It's all about the data. There's ridiculous amounts of data. How do you really make sense out of it? I think that's the answer that we're looking for. How do you really make sense out of the data? To your point, AI will help, but AI, again, will help. Somebody has got to put their minds to it to really figure out what should be that algorithm. How does the algorithm interpret the data, right? And so, Alex, the question is more to you as a researcher. How do you think researchers should be thinking about this in terms of making sense out of the data? And then afterwards, Pallav, what I would like to hear from you is, while the researchers are going to give you that insight, right? How do you make it more commercially viable, and how do you really, I think another key part is to spread the word, right, for the lack of a better term. How do you really go about doing that?
So I'd like to put forward really a short answer and then I'll elaborate. I see the answer to this being two words, and those are integration and openness. And what I mean when I say that is integration really means getting out of our silos. So if you think about oncology, both in terms of clinical practice and clinical development of novel therapies, we are a little bit siloed still. And we've heard these amazing applications of genomics, personalized healthcare, prevention, lifestyle genomics. So when a patient walks into our oncology clinic, I would like to invite us to look at them as a whole and not as a tumor. So if we could understand that perhaps they're experiencing this condition at this given point in time, they are a whole person. So we need to start collaborating and integrating all of these beautiful offerings that we have today that genomics gives us. And then I really feel that AI is going to tremendously help us make sense out of the data so that we can go back to being human. That's integration. And what I mean when I say openness, it's really willingness, if you would. It's our willingness to be open and to accept and embrace what technology and genomics are giving us, and not to think that our role as a clinician or as a drug developer is going to be somehow taken away from us, because it's not. It actually is going to be repurposed to what it was meant to be all along.
And that's an interesting point, right? I think it's very important to understand AI is not to replace, or technology in general is not expected to replace, but to help augment human capabilities. AI can do what you ask it to do. Yes, it can self-learn, etc. But that again is dependent on what you want it to learn. It's not going to be able to cure. It's going to be able to tell you, here are the possibilities. So we need to your point, have an open mind around it, right? And so, Pallav, how do you think that really translates to from a commercial standpoint? How do you scale it up, really?
Oh, as an entrepreneur, this rings bells, you know? So I'll just throw in some numbers. The genomic service market in 2023, just the genomic service market and not the associated market that comes along with it, was 46.2 billion around, you know? It had jumped 3 times from 22. So imagine how big it'll be in coming 5 years. Now what AI does, and we need to embrace, we have to embrace genomic testing, genomic healthcare. This is what all countries and all healthcare service providers should do. And that's how we will move forward and make it commercially viable. As we keep embracing it, make it available for all of them, the scale of economies go down, and people from the lower income group can also afford it. And doctors can start prescribing it. The reason I say that is, let's take example of Dubai, where we are sitting, such a wonderful country. They have an AI minister. They have a ministry for AI. They have already made the company that I come from, my DNApedia testing kit, as medical devices. They've certified it. So see, countries are already embracing it, trying to bring it in the mainstream healthcare practice. So it's like AI. Either you embrace it, or you can, start to say that it's a demon. But it is here. Let's embrace genomic medicine. Let's embrace them into our, regular practice. And I'm sure it'll give you tremendous outputs. And like Alex said, we'll be humans again. Yeah.
We'd be humans again. That's
Very controversial, and we had discussed this last.
and thanks for that. And I'm hoping that elicits a few questions from the audience. So interesting conversations. Pivot a little bit, right? So yes, we know what genomics can do. We know what our AI can do, right? The million-dollar question always is, okay, but how, right? Of course, the technologists will say, tell us what needs to be done. We'll build it for you. But then how do you really go about this, right? One of the things is we talk about, to your point, right? We really talk about silos. But is silos really something that's going to help, or do we need to really look beyond those silos, right? We need to start looking at things from a more holistic perspective, because that's what genomics can really tell us. It can tell us an individual's capabilities. Where does that individual stand from a genetics perspective? What is that individual predisposed to? So how do you think we should be going forward with this whole topic of merging genomics with personalized medication? Pedro, you want to?
Well, it is very important to remind that genetics is not something that is static. It's a dynamic thing. As a biology system. And the environment and also our inner mind changes our epigenome every other second. And from this point of view, with AI and genomics and all the technological advances, you have a very good tool to know what is happening. But then how to act upon this remains on the side of the person, no? Your client or patient or whatever you want to call them. You know? And the thing is that, for example, in my practice, I can be very precise, providing my clients with a personalized nutrition plan, a mobility plan, a recovery, and all this stuff. You know? But the main thing we work on is their attitudes, their emotional attitude, and their upon them and their life. Because if they don't begin to give a priority, and they understand that all they can do is in their hands, they're not going to do it. This is why all preventive public health plans and lifestyle plans by now are failing, because people cannot change the way they have been built up.
Absolutely. And we're talking massive change here, right? We're not talking about changing just the laws. We're talking about a change in the way people think. So Alex, to question you, right? How do we really go about that from a researcher's standpoint? How do we really propagate the thought process around, let's not look at it from a silos perspective, let's look at it holistically. How do we kind of make sure that any treatment, or rather any innovation that we really bring about really takes into consideration a holistic view into things? Obviously, it's a lot easier said than done. But then we're still talking art of the possible, right? So why not?
Yes, it's really this concept of holistic genomics. And it incorporates the integration and getting out of our silos that I mentioned earlier. So what could that look like? Let's say from a research standpoint, we now have so many incredible pharmaceutical and biotech companies who are developing new drugs, and really we're seeing paradigms shifting in terms of the modalities that we have at our disposal to treat diseases. So notice that I'm not saying disease, I'm saying dis-ease, right? So shifting our mindset around some of the narrative that we use will be super helpful as well as we go about this. And we have clinical trials, and we say the trial has succeeded or the trial has failed. The drug works or the drug doesn't work. Well, if we take a step back and we really zoom out for a moment, within every clinical trial, there are patients who have responded to the treatment and then those that haven't. But we tend to look at these clinical trials as singular entities. And I understand also from talking to you yesterday that there's an incredible initiative now to step out of that model and to really integrate that concept as well, because my bet is, I mean, we're humans, we're more similar than we are not. And my bet is that if we start pulling the data together, because we sit on so much data in isolation, if we only were to pull it, not even just in one medical area, not just in oncology, but pull it perhaps across autoimmune disease, inflammatory disease, oncology. Pull the trials together and see the common thread between patients that haven't done so well and those that have. And let's see what happens there and where does that guide us. So as much as we have tools today that simplify things a lot, I think that our minds tend to overcomplicate it. And the answer is probably simpler than we think it is. So again, integrate and be open. Be open to look at the data in their totality.
Absolutely. And again, right? So, of course, please.
Because it's very good that you're telling this, because I have remember now the fact that among the most sold drugs in the US, for example, the 8 ones, the one that has more efficacy in their target population has 20%. So we have to rethink, no, about our model and how we are confronting the fact of health and disease.
Makes absolute sense, right? And when we really talk about breaking the silos, when we talk about looking at it holistically, right? I think that gives us another insight, and that's around the efficacy, the side effects, in a much more precise manner, for the lack of a better term, right? So I'm looking at comorbidities from the data itself, even before I really get into the administration of the drug itself. So which means that I have really gone predictive, for the lack of a better term. So Pallav, again, coming back to, and I think your contribution is more around being able to scale this, right? Because ultimately, at the end of the day, if it's not scalable, it's pointless. So your thoughts around the scalability piece?
Yes, absolutely. And see, this goes hand in hand, the research, the scalability, the economics, and how we can integrate. Because until and unless genomic testing, genetic testing is accepted, we won't have that data. If we won't have that data, we won't be able to use AI to interpret the data, make sense out of it, segregate it, use it for different purposes. So it comes back. See, all of this goes hand in hand. I mean, the point of this being accepted as commercial as possible, included in day-to-day healthcare practices. I'll share some examples. The Chinese government had made it compulsory for their Winter Olympic team to go through genetic screening. A lot of sports institutes in India and abroad are doing it, already using it for injury prevention, for nutrition, for diet, for performance enhancement. So yeah, of course, this has to be done in an ethical way. But then again, as soon as we start incorporating it, and that's where we come into picture. Like, we've started training our healthcare practitioners along with passing information about something of this sort is available and is very economical. The days are past when this was very, very heavy on pocket. It is very economically available. It's just that we have to start teaching ourselves to use this, as we are doing for AI or for other applications for that matter. So yes, this has to go hand in hand.
Absolutely. And with that, I think we're at a 2-minute warning. So just to kind of sort of conclude, right? The data exists. We need to make sense out of it. We need to keep a more open mind about how do we bring all of this together. And then finally, incorporate it literally in our day-to-day lives. And the technology is available to augment all of this. that's my conclusion out of it. And I'd like to hear from the audience if they have any questions or any comments on this topic. Yeah, please go ahead.
Can we have that mic operating, please? Or you can.
It's working? Hello.
Yeah.
Great. Hi, I'm Kunal from Bombay. Very nicely said, madam. When a patient comes, right, we are not only checking one part, we are checking the whole. What is the emotional state? And Mr. said, genetics are not only static, it is dynamic. Beautifully said. Now, my question is here, because I'm in the line of training from the last 30 years, and I have seen a lot of business clients are getting heart attack, okay? Especially CEOs, they run marathons, okay? In the morning time, they get a lot of heart attacks, injuries. Many people are getting autoimmune conditions. Now, my question is simple as it is, how genomics, okay, and stem cells, they connect, because the stem cells can become any cell, all right? If a person is getting heart attack, can we replace stem cells and with the genomics to create a new heart and to repair it or reverse the autoimmune condition? How it will connect? Because I'm a lame person here. Please help me, because I want to understand in a deeper way, so that I can suggest this technology to my clients, my patients, you know. I'm not master of your line.
So I'll take the first part of it.
Yes.
The researchers and the doctors can pull in later. So let's try and prevent it from happening, and let's not try and replace the heart and make a new heart, but let's prevent it from happening, and there are various tools to do that. So when we enter into the genomic healthcare specter, genetic testing specter, we get so much information. We already have predispositions of that person, whether he'll have that cardiac condition or not. Not just that, we have information such as whether exercises increase someone's blood pressure or it decreases.
Exactly.
Everybody works in a different. So once you know as a trainer what exercises does to that person, you will make a plan, an exercise plan, specifically according to his body. That gives you that edge.
Right.
What supplements to take, what exercises to follow, all of that. So many informations. I mean, you can tailor-make, that's why that precision medicine, precision healthcare, you can tailor-make regimen plans according to an individual, and it will be amazing. He'll start feeling amazing from day one.
And I can vouch for that. That's coming from a national level basketball player.
This is a preventive measure, right? But if somebody already got the heart attack, I'm talking about, because the stress level is so high in the business, in the family, I'm talking about emotional stress, which is a killer, which can create cancer, tumor, any kind of metabolic conditions. So I'm talking about how this technology is going to help to, is it possible to reverse, to heal that heart? If that person is on medications of 12 medications or 13 medications every day to pump the heart, to run the show, can we reverse it through this technology? Is it possible? I just want to know that.
I can take the first stab at it, yes. So I'm not sure whether I can give you an answer that puts genomics at the center of it. I think genomics could be a part of it.
Okay.
But I don't believe it could be the whole answer. That said, my answer to your question is yes.
Okay.
It can be done, and it potentially could be reversed. And how do we do it? This is where we get into, it's a multi-layered approach. And what that means is that you mentioned their lifestyle is stressful. You've mentioned, I heard you say emotional component. This is where we go for. And I hope that, and there may be something out there already, and I would love to know if there is. I hope that there is going to be a genomics tool as well that we can hold its hand and that can help guide us through this. But it really becomes that humanized approach. It becomes the point of addressing the stress and the emotional underpinnings of it and the reasons behind it, the why behind it. I don't think that genomics today can answer the why,
Right.
which is why we need to get back to being human as trainers, as physicians, as
Yes.
facilitators of this, as holders of that space for healing. So I think genomics is hugely important there. Prevention is hugely important. I think all of that goes together and you get to incorporate that, and that's beautiful. Chrononutrition, that's very personalized. Asking the question, who else lives here? What does that mean?
I got it.
Gut microbiome, right?
Got it. Yeah.
Genomics of
got
that.
brain access.
How do we get to optimize that?
Yeah.
So that's that holistic genomics. And then there's that personal touch that's going to beautifully address the stress and the emotional component. And together, you're going to see that condition reverse, if it's meant for that person.
Thank you. Thank you so
They
much.
have to make a choice as well.
Thank you. Thank you.
Yeah.
Sure, I think we've got one more question, and go ahead.
Hello. Thank you for this great contribution about genomic and genetics. So my question is in the field of prevention that we talked about. When we look at health challenges, a general rule is that health challenges are multifactorial. We have predisposing elements and trigger factors that activate those predisposing and predispositions that each and every human being has, because we all have some. From research today, we know that the field of genomic and genetics belongs more to the predisposing section more than the trigger itself. So my question is, where is the ethic, and if in the field of the expertise, how do you see the boundaries between carrying and performing some testing to make preventions, and almost giving to people that are healthy, giving them an information that they might develop a certain type of disease, when we know, as you said, sir, that our brain is actually much stronger than our genes themselves, because we can actually have a much greater influence. So our mind, and getting to know that we have a certain type of genomic predisposition that by itself would never be able alone to trigger the development of the disease, how do you actually plan to control in an ethical way the prevention and not allowing this information for people to be the actual trigger, and to see this tool as something positive for the future and not something that behaves as a boomerang and that becomes a trigger itself? Because if we would carry genomic and genetic tests on all the people in this room, we would all show up some kind of predisposition to develop certain type of disease, certain type of imbalances, and so on. So where does the ethic of the companies that are developing this for the future? Thank you.
Well, it's very interesting because this is something that I have worked on. Well, nowadays we are at the dawning of all this. No? We are very excited about genomics, but indeed it's in the beginnings. And as I said before, just now today have been published a study that finally detects as valid only 10 polyrisk scores. And one could ask ourselves, do I have the right to tell this person that has an X risk of cardiovascular or cancer disease? Nowadays, for example, what I do is just to make an analysis of how they are doing at this time with their lifestyle, in the environment they live, how they live, and then we work on this, but not on risks. Because working on risks, it's something that unless you have a clear intervention to reduce or annihilate this risk, it's no way. Either way, they are going to have to make lifestyle changes. So it's just something. But if you think, this is said from my clinical point of view, but if you think as a human point of view, I think I have the right to know. And
Also,
this is something that should be left to the people, no? But I think that the right to know is something that we have to preserve always.
yeah, also, I mean, when we incorporated this, how we did it, it is very important. This is very important because stress is the biggest trigger factor known forever, you know, and somebody has predispositions and they get stressed out about it. So what we've made is we only work with counselors. So the information routes through medical practitioners, trainers, sporting authorities, you know, and so you bringing back the human touch, you know. So how do we give out bad information to somebody? We do it through counselors. So if we have a bad information to pass on in a hospital, how do we do it? We have to do it. So we do it as a human. So once, because it closes the loop, because the practitioner, the trainer, they also have the solution for it. So it's not just giving out stressful information that you might have this, you have this, but he's also giving out the solution for it. So I believe that brings down the stress and give out actual solutions to patients.
Yeah, is it okay if I briefly address that? I absolutely love your question. And the reason why I love it, I'm going to give you two visuals for everyone in the audience. One is, imagine that the condition or the disease is a house that's burning, and there's a fire alarm that's going off to tell you that that's happening. The fire brigade comes and points the hose at the fire alarm and not at the burning house. This is really how we're addressing conditions, many of them today. We're pointing the hose at the fire alarm and not at the actual house. So we're not going down to the root cause. And this is where I believe that, in part, genomics and genetics can help. And the other part of this is what you've brought up in your question. Do I want to know? Are you offering me the solution? What is the right time? And I feel that one piece of the answer there is education. And it's also re-empowering the patient back. Because they have, I feel, given too much power to us as physicians. And I think it's time now for us to give their power back to them, because every single one of us is really the CEO of our own health. And I think that needs to be a reframe going forwards that puts the power back where it belongs, so that we harness sovereignty and discernment when we make our health decisions for ourselves. And then not every condition can be even addressed by genetics and genomics. It really can't. There's only a handful of diseases that warrant proper genetic treatment, and we thankfully have those available now, and more will come. But here's something just for the sake of discussion as I wrap this up. Think of our genes as a library, as books in the library. You walk into a library and the books are sitting on the shelf. Unless you pick the book up and read it, it's not going to read itself. So you need something to read your genes. And there's that layer that floats above our genome that we call epigenetics. And there's something to be said about how our daily living influences our epigenetics, and therefore the expression and the interaction of our genes, and how then that translates into what we're experiencing on a physical level. So I feel that we are not only going to be going forward integrating aspects of genetics and genomics, but we're also going to be collaborating with epigenetics, with metabolomics, to make that holistic view.
Absolutely, and I love that point Alex made. You are the CEOs of your own body, right? with that in mind, please don't run to the CXO 2.0 conference. On that note, thank you very much, everybody. We're significantly over time, and I apologize for that. But I think interesting questions, fantastic conversations. Love the interaction, and hope to do this soon again. So thank you, everybody.
Everyone.
Thank you so much. Thank you.
Thank you so much to our experts. All I'm going to do is ask you to take a step to the front of the stage so we can get a lovely photograph of you all. Yes, put your best smiles on. And I see the room has filled up nicely. So good morning to you all and welcome to day 2 of the Health 2.0 conference. For those of you who don't know me, my name is Maxine, and I will be your host and your guide for the entire conference. Up next, we have Ariba Khan. She is the CEO and founder of Jumping Minds. Now, she does have a very short presentation that she'd like to chat to you about, and the topic is Next Gen Mental Health Platform. Thank you so much, panelists. Thank you. And if you could all give Ms. Ariba a round of applause.
Hi, everyone. Hello. How are you feeling today? Great. Good to know. It's important because we are going to talk about mental health today. So let me just get started. Whether you are an individual or a doctor or an entrepreneur, we have all realized that mental health is very important for all of us, right? And today we are going to talk about Jumping Minds, an India-based platform that is good, that's transforming mental health care. Now we know that mental health comes in every shape and form. And most of the time, mental health has been an intangible part of healthcare, where we don't know how to quantify it, where we don't know how to measure the impact of it and the outcome of it, right? If we just break down these challenges into specific challenges, there are 3 of those. First is low supply of medical professionals that we have seen not in just India, but across the world. There are almost 1 to 2 medical professionals for 100,000 individuals suffering from mental health challenges. So just a layer of medical professionals is not enough in today's world to tackle mental health. Second is low engagement and retention. These days, if you look at majority of the mental health platforms, they go with the traditional approach of reactive therapy. If you are feeling stressed, you reach out, you book an appointment, and you take a counseling session, which is not enough in today's generation. People need more engagement, more communication. People need to see their own challenges and a personalized approach to their specific issues. And finally, although we see robotics and artificial intelligence coming into surgery and traditional healthcare, but it has been missing from mental health. Let's see how we are tackling these at Jumping Minds. Yeah. So at Jumping Minds, what we realize that we all have different levels of stress every day. Some days we might be feeling happy, sometimes we might be feeling a little low on stress, and sometimes we are feeling very overwhelmed. So there cannot be a one solution for everything when it comes to mental health. It's a complete spectrum, right? So what we are trying to do is to build a comprehensive solution. And we realize that any solution that has to be scaled has to be, first of all, anonymous, because stigma still exists in most of the regions and countries. So anonymity provides comfort to the users who talk about their most deep-rooted challenges. The second thing has to be round-the-clock support and a first layer of defense. So if you look here, at Jumping Minds, we are trying to create a comprehensive and advanced solution where a community, assessments, and personalized programs form a first layer of defense, while a 24/7 emergency line and a smart dashboard continuously tells you what are your mood levels, what are your stress levels, and what are your triggers that sometimes you yourself don't realize and, make you more stressed. So coming to the main crux of it, technology. So technology, we believe, is going to be the key to solve mental health. Now, at Jumping Minds, we are a tech startup more than a mental health startup, and we are trying to solve it through data and tech. We have 5 AI engines running in our platform, And thanks to my CTO, who is also here, my co-founder and CTO, Piyush Gupta, all of our engines are inbuilt within Jumping Minds and are proprietary and are the most advanced in the entire world. And you can discuss this with me and we'll tell you more about it. So, talking about safety and empowerment, if I'm talking about my mental health, I have to first feel safe. I have to feel empowered. I don't want to feel that I'm coming here for help, right? So creating a platform where I have the control of my data, of my challenges, who I am talking to, and what is the impact, right? So this is the safety and empowerment engine that we have created that works on sentiment analysis as well as natural language processing that helps you identify your own mood levels, help the experts and the community members, deal with you more empathetically, as well as giving you the full control of all the sessions itself. Second is personalization. So what happens when you are accessing any offering at Jumping Minds, right? It talks to you about how you are feeling. What is it that's, impacting you? And a lot of data, which helps us create a profile of the users, right? And this profile helps us match users with experts. Because as we know, the biggest challenge today is, I am feeling anxious and stressed, but I don't know who should I talk to. Who is the medical professional that I should reach out, who can help me better? So that's why the personalization engine, given that Jumping Minds has a complete comprehensive platform, we match experts, we match community members, and we match therapy. Someday you might need to talk to an expert. Someday you might just need to take a quick 2-minute peaceful exercise to feel calmer, right? So this engine helps us suggest therapies to users depending upon how they have been feeling. Third, so we've been able to collect over 40 million events related to a person's profile, their mood levels, their age, what kind of work they do, what kind of triggers they go through, and this helps us personalize and optimize the entire experience. I will not talk about the bot a lot. I think you guys already know about mental health bots. They have become quite common, right? Our goal here is to not make a therapy bot. Our goal here is to make a friend bot, right? Where a person can just hear and talk to the bot for 30 minutes and so, and not just, read about depressions, definition, right? But have a very real conversation. And we have been able to collect 1 million hours of conversational data in English where people are talking about their stressors. And this helps us improve our bot into a more humane level and not into just an AI machine, right? Finally, let me just give you an example. If you're a doctor, if you're an oncologist, right? Or if you are a maternity doctor, if before a patient comes to you, you have a data for 6 months that, okay, this person has been feeling very overwhelmed. The key challenge is that, maybe their work culture is not good, or they are not getting the enough support at their family, or maybe they have gone through some chronic illnesses in their past, right? So in the final one, the predictive AI dashboard, what we have developed is that as an individual, in a real-time manner, you are able to track your stress levels, your physical health, as well as what are the triggers and how you can get help, right? This basically combines 3 levels of data. The first level of data is the mental health data or the psychological data, which is what are your stress levels, moods, triggers, and so on. The second is the physical health data. How much are you sleeping? How much are you walking? Majorly from your smartwatches, right? So overlaying this data, we are in the process of, as you must have heard in the last panel, we are in the process of overlaying genomics and your health history, which is your pathology reports, your genomics report, overlay on this so that we have a future-proof predictive AI dashboard. This is what we are trying to do at Jumping Minds. If anyone of you wants to know more about it, you can talk to my co-founder here. So how have we fared so far? Sorry for that. So I am proud to say that in just 2 years of operations, we have been recognized by all the industry veterans, whether we are the Economic Times National Mental Health App, we are winner of Medics, we have been recognized by Google, and so on. Our goal here is to engage with all of you mostly the medical professionals, and figure out how we can do a better job, how can we create a global platform that is able to scale and does not see the challenges that we see every day, and how can we, make a better solution for you. Please do come talk to us and check out Jumping Minds. Thank you.
Thank you very much, Shariba. That was very, very insightful. I'll take that. Thank you. All right, so that was very insightful. The future is here, and the future is AI. I'm sure we all agree with that. We are moving on to our next keynote speaker, and this is from Stefan Wall. He's the owner and founder of Vital Wealth Pharmacy Group. From digital health records to cutting-edge e-pharmacies, Stefan will take you through a journey through Germany's success stories in healthcare digitalization. Get ready for a session packed with insights, strategies, and real-world examples to help you master the digital transformation in healthcare. Put your hands together for Stefan Wall. You're welcome.
Good morning, everyone. I'm pleasured to be here. I'm the fourth time in Dubai, but it's the first time in the conference. And at the moment, first of all, I would like to take the opportunity to thank my daughter. She comes with me to Dubai and support me here. Thank you, Marie. And also I want to say hello to my other 3 kids. They are watching the live stream, I hope so. And thanks a lot for your support and also for the support from my partner. She looks the live stream also. And yes, they supported me the last week. Very great. Thank you very much. So, I'm glad to share my topic today. Our topic is digitalization of the healthcare systems and the pharmacies in Germany. And why is this topic so important for us? We have more points, but 2 points are interesting. The first point is we have an enormous shortage of medical practices in Germany. Doctors, pharmacists, nurses, also midwives. And we need to provide care in a new way. And the second time is the mass of data is only processed digitally. I think there's no other chance. And we see it in the presentation. So I will give you a short overview of the content. Yeah. Perfect. I want to introduce myself shortly, and then we look to the German healthcare system, background information about the digitalization, electronic patient records, telemedicine, telepharmacy, e-prescription, e-health apps, wearable devices, and last but not least, further digitalization examples from practice. So let's start with the introduction. My name is Stefan Wahl. I studied pharmacy in Halle. That's a city in the east of Germany, short after the wall is fallen. It was an interesting time there. And after this, I switched to the University of Heidelberg to medicine. And 3 years later, I had the opportunity to found a new pharmacy. And I was a little bit study tired, and I opened then the pharmacy 21. And since then, we opened. One moment. Since then, we opened 6 more pharmacies the next years between Heidelberg and Stuttgart. I think 1 pharmacy is not on the map. I hope it exists still. And We have other groups who works in the healthcare system, like LMU. She's responsible for the building for medical houses, doctor offices, and also outpatient operations rooms. And the newest company is the Diametral. And this company is providing healthcare in rural areas, including telemedicine. So we are in all the digital healthcare systems involved. And now we just have a look to the digitalization, success story from Germany, question mark, is it a success story? We will see after the presentation. Just have a look in the German healthcare system. You see the healthcare system is very complex in Germany. You see in the inner circle, there are the service providers like us, like doctors, like nurses, like hospitals. And on the second circle, there are the regulation, administration, health insurances, etc., etc. And both circles outside, that's the circles where you have the free market, where you can buy, for example, private healthcare services or medicaments who are not paid by the insurance. And this is the statutory healthcare health insurance in Germany. We have a statutory system. 85% are insured in the statutory healthcare insurance, and only 15% persons are insured in the private health insurance. And how can you get in the private insurance in Germany? You must be self-employed or student or official, or you need to earn more than, I think, 69,000 euros a year. Then you can change the insurance. You don't must go to the private, but you can change the insurance. And then you have 15% there in the private insurance. And how works the system? You can see it's a healthcare fund. Zero page. No. Okay. You can see the healthcare fund in the middle, and all involved paid in the healthcare fund. On the side, on the left, the employees paid 7.3% of their salary, and on the left side, the state pays a contribution to the tax revenue. On the other side, the Federal Employment Agency pays, and also the German pension insurance, they pays contributions for the unemployed and the pensioners. And the healthcare fund by himself pays the insurances, and on the right side, the insurance pays doctors, pharmacists, hospitals, and all the other service providers. So it's a complex system in Germany. But it's mandatory to have a health insurance. You cannot have no health insurance in Germany. So after this, there's also a national digital health agency. It's called Gematik, and it is responsible for all digital projects in Germany, such like telematic infrastructure and all these things. Okay, just look to a few numbers. If you see here, the digital healthcare market is a gigantic growth market worldwide. We have a growth rate per year around about 15%. And from the numbers, the digital healthcare market will grow to 155 billion euros across Europe, 2025 estimated. German market, 2025 estimated 83 billion euros. And by 2025, digital health will account for 8% of the healthcare market in Europe. And if we look at the global market, 2022, 230 billion euro, now dollars, sorry, and 2035, 980 billion US dollars. You can see the market is very, very big and interesting for investors. So, and now let's take a look to the essential digitalization projects in Germany. There's once the electronic patient record, EPA, elektronische Patientenakte in German, then the e-prescriptions, the telemedicine, telepharmacy. We have the wearable devices and also the healthcare apps. Let's dive in. Electronic patient report. What is it? The electronic patient report is an essential element of connected healthcare and telematics infrastructure. It's a digital file. You can store there, view, share your health data, and it enables quick and easy access to all relevant medical information. It can be used as an app or with a health card and a PIN directly by the doctor's office. And since 21, every hospital in Germany must have the ability to load the data onto the APA. And the APA is important for multiple illnesses that are treated by different specialists. What's the advantages from the APA? It's a fast and easy access to all relevant medical information, better interdisciplinary collaboration, and is no more paper needed. And the disadvantages, security problematic. In all digital projects is security problematic. And here are still too few service providers involved in Germany. It takes time and it takes financial investment, and also you need to keep it up every time, yourself and the PC. Okay, telemedicine, telepharmacy. What is it? Telemedicine makes it possible using audiovisual communication technologies. Telemedicine is an important part of medical care, especially in rural areas. So why is it necessary? Like I said at the beginning, the shortage of service providers is immense. If you can see the map on the left, that's Germany, and the white areas north of Germany, but also in Bavaria, the white areas, you need, or it takes up to 30 minutes to go to a hospital. 30 minutes, and it's similar to go to a doctor, and in the next few years, it's also similar to go to a pharmacy. 600 pharmacies were closed in Germany at the last year. The trend is rising. You can see it's a big problem for us. To make the healthcare better in the moment. Okay, then the advantages from the EPA, from the telemedicine, sorry, faster access to the doctors, faster access to the specialists. We have in Germany less specialists. Sometimes you wait half a year or 1 year to get a meeting by the doctor, also it's too long to wait. And it's important for structurally weak regions, and the disadvantages is also the data security, but this is in all digital projects a disadvantage. So when you see German patients are more cautious about the digitalization services than worldwide. In this statistic, Germany is represented by the dark blue graph and worldwide by the light blue graph. And you can see, as you can see, Germans are in general more skeptical of telemedicine. You see it here, and this one, and also this one. And this one is Germany. The people goes to the doctor in the offices. And I think we must learn a little bit how telemedicine goes on. E-prescription, that's the biggest part of my company the last days and the last weeks. What's an e-prescription? Insured people have the option of completing e-prescriptions digitally using the electronic health card or using QR codes. Yeah? You can have a QR code on the smartphone, you can use an electronic health card, and you come to the pharmacy, you insert the card in the card reader, or you give us the QR code, and we retrieve all the open e-receptions and handle the medicaments to the patient. It's relatively easy to make it. Here you can see the old paper prescription, and on the other side, a smartphone with a new QR code, and you can go with the QR code in the pharmacy or can send the QR code to a pharmacy who you want. Yeah? Also to a pharmacy who can deliver your products. Advantages: faster and safer. Storage of paper prescription is not necessary anymore. That's good. In the last years, the insurance companies stored the paper prescriptions up for 7 years. They need thousands of square meters of storage. That's a great problem in Germany. And now we can digitize, and no paper is needed anymore. And disadvantage also the data security. And all data is stored centrally on one server in Germany. So if the server breaks down, no one can get a prescription in Germany for this time. Short e-health apps and wearable devices. What kind of apps and devices are we using in Germany? Activity tracking fitness apps, fitness trackers, health apps, medications, nutrition, symptom checker, smartwatches, and other devices. And if we look there, it's only a study from 2017. I think today there's much more use, but 2017 there were 21% who use fitness apps, 15% who use fitness trackers, and 12% who use health apps, but also 62 persons who need nothing from this. But like I said, today it's much more use. And I have one, it's my favorite wearable. It's the Life's Abbott. So how is the name? Did someone knew him? Life. I said it. It's a wearable for diabetes patients. You apply it on the skin, and you can overview your blood sugar over the app in the smartphone. And I use it all 2 months for 14 days. It's very disciplinary. Yeah. Eating cake goes to 0 if you have this. Yeah, you need no Ozempic. Very good thing. Freestyle Libre 3. Now that's the name. Okay. There it is. Okay. And then we have, last but not least, further digitalization examples from practice. I think this is an old example. Our first video pharmacy was built in 2014. It was a time where the government told us there's no need for a video pharmacy, there's no need for telemedicine, and it's only 10 years ago. Today I think it's obvious that digital healthcare is important. So this machine is a case for the museum now. It gives better machines, but it was the first in Germany. And then we have a storage automat, storage machine, about 15,000 medicaments are in there. And this one is the most important and successful project. I think digitalization should increase the quality of life. If I receive an e-prescription in 2 minutes instead of 20 minutes, a paper prescription, that's good, that's great, but it's not a must-have. I think to avoid hospital admissions, to avoid side effects, to avoid drug interactions, to avoid doses errors, all that was in the pharmacy that's increasing quality of life. And if we see 5% of hospital admissions in Germany are caused by drug interactions, side effects, and doses errors. 5%. That's much, too much. Yeah. One number, 250,000 hospital admissions in 1 year only in Germany with 2 medicaments, blood pressure, ACE hammer, and diuretica. Only these 2 medicaments with the false doses, 250,000 hospital admission. And if we can make less mistakes in this program, we increase the quality of life. And I will show you what we made. What did we do in the last time? We delivered the medicaments. We're giving it to the geriatric nurses and they blistered it, or we're giving it to the patients by himself and they blistered it, or they take it every morning, every evening, normal. And there are much mistakes. And what do we now? In the photo you can see our blistering machine, and in the photo below you can see our control machine. We download the digital medication plan, and this plan we double check. We double check it for side effects, we double check it for interactions, we double check it for doses errors. And if there's a problem, we call the doctor, and if it's okay, then it's okay, or we change the medicaments, we change the doses, we change some other things. And after this, we're blistering the medicaments by an automatic machine. After this, we control it and double check it with the machine, and then we deliver the blister to the patient. And this is the end product for our patients. 7-day blistered medication for every day, every time you can take tablets. It's very good, it's very easy, and we have less mistakes than the old system. I think it's a big advantage of digitalization. The rate of errors are significantly lower. Okay. Last one. Digitalization. It's a digitalization from an AED. This is an automatic external defibrillator. The problem was there are much defibrillator in the Rems-Murr area, but no one knows where they are. The person revives the patient. And you can see here, it's the look from the emergency control center, and you can see the operator sees the AEDs, he sees where the layman is, and he directs the layman to the AEDs, and they make a study evaluated by the University of Hohenheim, and the use has been increased. The use of the AEDs has been increased between 53 and 170%. That's a very good thing. And I think this is a success story from Germany, and that's what I want. And time is up, I see, so I can end the presentation here. Thank you for your attention.
Thank you very much, Stefan. Very insightful indeed. Everything is going digital, and yes, saving the trees, saving paper is also good for the environment, yeah? We only have one world. We only have one Earth. Now, I know the next one is definitely going to captivate you. Our next is a fireside chat, integration and interoperability, enhancing safety and seamless data exchange in mobile health ecosystems. Sounds pretty technical, right? But don't worry, we've got a stellar lineup of experts that are here to break it all down from us, from tech advancements to regulatory policies and actionable tactics. They'll be sharing insights and strategies that'll leave you feeling empowered and informed about the mobile health landscape. I'd like to welcome to the stage our two speakers. We have Shikha Kumari, the Deputy Director of the National University Health System of Singapore, and Mr. Vivek Mahendra, the Managing Partner of Viveka Advisory. Please put your hands together for our speakers.
I think it's on. Yeah, hi. Thank you, Maxim, and thanks to all of you who are staying back. I think I'm standing between you and the lunch. Me and Vivek will try to give you some pointers which will be interesting and share some of our perspective. So I'm from a provider side. I am from one of the 3 health clusters in Singapore, taking care of or implementing value-based healthcare. And our cluster has 3 acute hospitals, 2 step-down hospital, and few poly clinics. So I will be talking from the provider side and the patient side, and then we have Vivek.
Yeah, good morning, and I hope you're having a good day here. So I come from, you may call it the consultant influencer, to see how we drive affordability and accessibility for healthcare. For the last 15 years, I've been working with provider ecosystems in the US and in India to see how we bring data interoperability in a way that helps from a longitudinal health perspective and see how it leads to maybe more accountable outcomes. What I will try to do is to not go technical on this subject, because the subject can really become technical in nature, but focus on bringing in a few elements for thought here. Because I think what we need is a more cohesive thinking process in this, and especially because it's a fireside chat, I hope it doesn't burn us. But some of the thoughts we intend to put up here are thought-provoking and a little more inclusive, and we hope that we'll get your support through the process.
Thanks, Vivek. So I think we do have a clicker, or there are a few slides we have just put as a backdrop.
Move the slide, please.
Yeah, next slide, please. Yeah. Yeah, thanks. So,
No,
thanks.
it's okay. I'll pick it up.
Yeah. So basically, before we get into the topic of this fireside chat, which is interoperability and integration, and mainly from the data system, data point of view, and the mobile ecosystem. But before that, we get into a bit of what, where we are, and what we have, and what we need to do. We wanted to set the context, what we are seeing right now. So we are at the time where we are seeing a fundamental shift in healthcare delivery approach. So we are going away from treating the disease. We have been hearing this in today, this morning, and yesterday, that treating the illness is not enough. And we should be going away or thinking beyond healthcare and think about health. When we say health, health is for our population, not only when you fall sick or when our citizen or our population is sick or having any disease, rather than how to make sure that we make them healthy and keep them away from the healthcare system and make them healthy in our community. So this concept sounds quite easy, but when we are seeing this and trying to implement back in Singapore, the kind of data and information needs to exchange across the setting is like marvelous. Currently, maybe a few years ago, we were talking about integration and exchange of data and the standards, even in an acute setting. So department by department, and within our cluster, we have 3 acute hospitals, so exchange of the data from one hospital to another. But where we are today, dealing that fundamental shift of the whole healthcare delivery approach, we want to integrate the data not only from the healthcare setting, but even in the community setting. So, and then whole wearable things comes, and whole your lifestyle, the social determinants of health comes in picture, to able to know that when you might seek our help, or how do I make sure that I keep you healthy in the community and you don't need to come. So why I'm sharing like this, to just set the context and the scope and the amount of the data we need to integrate across the settings and the different kinds of data. Community data would be different than when you do a surgery in acute hospital, or when you take care of or do a rehabilitation in a step down. So this is just to set the context. There's one line we put it together and we discussed among ourselves for a few days, is that, but what is the goal? What is the goal? So basically, anything or whatever we are trying to do, we are basically trying to improve the health outcomes and improve the patient experience, and putting the patient in the center of anything and everything what we do. So just, this is like a set context where we are and what challenges we have in hand and what we are set out to deal with. So Vivek, over to you.
Thank you. I'm putting the slide only as a backdrop here, because I think everybody understands this whole information overload and the conundrum that comes out of that if it is not properly utilized. Now let me kind of bring in some contextual input here. So 2016-17, we started working with the second largest not-for-profit health provider in the US. We potentially were looking at maybe 52 hospitals, about 6.7 million patients being treated. But the issue was that, or the biggest problem they were facing was that when the patient moved out, having come for a particular condition, in all practical purposes, the hospital would potentially lose the continuity of care perspective as a part of that episodic intervention. And I think that continuity of care is a very interesting aspect, and maybe for whatever that we've heard this morning and from yesterday, a lot of what we are trying to influence is to is to focus on better health outcomes. Better health outcomes can never be done for one episodic intervention. They will always need to be carried through with the unification of data coming from various sources, whether it is genomics, as we discussed in the morning, or whether it is from the review of systems data that happens as a part of maybe your SOAP protocol that you use during your intervention at a clinic, and so on and so forth. Now, there are a lot of, so for example, if you see the progression is seen in such a way that we have built both an interpretation and contextualization through the ecosystem that we created. So we are talking about syntaxal correlation of health data across the various providers. Now, only thing that we face is that when we talk about that, are we seeing it universally being applied or utilized? And I think we're facing the challenge. I think one data very specifically states that especially between 2014 to 2019 in the US, the prevalence of the HIEs, while the enforcement to see if they should be adopted has increased, but in real purposes, only 4.5% increase has happened, which is apparently contributing to maybe just around net of data interchange of about 13x percentage. Now, if you look at this, what are we trying to do? We are trying to get back into the same situation of the patient comes for an episodic intervention, patient comes when they are sick, and the patient never comes to a facility when they really want to see if they can prevent a situation. Now, so the second part that is interesting that we've seen, especially from a perspective of evolution that we see now, so especially with genomics coming in, and we had the conversation around Dr. Ali's the metabolism and basically the cellular biology element that comes into play. I think one of the things that we have to, I think it's a proposition we put on the table, that we have the payer, provider, the pharma companies, the policymakers possibly, and obviously the patients in this room. Are we doing anything from this whole conundrum of information that we created, which is from a patient-centered standpoint? Because we do ICD codification from basically it's like a service catalog for the payer. So what do I pay for this disease type? We are never saying that, okay, how do we trace back this disease to where it emanated, and how do we ensure that we're able to kind of purge and not let it progress? Because it's not a commercially good situation to be in from a payer standpoint. From a provider standpoint, it is only information that we are collecting for that episode, because we are not looking at prevention. Because if we prevent, in all practical purpose, there's a commercial loss for me, because the patient will not come back to me if they are healthy, which in all practical purposes means that I'm losing money on it, right? And if you were to look at it from a pharma company's perspective, every time they come out with a new medicine or a new drug, it has to be commercially viable, because you spend 10 years, you spend $1 billion plus, and you need to make it commercially viable. Now, the option that we have on the table is we have this data. We have the data adoption happening. Even in a country like India, which in 2014 was about only less than 30% insured, to now almost 70%, 72% insured in terms of number of people who are insured either through government schemes or private sector. Is there a way that we can have a more cohesive payer, provider, policymaker collaboration driven on the principles of prevention? And when we do the principle of prevention, you can still keep your interests on commercial gains over a longer period of time, but you may not be able to see immediate benefits that you intend to kind of bring to the table. So I think that's a question that we have, and I potentially, Shikha, you have any thoughts on that you can actually bring up?
Yeah, so as Vivek rightly said, that the famous 5 Ps of health ecosystem, which is patient, provider, partners, as in pharmacists and medtech companies, policymaker, and payer. So when we are collecting data, exchanging data, or analyzing data, which perspective are we analyzing it from? So we all agree in principle that the entire healthcare or health should be from patient-centered approach and keeping patient in the center and thinking from the patient. But unfortunately, sometime our policy and the payment, all this does not support the ideal concept which we think is required and putting the patient in the center. So what we have done in Singapore, and as I'm a value-based healthcare practitioner and implementing this in one of the clusters in Singapore, the Ministry of Health has implemented capitation just last year. So with this capitation model, some of the things which Vivek was trying to mention is that why are we collecting data? So when I'm collecting data, I'm just collecting the services the patient has rendered during that episode because the provider has to claim, payer has to provide, and somebody has to analyze for that from different perspective. But in capitation, what in Singapore we aim to do is to move away from healthcare and think of health. So how ministry has this implemented, and we yet to see it, it's just been 1 year. We are still trying to see that how this new model of payment and the model of care will fare out for Singapore is each cluster is responsible for area of a Singapore. So Singapore is not very big. It's like 5-6 million people in an island. However, we have 3 clusters, which we have a positive competition. And every cluster is responsible for that area. So one cluster looks after east of Singapore, center, and another west. This is how we have done it. So in my cluster, we have to take care of 1 million of people, and we have to take care of entire west of Singapore. So when ministry is discussing with cluster and the management, what they are saying is that, oh, I'm going to give you this dollar amount for you to take care of your population. And I'm not going to reimburse based on the service. Or it's the same concept like in Singapore, we have a public insurance kind of framework. So ministry reimburses or gives a subsidy or amount of money for when we treat a patient. So now ministry has said, oh, the resource is finite and the kind of, the healthcare expenditure is increasing, I can't sustain it. So what I'm going to do is that you make your cluster efficient, you take care of your population, and I will give you this lump sum amount. And it's up to you where you pump this money. So you pump this money doing more surgery, more amputation for your diabetic foot, or you pump this money more downstream, even in community, doing screening and identifying, those diabetes which could get complicated in a few months' time and prevented, or delay the disease progression rather than, just keep on reacting. It is the old way of doing the healthcare. So what we are now doing is that we are doing multi-approach to make our healthcare efficient and make sure that we keep our people healthy in the community. So now healthcare is more than healthcare. We just don't do surgery and things. We go in the community and partner with pedicure salons and all to make sure that when the citizen goes to the salon and if he has any foot ulcer related symptoms and all that, then he gets identified and you catch those things well earlier rather than when it comes that where it's rotten and you need to cut and which is like a few $100,000 when you provide their services. So what I am trying and what I'm trying to share here is that, and which Vivek has rightly said, the data exchange, interoperability and all, we are quite advanced in technology. We have been talking about it. So the technology is not a deal breaker. The deal is about the policy and governance and the regulators coming in and setting the tone that what we are trying to preach and the payment, because the whole model revives that who has the dollar and how it's getting distributed and how it's getting different. So while our session is just about interoperability and interchange and exchange and standards, but the whole concept is maybe technology is not the deal breaker. We do have solutions and that's not a problem, but the question is that do we have a policy or regulation or the right payment model to make sure that the clusters or health data are getting exchanged in a right way for the benefit of improving health outcomes of our patient. So that's the whole thing we wanted to share with you or something.
So I think, interestingly, I just want to kind of bring up, sometimes, as they say, charity begins at home. You can also start fairly small here and see how you can influence it. So 2016-17 in India, we covered a population of close to about 400 million people. What we did there was, what we did was brought in 2 peers on the platform for what we call as a pre-authorization adjudication of a claim. We brought in a set of wellness centers and we codified the wellness center services so as for them to correlate and say that this service potentially may lead to, say, a ICD code which is, say, on cardiology or diabetology or so whatever the case may be. So we did a correlation between a typical cellular-based or alternative medicine-based approach as an input for a patient or as an input for an individual. I won't call it patient because the person at that point in time is still not expressing any symptoms for a disease. But maybe looking at, say, coming to us from a perspective of, say, mindful living or wellness services and so on and so forth. And then trying to see if there is a possibility for us to start mapping that into pure ICD codification from an aspect of maintaining the data. So we brought in like you may call it like a transformation engine or a mapper, which was potentially trying to do this correlation. We started getting a lot of information about patients' lifestyle and so on and so forth prior to recommending a particular wellness program or a plan for them. So we brought in like you may call it the equivalent of a data master or a library for doing that mapping. And then we extended it further, stating that when you move from that state to some other state, we should be able to provide you a platform to interface with the right healthcare practitioner. So your choice of the right healthcare practitioner is not done through the process of a PCP, like a primary care physician, but is done through the process of what is your cellular inability that you're showing before you kind of come to maybe the treatment setup. So we changed the dimension from going to a PCP and then getting diagnosed with an issue to instead going to a wellness center and identifying what are the issues that you may have. And therefore, I think one of the things we started trying to do was, can we integrate some of the old alternative techniques, like, for example, Ayurveda or Unani, or for that matter, input coming from general soulful living wellness practitioners, and see how that can be codified into pure play medical data set. This is through a third-party independent platform, which was aggregating these services. And we then also tied it back to a peer and said that from a peer standpoint, instead of penalizing a person for giving that initial data for increasing their premiums, because finally you underwrite and you put a premium on that based on the risk profile that you've created, to saying that can you come at a stage earlier on and start looking at some programs for preventive healthcare or preventive coverage, where you are potentially only paying for the purpose of keeping the person healthy, not for the purpose of ensuring that the person is diseased and therefore you pay for the disease, right? And this has been a very interesting play for us. We were able to cover in the initial set. We started with at that point in time it was Andhra Pradesh, now it's Telangana. So basically we started from the Andhra Pradesh Telangana space, almost close to about 4 million people. 40 million people, and then we started going to some of the other regions in the country, and we started expanding it there. And when we took this program out to maybe, for example, countries like Azerbaijan or countries like now we are doing some work in Colombia and Brazil, where we have taken it to the next step, and we're saying that okay, one is the preventive element, and second is the continuity of care element through the caregiver intervention. Because a lot of times the caregiver intervention becomes also very important, because it is those people who personally interact with you after you are out of the hospital. And therefore, how do you still continue to get the right kind of information set to ensure that you're able to maintain the patient's health? Now, all this basically was leading us to, at any point of time, so like we've kind of done some, we keep a track of what we call as a set of entities. And we said that at any point of time, one single patient interaction from a wellness, soulful living analysis, all the way up to maybe, for example, if it is acute and post-acute recovery process, we were getting per patient at any point in time during maybe that, maybe whatever, it could be say a 2 years or 3 years period, over 1 billion data sets for that particular individual. And obviously, this is a very beautiful construct. If we start addressing the whole aspect of genomics now to it, suddenly the richness of data that you're talking about here will be an absolutely different level of play that we look at. And I think that's where maybe next topic that we should look at some point in time is, we've spoken about it, is we talk about generative AI and things on that nature. I believe the topic has to be driven, because generative AI normally, and I think we were having this conversation with Shikha yesterday, that a lot of times this information is engineer-driven and not practitioner-driven. Now imagine that you're able to give this information and a practitioner does the supervised learning, or rather basically enforces supervised learning for the machine, which we may call as a closed language model, for the machines to do a much better prediction. And I think maybe with that, I would want Shikha to add a few points on that, and then we'll open it for you for any question that you may have for us.
Thanks, Vivek. So yes, we were discussing about that in IT, it's a garbage in, garbage out. And sometime our data scientists and our clinicians don't speak on same languages or taxonomy. So one is talking about the wholly subject matter expertise and trying to understand how the vitals have played the role. And another is just trying to put the different types of data. Oh, let's try age, let's try Charlson comorbidity, let's try frailty, without really understanding that why are we adding that in analyzing diabetes disease progression or stroke or dementia. So this kind of things which I am seeing in my organization, that there is a bit of data exchange standard issues, and sometimes it requires a detailed discussion, and often clinicians may not have the time, bandwidth to sit with our data scientists to sit together and get it through. So that a bit here, that can be sorted out, but that's one of the things we wanted to also highlight, that in IT is garbage in, garbage out. If you don't really get the right standard, clean data, accurate data, complete data, then the whole thing may not turn out the way you want it to turn out. Another, before we open for the questions, another point I wanted to highlight is that because the goal, when we put it down, the goal is about, at the end, we want to improve the health outcomes of the patient. So when we say outcomes, there are two perspectives. One is the clinician way of looking at the outcomes. When a clinician treats a stroke patient, then what's he thinks is the good quality. Oh, my door to puncture time, my door to groin time, and this and that is looking at that. But from patient's point of view, maybe patients are looking at the functionality related, whether how, after a post-stroke event, how well I am going back to work if I am in the working force or society, what is my reported outcome? So sometime when we are talking about interchange and exchange and interoperability of data, we also have to see that there are few is the patient-reported outcomes. And these data needs to be integrated in our system too. And a proper standard. So currently we are we do have some standards. We have iCharms and we have some of the standards to collect it. But this could be quite different based on the settings. And how do we integrate in the longitudinal view of that patient across the episodes, across the settings, and make sense out of it. So these are some of the burning questions we still are dealing with. We didn't come up with a proper solution to share anything with you, but we are just highlighting some of the things which are on the table for us to consider and discuss.
Thanks. And I think we said that, okay, obviously everybody is in for some kind of a commercial gain. So I think as we go forward, maybe when we look at, say, a pharma manufacturer or pharma R&D entity, obviously they are expecting a better outcome of the NME that they have put on the market, and how do they get the value out of that, and so on and so forth. Similarly, it's a payer wants to ensure that they get they service the minimum amount of claims so as to be profitable, as the case in point. All the dimensions are a little contradictory from a patient standpoint, with patients looking for full coverage, good health, and so on and so forth. Sometimes I think maybe it's a good point, and if you think it is a viable point, maybe we should form, as an output of this conversation, some kind of a small working group for whoever is interested to start working and seeing if can we influence the policymakers, can we influence the ecosystem. And maybe next year, maybe if we come, or should we come here, or maybe whatever point of time, we should kind of come and say, okay, yes, we've been able to start the process of ICD coding for wellness and mindfulness living services, or neurological disorders, and so on. So we kind of start bringing those to the table and say, okay, yes, we started influencing the industry. And I know it will not be a one-year program, it will be a longer program, but it is a program which requires all the 5 Ps to collaborate, or at least all the 4 Ps to collaborate from a benefit of a patient for a better wellness. I think I'll leave that point here. Any questions, we'll be glad to address.
Thank you very much for this conversation, very nice. I just want to put some thoughts on the ICD regulatories and whatever we are trying to diagnose a person and bringing in that particular code for maybe the insurance purposes or whatever the thing is. What I think is, after this COVID has started, we need to consider COVID. It should come into the center point, because what is happening now is everybody is following the old methods of diagnosis. Everybody is trying to put the current patient into some of these coding. And it is not fitting, because the diagnosis is now differential diagnosis. It cannot fit into that. And moreover, clinicians are trying to fit the person into that coding and trying to give the treatment according to that diagnosis, which is not helping anyone. So what we are seeing now, so there are a lot of my own patients who don't fit into any of these criteria. So I think ICD and all of these regulators which were there before COVID, I think they need some, rethinking of these, as how we will redefine all of this coding. I think so. Yeah.
A very, very good point. I think that's why I was mentioning that maybe we have to expand the vocabulary of ICD, because it is still very restricted and still very payer-centric in nature.
So I'm not a practitioner, I'm not a doctor, but I work very closely with them. So in our system, we do have few ways of coding. So we do have problem list, which is SNOMED, which is for doctors to code. And ICD is often coded by generally same purpose, because insurance. And COVID does figure as one of the problem list. And when we code for the patient, this is practical knowledge I'm sharing. I'm not really coding, but this is how I have analyzed the data. One patient could have one primary and few secondary SNOMED and ICD codes. So having said that, when the COVID comes in picture, COVID is being coded as one of the comorbidity, if that is the comorbidity, not the primary diagnosis. So you could come for heart attack, and then the swab is done, and you will be COVID positive, and then you are diabetic, and then you have hypertension. So these all will be coded together. And that's how, at the end, we also calculate Charlson Comorbidity Index. So saying that where do we stratify the patient? So a healthy stroke 40-year-old is very different from a 70-year stroke, which has, the patient has hypertension, diabetes. So there are ways, and these are some of the ways we handle these things. And in addition, we also pump in the discharge summary, which is the doctor's notes, and we put the pathology, we put everything to come up with a very complicated model to see that how to stratify the patient, which risk category the patient falls in. So these are some of the ways we are trying to tackle
So
the
I think
existing issues.
one interesting point, if you were to consider, so all of us who read chemistry read about the periodic tables. There are finite set of elements we see there, but it's a combination of them is what leads to maybe a what you may call as a complex what do you call an entity. So essentially that's where I think for us also when we started doing, so in India we are taught, when as a medical science student we are taught SOAP principles for going through the process of analyzing a condition a patient may have, but we finally end up looking at only the chief complaint. The CC becomes our primary anchor. And the second element is the review of systems is limited only to general complaints or musculoskeletal or maybe for that gastrointestinal. Now, what happens is you have to extend it beyond this to other elements like cellular health itself, because now a lot of people are talking about mitochondria dysfunctional and fatigue syndromes and so on, so coming especially after COVID. So I think what we should ideally be doing is if we can maybe form a group and create what we may call as the elements of the disease, so basically our periodic table, and then do a proposition back, I think it becomes a industry taking part in driving the policy, rather than maybe waiting for the policy to happen to get that thing. That's how we kind of tried to solve that issue when we were still not, India still didn't have a health information exchange. India still did, at that point of time, 2014-15 time frame I'm talking about. And it still didn't have, it still had a very undercovered, insured population. We were still trying to solve this issue as a startup. So I think there is a way that we can influence the policymakers, and I think maybe if collectively we are able to take up one small initiative of this nature from this group, I think we would have achieved something out of this conference beyond exchanging ideas. Thank you.
Thank you, sir. One small question, one line to add up whatever ma'am mentioned. Actually, I'm a certified coder and auditor, so I can add some inputs to you. So as madam very well mentioned on it, yes, ICD code is periodically updated. So every year we have set of ICD codes included and deleted and also updated. So 2024, we have updated CPT code list for the procedures, and also in October we have ICD-10 codes. And as doctor said, for sure, all these COVID conditions and the complications of the COVID and even the new diseases which is arising in the healthcare, it also included in the ICD-10 codes. And already the problem is in a developing country like India, we have not yet reached that level as US. And here also in UAE, the same happens. US is very advanced and they are with the current practice of 2024, but in UAE, we are not following that 2000 code sets, and also in India also we are not following that much advanced thing. So I think these lack or gaps should be filled, so they should be doctors answered, I think, the question to the doctor's answer. So hopefully in future, these gaps will be filled, and we will be on the same advanced stage. Thank you.
So just one point, that there is a history behind why US is extensively or overcoding. Don't quote me, but this is my experience. And in India, we don't care, or it's okay. Singapore, we are just right coding because the finances are driven by that. The whole idea why we are coding is to get the reimbursement. So in US, the payers will pay you based on the codes. So the service provider will make sure that they put all your comorbidities, everything very rightfully to get the insurance money. But maybe in India, I have not worked, so I'm not sure. But in Singapore, there is an audit and we do it right, also because our ministry pays it, and the coders are deployed by the Ministry of Health to all the public healthcare institutions to make sure the coding is right, not over, not under.
So I think the difference, if you see it from a granularity of coding, you see maybe about 11,000 odd codes in India. You see about 97, 98,000 codes in the US. The reason is primarily that. The only thing is now in India, because we are trying to drive through the universal health coverage, a coverage of a minimum amount for all individuals in, especially the underserved individuals in the country. You'll see something very similar happening, but obviously what we're trying to distinguish is, like in the European system, where you have to wait for so many months to get your first appointment and maybe there's your test and so on and so forth done. We are trying to still see how we can be nimble enough to get those things done, do a right merge of what you may call as out of pocket to maybe the payer's contribution, so as to ensure that healthcare for our patient becomes more centric rather than maybe driven by the payer or driven by maybe any other entity. So I think at least we're seeing the right trends. We just hope the speed of acceleration is good enough for us to maybe reach a state of like a larger coverage set.
I think time's up. Maxim, we have one more question. Can we take it, or?
I'm sorry?
We have one more question.
We have to wrap it up.
Okay. So I think I'll come to you, sir. Yeah. Okay. Thank you.
All right, a round of applause for our speakers. Don't go anywhere. Go stand over there. I need a photo. Yes, we need photos of all our lovely speakers. Yes, big smiles. Fantastic. Now, in the world of public health, mentorship and networking stand as pillars that support the growth and development for future leaders. These elements create a nurturing environment where emerging professionals can gain insights, acquire skills, and connect with established figures in the field. So, our next panel discussion has the topic of mentorship and networking, fostering growth and development for future public health leaders. Our moderator for this session is, I'm going to be welcoming back to the stage from yesterday, Dr. Osama Kandelaft, alongside his panelists of Tony Sorensen, Dr. Basma Khandura, Katrin Vayar, and Dr. Sunil Reddy Bondapanu. Put your hands together for this panel.
Thanks so much. Appreciate it. Hi, everyone. Good to see everyone again today. So we have an incredible panel, incredible group of people here today to talk about, networking, mentorship, what that means to kind of establish yourself at least within a particular field, but also how to develop a particular idea, network, connect, and grow future leaders within the spaces that we are specialized in. So we're actually just going to start off with introducing, our first panelists as well. Dr. Sunil, if you want to just take it away, introduce yourself, and we'll move down the line.
Good morning, everyone. My name is Dr. Sunil Reddy. I am founder and CEO of New Shift Technologies, where we build a unified healthcare platform where all the healthcare stakeholders is going to connect, collaborate, and engage with the patients for building a stronger community towards the better patient care.
Hi, my name is Katrin Weyer. I'm the founder and CEO of Provalea practices, which are practices for speech, learning, and occupational therapy, and I come from Germany.
Hello, everyone. Good morning. My name is Basma Khandura. I'm a dentist by profession. I'm also a general manager within the Business Partnerships Executive Department within the Saudi Commission for Health Specialties. I come from Saudi Arabia.
Marhaba. Hello, everybody. My name is Tony Sorensen. I came from a medicine background, working my life towards life science, not really liking what I saw, and I decided to start my own business. So I'm the founder of 75 Pharma, which is a really seriously impact-driven pharmaceutical company, and I'm really pleased to be here.
And I'm Dr. Osama Kandelaft. I'm a medical professional, primary care professional up in the United States, an assistant professor in internal medicine as well, starting my own qualitative and more holistically focused medical clinic out here in the UAE, kind of returning back home. I'm from the Middle East myself. So, I mean, we have, again, a highly distilled, version of what everybody's done so far. But I mean, like our Zoom talk, the first one that we all jumped on, took maybe about like an hour and a half, actually just sitting and exploring everybody's history. So, I mean, like this 1 to 2 minute discussion in terms of, who everybody is just this incredibly distilled form. And hopefully we can kind of glean some experiences from you guys just in your fields of specialty and how they all interconnect. I think just to kind of start off, the idea behind building a future leader starts off with kind of understanding who we are in general, what our goals are, what our purpose is, what impact we want to really drive in the community that we are focused on. So just going to open it up and guys jump on in. I mean, I may even start with Katrin and Dr. Sunil as well, just with your experiences being within rigid organizations and structures. How has that affected your goal and purpose in terms of?
Yeah, there is a clear divide between senior, junior, and early stage practitioners. So there is a structured format where we can't access the main chief consultant because they can't openly ask the question. I feel there is a need to transform that into like, let's make it more open between all the stakeholders.
Yeah, I think I will start with an issue in my country. So we have a huge lack of young professionals in speech and occupational therapy, which is really bad because we want to provide good therapy to our patients who are really in need. So I think, as you said, we have to start with ourselves. Being good leaders, and what does it mean? So for me, it also means to have a purpose at first, to have a vision, but also to give the opportunity to to the employees to build up their own purpose and vision to provide good therapy. I think only happy therapists can provide good therapy. And because of that problem that we have with gaining new or young professionals, I think it's also very important to have a good mentorship system. For example, we're doing a method or a concept to onboard new employees, like an onboarding system also for therapists, and to guide young professionals through the profession. When you start working, you need a helping hand and guidance.
And that mentorship system, comes in at least through that guidance, when somebody's first starting off.
Yeah, right.
Yeah, to have that mentorship that really guides you through that rigid structure and system to see how things develop from start to finish within the institution that we have. Dr. Sunil, from your experience as well, talking about internship through residency forward into consultancy, that's kind of what that structure is.
From my internship and through my graduation and early experience, we were able to connect and engage with peers, but seriously, it was very difficult to go on the top. We can't access them for mentorship, or we can't ask directly. Because there is a barrier which is there where we can only talk about basic principles and everything. But I really feel from bottom of my heart it has to be changed. We need to be more open, where we can connect to anybody, where we can ask people for a mentorship. Because mentorship, we need to seek expertise, we need to seek excellence, and we need to seek the collaboration. So that is where I feel there is a need.
Can I jump in?
Yeah,
so I'm just thinking from the mentorship perspective that it's really super important also to discuss how an organization adopts mentorship. And I think it should be viewed from a non-silo perspective. So you don't have a mentorship from the top just sending signals down. You need different stages and different parts of the organization adopting that as well.
My perspective is mentorship is you can travel along with them. It is not like somebody knows better or somebody knows less. like everybody knows everything, but mentorship is about way to act upon, when is the right time to act upon, and what is the right action. Like it helps us to measure the action. Like knowledge is what we know. Mentorship, where we need to apply. Mentorship is all about action, where we need to apply that. So that is missing in our culture.
Being a dentist by profession as well as a general manager in both the government and private sector, I had the opportunity of working in a micro level industry and then moving up towards the macro level industry where things are more on a strategic level, and that gave me the opportunity to see the differences between those two levels and how implementation of mentorship, leadership, and so on is important throughout the levels, starting from the macro all the way up to the micro level. Another perspective is that part of my work is knowledge sharing and international relationships and collaborations. Having said that, it is not just within the healthcare. We are actually by just looking at healthcare, we are limiting ourselves. Part of the innovation is actually looking at other industries and how they do it. So for example, the gas industry and the petroleum industry have a washing machine, so to speak, where they put people into rigorous leadership and mentorship programs. No one goes around without having those skills being developed, just the way they are developed in their hard skills, which is the healthcare aspect of it. They are as well developed in their soft skills. So they have coaches, they have all that kind of training. Otherwise, they don't go up the ladder and excel in their work. So that's also something that I think we should keep into consideration and look at, not to limit ourselves into the innovation of healthcare, but actually enjoying this opportunity right now where we have other conferences going on and learning from them, whether it's education, CXO, and so on.
I'm with you. I think just the first starting point for anybody who comes in wanting to do a particular goal, at least my own personal example of wanting to do medicine, the base knowledge is probably the most important aspect to it, learning and getting that experiential build-up, having those people guide you through up until you can start to see the cracks and deficits within the system that you're working in. And through that, obviously collaborating with people that are inside your immediate circle. We tend to do that, at least as providers, practitioners. We stick in with other providers, practitioners, and learn some bits from them here and there. But in talking with somebody from pharmaceutical, talking to somebody who does international relationships, looks at industries like the oil industry, even though you have the MD behind your name as well, somebody working in speech occupational therapy, but also expanding that opportunity to speech pathologists and occupational therapists, and similarly with yourself, Dr. Sunil. So that starts to build up, I think, through particular mentorship. I wonder.
But there's one other point, if I may, is that we should always, also going back to the micro to macro level, I found that if you want people to actually do their best, they have to understand the vision, where they're going, and believe in it. So part of the leadership and mentorship is actually as your role as a leader or a mentor within your organizations. You have to, is basically letting the people who are your team understand the vision, believe in it, and work hard. And trust me, they will work very hard to getting to that goal. Coming from a country who is doing a whole transformation in so many aspects, including healthcare, where they want to transform the healthcare by 2030. I am telling you, where we are right now, since 2016 until now, all the accomplishments that Saudi Arabia have done and more is because people actually believe in that vision and work hard to get there. They wholeheartedly believe in it. That is key.
So can I ask, what is it that you guys see as, how do you achieve that mental or that moral goal, that moral compass? How do you align it to be able to, or how do you communicate that to people who you interact with, to say, how do you find that moral compass to guide you into that right direction?
It has a lot to do with your emotional intelligence and knowing your team, knowing how to get to them. Some people react perfectly and amazingly with benefits. Some actually no. They react in another way. But as I said, believing in that goal would actually give a kick to going the extra mile to get there. Talking to them from a patriotic perspective, from a better future for not just this generation, the one after and the one after and the one after, finding better healthcare for your children, your grandparents, and so on. Talking to that culture and knowing how to talk to that culture is key. And I'm sure being diverse and international, you all know the keys to your own people and your own culture. But from my perspective and what I've noticed going through my work as international collaboration and strategic relationships, I found that we are more similar. We are so much more similar than diverse. We have, like, the values go in the same direction in almost all countries and all cultures.
There's one of my mentors, back from when I moved from Ireland over to the States, who told me, if it is good, if it feels good, then it is good. As in, if the intention is altruistic and good, then it is good, as the most distilled form. Tony, you've had a fairly unique experience, at least in this space as well, which, if you feel comfortable sharing, would love to hear your perspective on it too, or to share with the...
Yeah, I think there's a huge challenge in terms of the mentorship, especially since you mentioned transformation processes, and I know this firsthand very well, that I've been working in life science for some time, trying to adopt new business practices into life science, which has been completely static, not open for dynamic, not open for change, which I think is sad. But I want to end this comment with a really positive note that things are changing. So transformational process, especially in large organizations, are extremely challenging. And we see this because from an executive level, we have people looking at quarterly reports. They are looking at the metrics of the financials, and you don't actually measure the success of a company through the eyes of altruism, mentorship. So I think that, what we see is the kids, the future executives, they have a completely different view of this. They don't have at all the same finite mindset of ruling the world through a company and the quarterly reports. They have a completely open-minded view, and they can see that what we're doing is so goddamn unsustainable. Forget the language. So the change is definitely coming. And I just want to say a last thing in terms of the mentorship, that in terms of business practices, why don't just adopt this as like the normal standard, right? Into your standard operating procedures, into your quality management systems. Why just don't, just adopt a mentorship program? That would be amazing. Everybody should do that.
It's the plight of every single organization, company that's out there, is the P&L sheet, your balance sheet, the profit and losses.
Exactly.
That's it. So anybody who's ever within that leadership role at the top of the pyramid has difficulty looking all the way down at the ground level. I think, at least from professional standpoints, at least something that I like to impart to my students who work with me over in the clinics is start from the ground level, get dirty and get in the business itself, right on the ground level. Know what it's like for the worst person within the job and role, and build yourself up from that. Keep that focus on that goal and maintain the quality in and through from top bottom. But
if I may, there's also a lesson that I learned as a mom, is that this is a lesson that you learn how to talk to your kids, but I've noticed that it actually works talking to everyone. Like giving people total autonomy trusting their voices and listening to them is key for them to trust you back and believe in what you're saying. So if you're a leader who does not listen to anyone else's voice but themselves, people are just know that people are just there for their paycheck at the end of the day and not for the system or for the better good. And then later on, when something happens and you need people staying up until 5, 6 a.m. in the morning since the day before because something is up, you will find people not being able to because it's not their cause.
Yeah, I would like to add something to that because sometimes I think methods or how we work, our working structures our management is so complicated, like on a high level, and sometimes you only need to ask your team, how are you, how do you feel, to talk with people, and as you said, how do you communicate? I think that's a pretty tough topic, like internal communication. There are a lot of methods, systems, and yeah, but you really need to integrate those structures inside of your company, and yeah, it doesn't matter if you have a practice or some other companies.
It's a one-dimensional space that we're looking at. If you're looking only at the sheet itself, it's one
Yeah,
dimension.
right. Yes.
It's similar to how patients present. Sometimes, some patients, and I'm speaking about myself here, when you come into the clinic, I don't really want to know what my cholesterol level is. I don't really care to know right now, so I'm just not going to check it. It's that fear as well of going in and saying, hi, how are you doing? How is the work?
Yeah.
How are things going there?
But there's always a person in the so you are a leader because of how you are, not just because of the position you are in. So there are a lot of people who are true leaders within the community, and you will see them in your teams. You'll see someone, one or two, that everyone listens to, everyone loves, everyone trusts, even though they have no title to them, because of the way they act, because people trust them, trust their knowledge, their sight, and they know that they have their best intentions to heart. So what I'm saying is, be that leader, even though whether you have the title to be one or not. Just trust me. The biggest asset you have are the people who are working with you, not the money, not the financial assets, as much as the people who are helping you build that, whether from a governmental level or a private level.
And I think this is a very important aspect, because you have to empower your team, you know, because we talked about purpose and vision. You have to give them the opportunity to think about the purpose and the vision for their lives and also for work, to give the opportunity to combine those two aspects.
And that gives them the answer to the question, what's in it for me?
And also for the young generation, I guess, what you just said, because they have a different mindset.
Absolutely.
Sometimes a better one.
Yeah, there's actually, I've done a lot of stats. I've seen a lot of stats on that. And just the way that has increased since the last 5 years is just insane. You know, just the way as patients or as consumers, if it's regarding healthcare or the pharma industry, they have different metrics, they have different KPIs, they are looking at it completely differently. And the stats are showing that, for example, if a company does not do, might be a private company in health or life science, doesn't matter. If a company doesn't commit to transforming to a more ethical and sustainable and moral business model, they are actually, these consumers or these patients who will be the next generation of consumers for pharmaceuticals or for seeking private health care, they will simply choose not to go there because they don't reason with the brand or they don't reason how the company is being run. And there are new clear stats about that, proving that if you're not in the business to do the change now, then you're out. In 10 years, you're out, you're done.
I think one of the biggest things as well in relation to this is setting expectations early. You know, heading into
Absolutely.
heading into medicine, you know, you're a medical student or you're even pre-med over in the States, you have this idea of what a physician is meant to be, a Grey's Anatomy type show. You're going to find your great love over in the hospital, you're going to do CPR 5 times a day, and you're going to be amazing and come home and whatever, the craziness that happens on this TV show. So like setting expectations very early on as well to say, you know what, currently how the system is you are going to grind. It will be difficult. You will get through to particular aspects where you can sometimes question, is this worth the work that you do? But setting those expectations early, in my mind's eye, helps build up a resilience as number one, understanding your capability, your deficits, your positives, but then also for the next rung, how do I impact change within the system that I'm in based on those expectations and seeing them for myself early on?
I think for that, also, again, networking is so important. Yeah, we talked about it earlier. It's so necessary to exchange knowledge, to look across borders and countries, also generations. And yeah, also when it comes to mentorship, as you said, the new generation has another intention, or maybe they are more close to themselves. Like sometimes it feels, or I have the impression that they have already a purpose and a vision, more not in a working way, but in a life way, which is pretty good. And vice versa, it's very good to have experienced professions. You know, for example, I took over one practice from very experienced speech pathologists, and we did it in a way that they are retiring step by step, like over a few years. So now we have got the chance to keep the knowledge inside of the practice and also give experience and that knowledge to the younger therapists, but they can also give, something new, inspiring aspects from therapy or just the thinking-wise to the experienced professions. So I really love that.
I feel networking is the inherent need of everyone. That's why we are all here. I think everybody would agree that. So I feel networking, like we need to understand, it helps in knowing the people better. There are different perspectives, like there is no right perspective and wrong perspective, but we need to understand the different perspectives which are available. So networking creates that platform to understand the different perspective, which will inherently enhance our knowledge and our potential capabilities, and where exactly we can collaborate our strategic partner. Like it will create that opportunity. But it is an inherent need which will expand our thought process and where we will know different perspectives.
Yeah, absolutely. That also takes a bit of personal vulnerability to understand what I know and what I don't know, and to be comfortable to say, you know what, I don't know about this at all.
Yeah.
I'm going to ask you a question. Hi, you know, how are we doing?
Or how can we both find a solution?
Yes.
That's
But
so true.
this is a real expert for me, and also being a leader, to be vulnerable and to just be honest, you know?
I can definitely relate, and I agree with you all. And I think in terms of sending off job descriptions, that's one thing. It doesn't really resemble reality, neither does the CV of the people who are applying. So I've been sitting with a few people, and the first thing that I say that, please tell me when you don't understand, when you don't know anything, because you can assume that you're not the only one, and that shows trust. So I always tell them this statement that be comfortable enough to be uncomfortable.
Yes.
That's a really important thing to understand, that you need to feel safe in your environment. As a leader, you need to promote a culture where the people you're working with feel safe enough to tell you when they're not safe and they're not comfortable.
So we're kind of wrapping up slowly. We have about 3 minutes left at the moment. I kind of wanted to take the words from Tony's mouth during our last Zoom meeting to become an impact ambassador, right?
Right,
Yes.
yeah.
So what are your...
Self-proclaimed title.
So
We're
just to
all
open it up to
jumping
us.
into that
Exactly.
train.
Onto that role right now. So I guess like each one of us, if you can give one impact statement, one statement that you would impart to a mentee, to somebody who, you know, is
I would
communicating with you and
say
engaging with you.
the number one impact which we can make is better patient care outcomes. So when the networking is there, when like together as a community, we can be bigger and more impactful towards the patient care, like quality care, value-based care, you can name it anything, but it is the best outcome.
Focus on the quality.
So that is the
Yeah.
outcome we are going to get.
Yes.
Okay, yeah, one takeaway message. This is pretty tough. But yeah, for me, I would say it's the creation of a purpose and a vision that's a combination of an individual goal and also a working goal, and to combine those aspects and to give the opportunity to the team.
I'll try to sum it up. So I would say, don't wait for a role. Just be the impact, be the change, be the leader you wish you had if you don't have one. And trust yourself and know that everything is figure-outable. Like, that's a motto in my life. Everything is figure-outable. Just do what I just did and go in and dig in, and you will find the solutions, and you will excel some way or another. If you are determined enough, you will find it.
Wow, I have so much to say that I'm shaking over here.
I tried to sum it up.
I'm going to actually just build on something that you said about trusting yourself. And I think that we all have scars. We all have negative experiences that has been challenging and that has, to some extent, colored us. And it sort of puts a gray veil over decision-making sometimes. And I think that when you can identify what your fears are in terms of decision-making, and when you can choose to ignore them, what is left is your intuition. And I always make business decisions on my gut. People think I'm crazy. That has served me well up to date. And I think trust your instincts. Always trust your instincts. When you can separate them from your scars and your fears.
There's a lot to follow, yeah. You know, mine would be know yourself. When you know yourself, any challenge that's ahead is not insurmountable. Be brave to take risks, especially if it's aligned with your moral compass. If this is the direction that you know you need to go to do good and impact the world in a different way, in a better way, be brave, be confident, be powerful within it.
Can I finish with a quote? Yeah. Steve Jobs said before he died in a long statement, and the last part of that is a quote that I like, and it says, "The people who are crazy enough to think that they can change the world are the ones that actually do."
They're also called impact. What was it?
Yeah.
Impact
Ambassador.
ambassadors.
Impact ambassador. I don't know if we have some time for questions, but if anybody wanted to jump up, throw out a couple of comments. If somebody has their own impact statement that they just want to yell out right now, literally just stand up, go for it. Any hands
We blew
up?
them away. They're
So
completely...
we made everything very clear.
When we talk about leadership, mentorship, and whatever, if you have the idea which is unconventional, that comes into innovation. It's very, very difficult that people will believe in it. And one has to struggle one has to establish that innovation. And that particular patch, it might take the whole life of that person. But then the established idea will be taken over another decades, another few generations. And as now we do that, we think of what Edison had done, what all of these researchers had done, and we are carrying the same ideas now. And in that particular patch, if someone has read the autobiography of all of these persons, you will understand that everybody has suffered a lot when they were doing these innovations. But then believing oneself is very, very important. There will be more odds in this patch. But then if you stick to that idea and if you continue with that, one day success is there. And what I have been doing in my unconventional innovation, it's a patch of 2 decades, and now I have come up to that patch where people have started believing that. And everything which I did, it was all self-funding which I did, and I'm going to talk about it in my leadership award, what I have done. But then the thing is what you were discussing about mentoring. So one has to become a mentor of oneself. When you have something unconventional to give the persons to be, for the better world or better outcome in the world. So there are more odds than events. But then if you just conquer those, yes, success is definitely
100%. I mean, to jump on that as well, thank you for the comment, by the way. Knowing yourself, knowing your expertise, this is a term that's it has a negative connotation in with it at least, ego. The narcissist, the egotistical, etc. You're very self-absorbed within your idea, etc. Ego is necessary for people who do want to build, not in the negative connotation, in the sense that I have enough confidence in my expertise, my skill set, and the moral compass of what I'm trying to do that I can still persist despite the scars, the insults, the challenges, the failures, the many, many, many failures that come through. I think everybody in this room has scars and challenges of what they've experienced throughout their entire career. It's not uncommon. The difficulty is continuing to push past those challenges, those obstacles, those roadblocks. And again, if the concept, the idea, the purpose is good, we're able to drive through that. People pick up on those intuitions, not just the verbal ones, but also the non-verbal attitudes about all of us. Sorry.
Yeah. Thank you very much. You see, the healthcare is a very complex system, and having to deal with, and there are different stakeholders, and having to deal with different people, different specialties, makes it even more complex. And what even makes it more problematic is that the professionals in the healthcare have to go through the structured training where they have to go through from 0 level to the more advanced levels. So and in healthcare, you don't have lots of chances to make mistakes. So see, I think what makes or what would make it easy to make health leaders in the healthcare is to have a very structured programs for everybody. And in these structured programs, you have to have some curriculum about the healthcare leaders building, and having or supervising them through the 4 years or 5 years journey of training. That would make it like a slow process, and by the end of this process, hopefully they would reach a stage where they're mature enough. They would have learned from the 4 or 5 years because they were allowed to ask questions and to consult people, but again, not make mistakes. So I think in the healthcare, having structured programs, training programs would really help create future leaders. Thank you.
That's a really good point. Sorry, forgive me. Just quickly. So I think that what you mentioned is I'm walking away from life science now thinking from the clinical perspective. So I mean, we see this all the time, but there's also a huge benefit in the shift to generation, because the previous physicians, they were thinking from healthcare from a more dualistic perspective. You know, you have psyche, you have soma, and the natural transition away from dualistic perspective towards the younger generation of clinical physicians also makes you more coherent and, you know, towards the culture of the organization and so on. Please.
I only wanted to add that what sometimes for me, our system, you know, not healthcare is very complex, and I think in every country it's totally different, our healthcare systems. But what makes it sometimes different for us is that we are actually practitioners, like we have to treat patients, and it's so tough in real working life to communicate, to add some management structures and stuff like that, to, you know, to deal with all those problems with how to deal with the next generation, what to do if we have a lack of young professionals or whatever. So I think this is also...
The organized framework is, and I think at least with medicine, it's one of the only structures that we have in play other than a couple of other fields out there, where you have this playpen to an extent to really kind of experiment with the theoretical skill that you've learned in med school. You learn everything on paper. You have no mental image and visualization of what you're actively sitting in front of and working with. You need to build that own mental script and visualization of what that is. Medicine is one of the only fields where you actually have that internship and playpen, ability to make mistakes, you know? I think integrating that into other aspects of the space, the commercial space, the legal space, education space, etc., giving that mentorship and apprenticeship opportunity for people to learn and to build up, make those mistakes, therefore have a better understanding when they're in physical applicability of it.
For that, you really need a trustful environment, you know, what you said.
Building on that, a lot of the medical schools are actually building in leadership programs within their curriculum for students, whether they are whatever field in the medicine they are in, because it actually helps them to identify the soft skills needed to lead, because it takes more than just understanding the medicine itself. It takes a lot of emotional intelligence, it takes a lot of communication, business intelligence, and much, much more. So, yeah, I think there's a big hope for the future.
I would love to give the opportunity for one more question, but she's staring me down as well. Is it a quick one?
One more.
Just a quick one. To Tony. Tony, you mentioned about scars in business. Could you give an example of one of the scars?
Can you come a little bit closer, please?
Could you give an example of one of the scars you've maybe had in business and what you either did about it or perhaps are dealing with it currently?
Whoa, that's sensitive. Thank you for that. I'm not going to buy you dinner tonight, so. No, seriously, I mean, the one thing for myself is to understanding. I was speaking before about intuition, and I'm referring to trusting yourself, but also allowing you to make mistakes in your judgment. That is really important, because we don't make the right calls all the time. I mean, which comes into, sort of if you have, sort of the Stone Age metrics of a winner or a loser, or how you define yourself from making mistakes. And I think that's a really important issue that, you should, the only persons who succeed are those who are committed enough. They fail like hell. They just get up again and again and again.
Make it your hobby.
Yeah, exactly. And I've had an experience in my recent company with some of the shareholders that they broke my heart because they strayed away from the business model and things like that. So just get up again, get up, rise, and continue your purpose.
Something I learned the hard way, but because I need, like, from my scars or our scars in general, is that using language to help you, or the way, your perspective, see things differently. So let's say this happened, a mistake happened. You can, as a leader, and even when you're talking to yourself or your colleagues, and this is something that actually happened with me. It's like, okay, this is a learning opportunity. No need for, like, no need to point fingers. This is your mistake, my mistake. No, it's a learning opportunity. It's a problem. Let's all fix it together. Let's sit down, round table, fix it together. Learning opportunity, and then teach it. It's a teaching opportunity, a learning opportunity. You never know what comes out, and most of the time, those things come up with amazing innovation solutions that they would have never come up otherwise.
Thank you, guys. Genuinely.
Thank
Amazing
you, too.
discussion, just again, amazing
Likewise.
panel as well. And thank you guys for attending as well. Feel free to come and bother us about this, like, literally at any point in time. I'm sure you can tell we like to talk.
We had the best moderator also.
Yeah.
Thank you, guys.
Thank you, everyone.
I'm going to add my own quote on that. It's never a failure. We can always classify it as an attempt. Yeah. That's it. That's it. That's exactly what Dr. Basma said. It's a learning opportunity. FIL. First attempt in learning. Fail. There you go. Yes, Dr. Basma approves. All right, so I need everyone to just raise a hand. Raise any hand. Raise the other one. All right, you're all awake. Great, because this is the moment we have been waiting for. Now we are set to honor the healthcare professionals and business leaders globally. And we're going to give, they've just truly excelled in the healthcare, wellness, and pharmaceutical industries. These individuals have made significant contributions in their field. And I would like to ask Mr. James P. Cummings, the founder and president of Kijana Educational Empowerment Initiative, to join me on stage as he will be presenting these honor awards. Yes, put your hands together. This is James. Oh, and my team is just making the stage very beautiful so that you can have beautiful photographs. Very good. So we are going to be starting with our very first award. This is for the Health 2.0 Conference for Outstanding Leadership Award. I'd like to invite Dr. Ahmed Aladawi. Dr. Ahmed Aladawi is a corporate performance management consultant at the Dubai Health Authority and quality resource person with over 25 years of experience in the Middle East. He works as an experienced strategic corporate development, futurist, and digital transformation consultant in healthcare, education, and social sciences, not only here, but in Egypt, Saudi Arabia, and the UAE. A fun fact, he's a full-time professor at the Academy of Sciences, Technology, and Marine Transportation, which forms part of the Arab League teaching and instructor in Medical Management Board certifications. You're very welcome. Congratulations. All right, we're moving on to the Health 2.0 Conference Young Leadership Award. I'd like to present this award to Al-Nud Al-Abul Hadi. Where are you? Are you in the room? Yes, there she is. Al-Nahud is a driven medical intern at Al Faisal University, where she actively contributes to patient care and medical research. With a strong foundation in medicine and a passion for neuroscience, she serves as the president of SIGN, the student interest group in neuroscience. The future, ladies and gentlemen. This is for a Young Leadership Award from Health 2.0 Conference. Lovely. Congratulations. Health 2.0 Conference Outstanding Leadership Award. I'd like to invite Anna Gavalda to the stage. She is the co-founder and CEO and managing partner of Anion Consulting. Yes, she is passionate about data analysis, portfolio management, and strategy with more than 20 years of experience in different roles in the pharmaceutical industry. She has consistently demonstrated a commitment to improving people's health through innovative healthcare solutions. Congratulations. For the Health 2.0 Conference Outstanding Organization Award, I'd like to invite Dr. Khaldun Boshnak for Alma Health as a digital health platform that simplifies the lives of people with chronic conditions and those who care for them by harnessing the power of technology. Where is Dr. Khaldun? Yes, he's here. He's standing next to me. Alma Health has created the first digitally native healthcare experience. You're welcome. From doctor consultation to delivery of medication to ongoing care. Oh, sorry, there's only one set of stairs, unless you want to like bungee jump down. Yeah, that's all right. There's enough doctors in the room, you know. You're very welcome. Up next, I'd like to give the award for Outstanding Leadership Award and invite Dr. Basma Khaldura back onto the stage. We know a lot about you as you were just on the stage, but she is the General Manager and Executive Director of Business Partners of the Saudi Commission for Health Specialities. Her multifaceted background includes strategy, project management, teaching, and clinical research. Thank you, Dr. Khandura. Up next for the Health 2.0 Conference Outstanding Leadership Award, I would like to invite Chitra Jacob to the stage. Chitra Jacob is a manager focusing on quality, innovation, and learning at the St. Joseph's Life Care Center. She brings over 15 years of clinical, educational, and administrative experience in primary care, acute care, and long-term care settings. How you doing there, James? You okay? The face okay? Smiling? Yes? All right, you're very welcome. Up next for Young Leadership Award, Dr. Farouzia Sheikh. In the room? Yes. All right. Farouzia is a young entrepreneur and medical intern at the Krishna Institute of Medical Sciences with a deep understanding of healthcare systems and patient care. She strives to lead teams and implement strategies that enhance the quality of care provided. Through her unique background, she aims to bring a holistic approach to healthcare leadership and contributes to the betterment of both patients in the industry as a whole. Thank you. Those shoes. Girl. Up next for Outstanding Leadership Award, I'd like to present this award to Dr. Farhad Al-Harbi. Dr. Farhad serving as the consultant and head of the neonatal intensive care unit at Dr. Sulaiman Al Habib Medical Group. He holds the role of Chief Medical Information Officer and serves as a surveyor for the Saudi Board of Healthcare Institution Accreditation. He has earned his Arab Board of Pediatric certification back in 2000 and achieved an Australian fellowship in neonatal perinatal medicine. Additionally, he holds the digital health certificate from Harvard University. You're welcome. I can't not say that. I mean, it's got Harvard in the title. I can't. All right, up next for the Health 2.0 Conference Visionaries Award, I'd like to invite Heather Stokes. Oh, you got some love, Heather, in the room. Founder and CEO of Serenity Light Recovery LLC. Heather is a certified IASIS provider and a certified crisis prevention intervention instructor, a practitioner and certified life recovery coach, and a member of the National Society of Leadership and Success. She also serves on the board of directors for an Angleton Chamber of Commerce and volunteers with Grateful Americans organization, working with PTSD Foundation, helping veterans heal from trauma. Congratulations. For Outstanding Leadership Award, I'd like to invite Hiroshi Atago. Hiroshi Atago is the Director of Business Development at Syneos Health, has over 20 years of dedicated experience in the pharmaceutical industry. His expertise spans from early-stage cardiac safety risk evaluation on new products on to leading the establishment to comprehensive and exclusive strategic business partnerships for drug developments. Congratulations, Hiroshi. Up next, I'd like to invite Joshua Forst for coming and collecting the Outstanding Organization Award for the TY Health Insurance positions. Is Josh here? I remember seeing him yesterday. I haven't seen him today. All right, we'll skip over. We can maybe move him to the afternoon slot. All right, I'd like to continue with the Health 2.0 Conference Outstanding Leadership Award. I'd like to welcome back Miss Katrin Weyer. With 12 years of experience as a speech pathologist, Katrin realizes that there was a gap in practice management systems. Back in 2017, she fulfilled her dream in opening her own practice called the Provalia in Münster, Germany, in her hometown. Yes, please do.
I would like to say something because this award really means a lot to me, and it also shows that with our practice concept we already could show how to do a change for our therapy field. And I would like to say thank you to my team who's working very hard and with high quality and is always open for my new ideas. So thank you for that. And I also want to say thank you to my professors of the SLP School, Schule für Logopädie Münster and FH Münster, for teaching me in speech pathology and therapy management. And also, the last one, the School of International Business and Entrepreneurship, because they taught me how to write business plans, and they were the reason why I could open up my own company. So, yeah, thank you.
Congratulations. Up next for Outstanding Leadership Award, I'd like to invite Krishan Bardwaj. He is a seasoned professional with over 23 years of experience in the field of IT. He is currently serving as the Senior Vice President and Head of IT at Medel Healthcare India, with a diverse background across industries including healthcare, hospitality, real estate, and IT services. Congratulations. Health 2.0 Conference Outstanding Leadership Award would like to award this to Luke van der Nest. Is he in the room? Luke? Luke van der Nest. All right, we'll skip over that one. Up next for, again, Outstanding Leadership Award. I know this lady is in the room. Dr. Mangal Kardile. Please give a round of applause for Dr. Mangal Kardile. She is the founder and director of Mental Health Aims and DRMK Memory Foundation and president of ARDSI Nashik, and has been working in mental health consultancy and disability services since 2000. She has a strong clinical and research background in the fields of philosophy, clinical psychology, clinical research, neuropsychology, medical neuroscience, advocacy, mental health law, and human rights.
Thank you, everyone, and thank you, Health 2.0, for recognition of this innovation and my leadership in this area. I dedicate this award specifically to my patients and caregivers and those doctors who supported my research, because it's very, very important in healthcare. Innovations are very, very difficult, because it's not just you bring up one product and you market it heavily and everything is done. It is not like that. And when it comes to memory and cognitive impairment area, it's lot to be done before establishing some innovation in this field. So it is a very, very long journey. And once I understood that psychology can have support with psychopharmacology, because pharma can help very, very severe psychological conditions also, but not for the neurological disability. So I first started with developing a screening test which is applicable to every other person across the globe. So first I started with that very, very long ago. And I got support from Australia with the International Research Award, and they standardized that test. But with screening, when I was working on the research on the screening, I understood that I should have some answer to that. It's not enough that we should say that, okay, this person is having problem in this area. This person is not being able to understand the name of the person. Forgetfulness is there, not understanding any color. So what we are going to do? What is the solution? And I understood that this solution can ever be there in medicine. We have to think beyond that. So I started working on that, developed Brain Next concept in rehabilitation, and worked heavily on that, and gathered all valid data, more than 6,500 different neurological conditions and patients we have treated successfully. This is the first ever in the world that we have established that memory can be recalled successfully in dementia, Alzheimer, or any other neurological disability at any age and with any severity. First ever book has been published in 2022 on these case studies. And we are there to serve the nation across the globe. And most importantly, I would say that these are the affordable and any corner of the world the person can access. And recently we have translated into many other languages like Arabic, Spanish, and so on, so that the people from any corner of the world should be able to access these rehabilitation services. And with the note, I would say that we have started training courses because we have seen that the caregiver who is illiterate, we can just train the caregiver and the caregiver can take care of their persons, the patient at home, very successfully. So we have come up all of these innovations and methodologies, and I would really like to extend all of this information to you. Thank you very much.
Thank you indeed, and congratulations. All right, moving on to the Outstanding Leadership Award. I'd like to present this award to Marciano Same. I'm sorry. Executive Director at the Brain Health USA, and is passionate about results-driven leader spearheading the mental telehealth revolution in California. With over 8 years of professional experience, he has a consistent demonstrated exceptional leadership driving significant business growth. Of course you can.
Hello, everyone. It's very pleasing to see you all the leaders here. If you can help me give an applause for my family. They are watching me. They has been able always being the support for the person who I am now. I want to thank also my team for all the amazing efforts that they are giving for leaving a positive impact for our patients' lives. That has been the real award for our practice. Also, I want to thank you, all the leaders here, for all the valuable and sensational stories that I have been hearing since yesterday till now. Thanks for health too as well, because these gatherings where all the experts and the leaders of healthcare gathered together, these gatherings where the innovations comes for us to be able to help the patients get more and better lives. Thank you so much for that.
Thank you and congratulations. Up next for the Health 2.0 Conference Visionaries Award, I'd like to welcome Dr. Maria Rodriguez. Is she in the room? Dr. Maria Rodriguez? Not here. We'll be moving on. For the Outstanding Leadership Award, Dr. Marilu Oro. Marilu Oro, are you in the room? No? All right. Up next for Outstanding Leadership Award, Dr. Magna Kambam. Kambam? There she is. I see her. I remember her from yesterday. Dr. Magna Kambam, founder and CEO of Karen Grow, is a distinguished health designer, social entrepreneur, and award-winning medical graduate who is dedicated to catalyzing positive transformations in underserved communities. With a robust educational background from Stanford Business School, INSEAD France, UCL London, focusing on impact, social entrepreneurship, and health behavioral change. Dr. Kambam also has an MBA from Indian School of Business.
Very good morning, and I really would like to dedicate this award to my family and most importantly the team that we have on ground. We work at a very grassroots level in the, the very rural environments, delivering what we deliver, including the private hospitals and the schools. And it's really difficult to work in a terrain like that and sustain a concept like us. I really thank my team who are there for a very long time with us through the ups and downs of having a startup, the funding crisis, and and everything. And when we kept a vision for ourselves that we need to establish an ecosystem to completely eradicate the gaps in the early childhood development segment from 0 to 6 years with a technical cloud-based platform with a patented technology to screen the delays and immediately provide scientific stimulus activities to the kids with delays and refer the kids with delays like dyslexia and dysgraphia at the right time to the experts. And that's the biggest gap in any developing country or developed countries for that matter. Without the difference between socioeconomic status, everybody has these gaps in all kinds of nations to access immediately expert care and have a continuous development of 100% brain potential. So I really am thankful to be standing here with the greatest assistance of my family and my team to really further this vision. I really call upon any entrepreneurs on our who are working in this field who could really inculcate the 0 to 6 years early childhood technical ecosystem. Anybody is working towards sustainable solutions in a very cheaper manner to really cater to detecting delays early and catering to the scientific stimulus activities for them and giving them expert care. We are there, and please come and forge a relationship with us. I'm always here, and thank you so much. And I really congratulate all the other leaders who are doing meaningful work for the betterment of health and the humanity. Thank you so much.
Thank you, Doctor. Moving on to an Outstanding Leadership Award, I'd like to invite Michael Angelo Giannato. Is he in the room? There he is, arriving. Michael Angelo Giannato, or Mitch, is the group CEO and co-founder of Rumlas Health Group from Manila, Philippines. His company aims to bring the best global practices in health and wellness to the country and make them more accessible to Filipinos. By providing access to the most up-to-date medical technologies and practices to the Filipinos, they act as a bridge between partners and suppliers to create an end-to-end supply network. Congratulations. Health 2.0 Conference Outstanding Organization Award. I'd like to invite Nikos Chatsibelasis to the stage. BCMA, the Bioholistic Complementary Medicine Academy, is revolutionizing holistic medicine education by integrating AI, quantum technology, and various therapeutic modalities, preparing healthcare professionals for the future. Their commitment to advancing holistic education underscores a dedication to creating a more integrated and innovative healthcare landscape.
Well, I want to thank everybody for this award, and I want to say that I'm very grateful for my colleagues and my team. We have here Yvonne, we have Donna. They supported me on this journey to be here, and I'm very happy realizing that most of the doctors here are speaking about holistic medicine. So I would like to help you define what holistic means, because it's much more than we think. Thank you very much from my heart.
Congratulations, Nico. Up next for Outstanding Leadership Award, I'd like to invite Rohan Pereira. Rohan Pereira, IT business partner at G42 Healthcare, is a healthcare informatics business leader with over 23 years of international healthcare IT experience. He's a driven, leading cross-functional teams with the enthusiasm, motivation, and vivacious energy. Thank you, Rohan. You want the mic?
I'd like to thank previous colleagues from previous company, Philips Healthcare, which was an amazing 20-year journey, all the partners and private and public sectors that enable us, healthcare providers, to give them the latest and greatest in healthcare technologies. And I'd also like to thank all of my colleagues and mentors in my current company, G42 Healthcare, M42. So if there's anything that we can do to partner up, please do let me know. I'd like to thank our management team, starting from Mr. Hassan Al-Noways, Ashish Koshi, and Vinit for their fantastic mentoring. And most importantly, I'd like to thank my family. My wife was here with me, my 3 sons were at school, and I hope I can show them the video later today. Yes, we can. And my family back home in India. Thank you.
Congratulations. For Health 2.0 Conference Outstanding Leadership Award, Sarah Kalia. Sarah Kalia is a consultant in beauty and wellness business, started to develop an important concept about the importance of collaborating between all the professionals with the same purpose: a therapist, doctor, dentist, dermatologist, osteopath, concierge attendant. That's why, for her leadership concept is fundamental to show, act, teach, and live day by day while teaching and working, because an amazing dream team is built from every person, with all the people included in the project for studying and working.
I want to thank you, everyone. And what I am understanding in these days is that I'm so happy about it, is that we are all talking about something like an old and new concept about the holistic view about the person. And I'm not a doctor, there are a lot of doctors here, and sometimes with our business we work with you. And the very nice concept is that working together and putting all this concept is very fundamental, because in this way we can restart from a new point of view, and so understand better what the person is asking us and what the person and what we have to give to the person. So I also like to thank you, my friend Shika, because also before she said about you know, when I train about the kind of treatment we have to give to the person is very fundamental, because she said before about giving a pedicure or something like that, and here we are also talking about a diabetic person or whatever. And sometimes also in our business we think it's just a treatment, but it's not just a treatment. We have to understand well what we are doing on the person. So I'm so happy that we can do this all together. So thank you, everyone, and thank you.
Thank you, Sarah. Health 2.0 Conference Outstanding Leadership Award. I'd like to invite back to the stage Mr. Stefan Wall. Stefan Wall is a German entrepreneur and pharmacist renowned for founding the Vivalt Pharmacy Group back in 2001. After completing his pharmacy studies, he furthered his education in medicine at the University of Heidelberg. Under his leadership, Vitalwelt has expanded to include 7 pharmacies, cosmetic studios, and Vitalwelt family store. Dankeschön. Up next for Outstanding Leadership Award, I'd also like to welcome back to the stage Dr. Sunil Bodanapu. I know he's in the room somewhere. Dr. Sunil, a doctor by profession and entrepreneur by choice, is an alumnus of Kakatiya, sorry, my mistake, Medical College and Indian School of Business. He's a medical professional with deep insights across the healthcare value chain and over a decade of experience and expertise in healthcare, care diversity, healthcare operations, and healthcare management.
I would like to thank my wife who is standing by me in thick and thin. And I would like to thank my investors who have given a moral support and financial support to bring it up to here. And I would also like to thank my team who are there working hard to build the product which I am building. Thank you, Health Conference, for the opportunity.
You are most welcome. Thank you. Again, for Outstanding Leadership Award, I'd like to invite to the stage Mohita Shrivastava. Mohita, yes, she's here, a neuroscientist, founder and CEO of Cognitome Program, 15 years of experience, and Mohita believes that brain and mind health can be improved significantly by following a holistic approach along with evidence-based neuroscientific exercises. Thank you. For our next Outstanding Organization Award, I'd like to invite Suresh Naganathan to the stage to accept this on behalf of Gather Nature Connects, as it aims to promote self-activation as a means to achieve personal development and growth for all, allowing people to explore and identify the best versions of themselves. The team offers a bouquet of services designed with a lot of care and compassion, letting their clients choose how they want to approach their self-enhancement journey. Thank you. Up next, yes, you can give him a round of applause. We're staying on the Outstanding Organization Award. I'd like to invite Tanvir Hassan. Yes, AIHCON is a healthcare technology company that is committed to helping physicians and healthcare providers transition towards a value-based payment model. Led by Tanvir Hassan, who is the founder and CEO, it provides an innovative and effective SaaS solution that aims to reduce administrative burdens, streamline practice management, and create a more efficient and cost-effective healthcare system. That sounds wonderful. Thank you, Tanvir. Sure.
Thank you, Health 2.0, for this opportunity. And here we all are working together for a better healthcare, better future. And I'd like to thank my team who believed in me and is still believing in me, and my wife and family to tolerate me all this time and tolerate this craziness. Thank you so much.
Tolerate is a strong word. I'm sure they love you. All right, staying with the Outstanding Organization Award, Vivalt Apothecare. I'm going to invite Stefan back onto stage. Yes, Stefan, come on back up for Vital Welt. This is for the Outstanding Organization Award. Mr. Stefan was on the stage earlier explaining his entire concept. Yes, third time. We're hitting a record with you here, Stefan. Congratulations. Okay, we have reached the final award. Maybe I've saved the best for last. Outstanding Leadership Award. I'd like to invite Vivek Mahendra to the stage. Vivek is working as the founder and managing partner of Vivikta Advisory and Creatives. With an education in biosciences, Vivek has been passionately working over the last decade on leveraging the learning from these disruptions to address the last mile gap for accessible, affordable, and accountable healthcare. Through the initiatives in the healthcare domain, Vivek has architected and delivered platforms that today touch over 1 million lives. Thank you so much. Yes, of course.
Good afternoon. I won't take much time. Just wanted to kind of thank my clients who have trusted me as an independent consultant with areas which have a deep impact on the human health. I would recently we got a patent for one of our clients in the formulary creation for a provider. Basically, it's a patent that helps make the formulary more affordable and therefore the care more affordable from the consumer standpoint. So just want to thank them. And it's a partnership firm, so I have my partner Ekta Khanna here. I think we are trying to do things a little differently, and we hope we get support as we're getting till now for the last maybe 3 decades that we've been working. Thank you so much.
Thank you so much. And finally, a last round of applause for Mr. James P. Cummings. Yes, I'm sure his face is a bit sore from all the smiling. Thank you so much. You've done a wonderful job. And of course, my colleagues, thank you so much. From the Health 2.0 conference team, we extend our heartfelt congratulations to all of the award winners for their unwavering commitment and exceptional efforts in transforming the healthcare sector. We're excited to share that our upcoming editions in Las Vegas and Dubai are filling up fast. So if you do want to have a talk session, or if you would like to have a booth of an exhibit of your products or your services, please do get in touch with our booth that's next to the registration desk. You can chat to Jatin Sidhu, he who leads the 2.0 conferences. It is time to take that much deserved lunch break. Everyone can breathe a sigh of relief. Yes, do continue your networking sessions, and I hope to see you back here at 1:30 as we reconvene. Have a great lunch break. If I can interrupt you just before lunch, all the award winners to make their way to the stage for a group photo. Yes, if you would like to come up to the stage for a group photo. And for those who don't know, there is a QR code that is in the lobby where if you scan this QR code, and it'll prompt you to take a selfie of yourself because AI is incredible. All the photographers that have been around in the convention have uploaded the photos to a cloud. So when you take your selfie from your phone, it's going to do all the facial recognition, and it's going to take out all the photos that have you in it, and they make you a personal photo album, which is very, very cool. So all the award winners, come on up to the stage. We'll take a group photo. And then we can all go enjoy lunch. We don't have much time, though. It's only 40 minutes. Eat fast. I think everyone is too hungry. They've left. It's all right. It's all right. We've got enough. All right. We can stagger it a little bit. Some step to the front. Yeah, we need to compress it just a little bit more. There you go. Can we all take a step forward? Because some of you have the line of the projection across the face. Everyone take a step forward. Yes, forward, forward, forward. There you go. Yeah, that's much better. Yes. Not too forward. Like I said, there's enough doctors in the room if you fall. Also, when posting your photos on LinkedIn, please use the hashtag health2conf, as in health number 2 CONF. We will collaborate all the pictures and we'll do a lovely broadcast of the event. Have a great lunch and I'll see you back here at 1:30. All right, looks like everyone's still enjoying lunch, but I do want to say a big, big thank you to all of you that are here on time. I just feel like we need to be respectful of everyone's time, and I'm going to try keep to the schedule as best as I can. So we are going to be starting with our first keynote speaker, and I would like to call to the stage Dr. Tanvir Hassan, MBBS, MPH, founder and CEO of AIHCON Incorporated. Our esteemed keynote speaker will be sharing his insights on the topic of revolutionizing primary care, the journey towards value-based, patient-centric healthcare. Please put your hands together for our keynote speaker. Pointer.
Okay. Every life matters, and with that line, I want to start today's session. We're almost 10 minutes late. Supposed to be 30 minutes session, but I'll try to squeeze it in 20 minutes. But when I say every life matters, right now, every second, someone is experiencing their first child, someone is experiencing losing their parents or family. And how fortunate are we to be a part of the industry where actually we can touch life. And everyone, every human being, right now, almost 8.1 billion people, we actually have the chance to make their life better. And I think that to be a part of healthcare industry is actually very fortunate. At the same time, right now, looking at the global healthcare system, we feel like, are we really fortunate? That's the question we're asking. So today, I want to introduce DocPro, and we will be talking about primary healthcare, patient-centric care, value-based care model, and how revolutionizing primary health care can make a difference. So at first, I'll just like to start with value-based care. So what is value-based care? Very simply, I think we all are expert in this field, but in a nutshell, if we want to say that adding value to the every step of value chain of healthcare, right? And when we are saying value, that actually is quality over cost. That how much we are actually spending and how much quality of life we are actually providing to the patient's life. So the first thing, I'd like to ask a question. That the first thing comes to your mind when you hear the term value-based care. So if anybody in the audience, we know that we have very few people here, but someone wants to volunteer, that what is the first thing comes to your mind when you heard about value-based care? Anyone, sir? Absolutely. And so the word value is actually very interesting. So we are thinking about the amount of money we are spending in healthcare and what is the quality. But if we think about the value, how can we actually define value? It's about the quality of life. It's about the patient experience. It's about the provider experience. It's about the pharmaceutical experience. It's about how the payers are feeling. So every sector of the value chain, we are adding value in value-based model. So it's not only about the doctors, it's not only about the physician, not only about the patients or the payers or the pharmaceuticals. It's actually everywhere we are adding value, and that is value-based care. So next, the difference, like why this value-based care model came. So before it was volume-based, right? So whenever someone sees a patient, we call it fee for service, or there are other payment model, capitation, ACP, and all those things. But what we think that value-based care means that you will be paid for the value you'll add to the patient's life. But there's a debate. A lot of people like says that it's still like actually value-based care is the right model or not, right? But when we are looking at the past and see that, when volume-based payment model was there, what happened? There was overutilization. There was no control. Sometimes we were actually exploiting the resources. So value-based care wants to make sure that we are actually doing the proper utilization of resources, right? So next, when we come to the patient-centric care management. So patient-centric care management, so when you look back like 30, 40 years back, it was more doctor-centered. So it's all about like the providers, the healthcare providers, how they're behaving, how they're treating the patients. And at some time, because healthcare is an industry, if we look at any other industry, here the consumers are the patients, the service providers are the doctors or other healthcare facilities. So what we think that patient-centeredness is very important. If the whole system actually work, keeping the patients in the center, that will make a significant difference, right? So in terms of patient-centric care, what I would like to add that most of the time, because we were actually running a survey in New York, and we are seeing that how patient-centric care, like what do you mean by patient-centric care? We asked a lot of doctors, and we asked that, what do you think about it? So patient-centric care is a personalized healthcare, right? So as I mentioned, that every person is important, right? So when a doctor is seeing 70 patients per day or 30 patients per day, he keeps seeing all these patients, but that one patient is very important. Someone's father, someone's mother, someone's brother, someone's sister, someone's children. So what happens that it's very difficult for the doctor or the healthcare provider to think personally about that patient, right? So when we think about the population health burden, that hypertension, diabetes, cancer, obesity, depression, all other issues, it's not possible for a doctor to actually focus on one patient and give you holistic care. So that's where the value-based patient-centric model came. That you give like 30 patients care, and at the same time you provide a personalized health care. So next, this is the onion model. And very interestingly, right now I'm working with New York University, and this is the model I'm proposing, and our publication will come out very soon, that how actually we can change healthcare system. Because looking at the healthcare system, that if we dig deeper and see that actually what is the problem, and we are all talking about like digital health, we are talking about how we can improve the healthcare system, we are talking about patient engagement, but there is a way, like when we were doing research and we figure out that the most important thing actually is health-seeking behavior, that how you are seeking your health. Yesterday I was actually saying that, we always, like in terms of anything, we do the maintenance, right? But in terms of health, we don't care about maintenance. We don't think like it's important to maintain our life. We only see a healthcare provider when we are sick, and that is sickness-seeking behavior. So this sickness-seeking behavior needs to be converted to health-seeking behavior. And so once we have that, so that means we are actually starting to connecting the dots. So the patients are doing their part, the providers are doing their part, and also the system is now connected. Because you cannot blame only the doctors or the healthcare providers to provide better healthcare. So also there is a part from the patient's end, that they also have to do something so that the doctors, like it's like they're coming halfway, and the patient's coming halfway and the doctor's coming halfway, and they're meeting at a point where the better healthcare can come, right? So if we think about it, that there's a quotation from Khalil Gibran that comes to my mind, that he said that every life is actually contributing to take the world to its Earth's furthest dream, right? So, and in healthcare systems, exactly like that, that everybody is playing and they're actually contributing to take the healthcare system at the next level. And here, when we look at the value chain, it's doctors, patients, payers, pharmaceuticals, hospitals, urgent cares, so many components. And everybody is actually contributing a little bit and take the healthcare system to a better system. So next, if you look at the global healthcare challenges, there are a lot of healthcare challenges, but right now I think the most critical part is lack of physicians, and second, the number of baby boomers actually reaching their age 65 plus, right? So in USA, every day there are 10,000 people are actually becoming Medicare eligible. So that's a huge population health burden. So if we look at it, that life expectancy is increasing. At the same time, there is a lack of providers. So now what to do? So I think that the way we actually can make a difference is proper utilization of resources. And that's where DocPro is coming. DocPro is helping the doctors to make their system more efficient. So make it more automated and to make it more proactive. So there's one thing, like first, if you look at the slide, there is 4.3 million healthcare professionals shortage, right? And then there is increased population health burden. And at the same time, there is lack of efficiency. And there's a huge cost. If you just look at the US healthcare budget, it's almost like $4.7 trillion now. Like you can run like almost 70, 80 France with that money, right? Even that amount of budget is not sufficient. Is it truth? Like why that's happening? Like this amount of budget is not sufficient to provide healthcare to that population because there is a huge lack of proper utilization of resources. And what we want, that we want to address those loopholes and we want to help these healthcare providers to do the proper utilization of the resources. So right now, I already talked about this, that what is the urgency of patient-centered value-based care? Because at some point, there was patient-centeredness, and then it came like the value-based care. So all together, so I think it's more important to have a merge now. So it's patient-centered value-based care. So we actually can do the proper utilization of resources, because if we look at the future, we can see that there will be almost like 100,000 lack of providers in USA. Not only in USA, globally also this is a big problem that if there's no doctors, so now actually the doctors are replaced by nurse practitioners and other healthcare providers. So there is a significant problem. And at the same time, there is a huge population burden. So now what we need to do, that we need to have a proactive outcome-based care. So we can understand that even like some of the physicians in New York, we saw that they have like 5,000 diabetic patients, right? It's quite impossible for them to track every single patient's outcome and see that, how they can improve their health. So what we want that you don't have to do all this. The system will automatically identify the problem and the system will automatically solve, like give you a roadmap. So in every other business, if you look at it, they have a roadmap, any business. And for healthcare providers, that when we are in med school, we only learn about medicine. Nobody taught us about the business. Nobody talked about the financials. Nobody talked about like the health economics, right? So we don't know any of this. We learned about medicine, and then we come to a system, and now all of a sudden we are overwhelmed. We don't know what to do. And that's where like the physician burnout is coming, right? And physician burnout is a significant problem globally. And it's not for the medicine or the practice, medicine practice. The main problem is the administrative burden, all the administrative complexity, the intricacy. And those things are actually creating more problem. So as I said, that every 4 in 5 healthcare workers, they're saying that they have been affected a shortage of medical professionals. Because it's not only like treating the patients, it's about like you have to fill out these forms, you have to do this, you have to do that. So they are feeling overwhelmed. And at the same time, now with the advent of technology, EMR is there, and you're not only seeing the patients, you have to complete the charts, and the doctors are like overwhelmed. And most of the doctors, they actually complete their charts over the weekend. So where is the work-life balance? Like I see the patient 7-8 hours per day. At the end of the day, I'm completing the charts, and if the charts are pending, then I have to work during the weekend. So that's the problem DocPro identified, and they actually are trying to help the doctors to minimize the time of completing charts. So in a nutshell, what is the summary? Like what are the problems right now DocPro is addressing? Number one is 79% of the PCPs, they're complaining about burnout, right? Then almost 8 hours per day, that's the EHR or the EMR time drain. Then almost they're losing average like $600,000 per year because they don't have a proper data analytics with their system, right? And then 25% of their work is administrative work. And there is a huge shortage of the PCPs, like our primary care physicians are coming. And I already mentioned that 10,000 baby boomers are actually converting to Medicare every single day. So what DocPro is doing here? So DocPro is actually the tech enablers. We are the tech enablers. So whatever EMR you are using, whatever system you're using, doesn't matter. Irrespective of your tech stack, we actually come on board and we help to optimize your system. We help to give you the data analytics. We want to reduce the fragmented care. We want to give you, right now the systems are working in a reactive ad hoc model, like firefighters. Something, any urgency is coming, solving the problem. What we want to do that, we want to give them a proactive outcome-centric care. So they exactly know, they have a proper roadmap. They know that what to do for these patients, how to reduce the population health burden. Then the first thing what we are doing, so we have a tool that is AI-powered and data-driven. It's a very simple, we call it minute charting. It's like a karaoke. So what happens, like, you know, like if it actually guides you, that you just mention one symptom, one problem, and it guides you that, okay, what are the things you need to ask from your patient? Suppose the patient is here for a pain. So right away, it will actually give you the roadmap, okay, what is the location, intensity, the quality of pain, what is the aggravating factor, associating factor, alleviating factor, whether there is any radiation or not. So everything is there. So it's like, you know, like you don't have to think about it. It's everything is coming automatically, and you are just reading it, and it's transcribing, and then it is actually pulling the data from your EMR, conglomerating through AI, and giving you the chart, and significantly, it's actually a personalized charting system we are providing to the doctors. And then the referrals. Referral is a big problem, because the primary care physicians, they're referring every single day. And there is a huge lack of completion of referral loops, because one of the example, one patient came multiple times with chest pain. The primary care physician referred the patient to cardiologist several times, and that patient was not compliant, and that's where the health-seeking behavior is coming. So they think it's okay, because they don't think like it's important. Until the chest pain is really severe, they're not feeling the urgency of going to the cardiologist. At that time, what happens that this patient eventually ending up in the ER. So now the cost of care is exponential. If the patient went to the cardiologist, see the doctor, do the stress echo, all those things, the cost might be $1,000. And now the patient ending in the ER, the total cost is almost $15,000. So that's where it's not anymore value-based. It's actually now, it's a waste of the budget, right? So that's why we are trying to streamline the referral system. It's connecting the specialist, the primary care physician, the patient. Everybody is in the loop. They have the guidance that exactly they know that, okay, this patient is actually waiting to see you. Because most of the time, the doctors are just giving the referral. The cardiologist doesn't have any clue that, okay, this patient is actually waiting to see him, right? So now we can come to the care gap plus. So gaps in care is a significant problem that because there is age and sex specific screening. So we need to do the mammogram, we need to do the colonoscopy, we need to do the cervical cancer screening, all those things. But the problem is when you have a patient panel of 2,000, 3,000 patients, you actually don't have any track. Maybe you are addressing 10%, 20% of 30% of it. So now we are trying to activate the patients. That, you know, like the patients will be activated, the doctors will be activated, and this is a system that will actually reduce the gaps in care significantly. And now looking at the healthcare wastage, right? So if you look at it, I just told, I was telling you that just sometime before that $4.8 trillion or $7 trillion, and the wastage is almost $1 trillion. Like, this is unbelievable. And now we are complaining that we don't have enough budget, but we are actually wasting almost $1 trillion. So that's where we want to actually come in, and we want to make sure that proper utilization of resources is very important at this time. And I think we already talked about this, how combating healthcare wastage is value-based model. And this is one thing I want to spend a minute, that quintuple aim. This is the beautiful model, right? So before we know that the triple aim was there, and then the quadruple aim, and then the quintuple aim. So what is quintuple aim? So quintuple aim is, one aim is to reduce cost of care. Another aim is to reduce the physician burnout. And then we need to improve the population health burden. And then we need to improve the patient experience. And eventually, we achieve health equity. So that is quintuple aim. It's like a temple, like 5 pillars, if you look at it, that you reduce the cost. And when triple aim was there, it was patient experience, reduce the cost, and population health burden. But they actually then thought that who are the healthcare providers? They're not thinking about the providers. And that's the time it came that, we need to reduce the population, we need to reduce the physician burnout. We need to help the physicians to provide better healthcare. And at last, the 5th aim came, the health equity. So that's the quintuple aim. And that's it for today. And if anyone has any question, I'd like to take. Any questions? Great. Either we do, we're still just finished our, yes, sir.
So a question for you. I think you brought up an interesting point about the value-based care. We spoke about all the 5 players in the ecosystem to have a value generation for them.
Right.
Now, do you believe it's, how do you believe it's possible that you can derive value for all the 5 players, whether it's a payer, pharma, provider, and the patient altogether? Because I think somewhere it's a dichotomy where you, if somebody, for example, if you pay some amount of money, maybe if the money is less, the payer loses or the provider loses. How do you balance that out? What was your approach on that?
Great questions. I really appreciate that. So we were actually talking about it a couple of days back in our university setting. So how can we add value? So if you think about it, that there is a fixed budget, right? So every patient, there is a budget allotted for that patient. Suppose it's $10 per patient. So you have 10 patients, so total $100. Now think about it, that the payers, they're getting the money from the government. So $100 total budget, and if they spend $60 for these 10 patients, so they're saving $40, right? And in value-based care model, this savings is actually distributed. It's distributed among the providers, it's distributed among the pharmaceuticals, and everywhere. So now what's happening is volume-based. It's like whatever the service, the number of service they're getting, that's how they're getting the reimbursement. But in value-based care model, the more you save, the more you do the profit sharing. And that's how everyone in the value chain will be benefited. It's not only the providers, it's not only the patients. So patients are getting the quality of life. That's what matters to them. And in terms of reimbursement, everybody is actually doing the profit sharing, and that's how they are getting the value, if that answers your question. Sorry?
It answers to some extent in terms of this ethical standing, but still a European thought.
Yes,
it has to be
I know that.
on the ground.
But in the US healthcare, that's how they're thinking about it. But in a universal healthcare model like in Europe, so I don't think that would be the case. Any other question? So I think that's it. Thank you so much. And I really appreciate that. And I really congratulate everyone for the work everybody is doing and the trying to make a difference. And hopefully, we'll actually achieve the Earth's furthest dream of better healthcare. Thank you.
Thank you so much, Tanvir. Thank you, thank you. All right, so I'm glad to see the room is filled back up again. Yes, we all enjoyed lunch. Everything was really good, as it always is here at the InterContinental. And I just want to make sure that whoever is sitting around the table that you're on, do you all know each other? Yes or no? If you don't, I'd like you to introduce yourselves, okay? I'd like you to introduce yourselves. If you haven't figured it out, I'm trying to make time for these guys. Yeah? All right, so if you don't know the people on your table, introduce yourselves. Let's exchange LinkedIn. Yes? What we did yesterday was quite fun. I went through the LinkedIn and I found some lovely selfies, because yesterday I made you all take a selfie with your new friend and get linked in and in contact with each other. And since we've all had lunch, I think everyone's feeling a bit better now. The energy levels have replenished. Everything is back on track. Not so close. A little bit forward. Yeah, just give them space to walk. Yeah? Thanks. Perfect. I love the hum that's come across the room. It means everyone is getting to know each other. We are networking. It's not all about business. We can make friends, yeah? Thank you, gentlemen. Thank you, thank you. All right, looks like we are back on track. I hate to cut your conversations short, and I'm happy to say that we are running perfectly on schedule. So I would love to introduce our next panel. As you can see, there's going to be quite a number of experts, and they are going to be taking a deep dive into body positivity and health, embracing self-acceptance without compromising well-being. Moderating this session would be Dr. Mohita Shrivastava, and in her panel, Nell Pueter. I hope I'm saying that right. Fantastic. Minerva Kalada, MD, and Dr. Vipin Kumar. Francis, which I still cannot say your name, but it is Francis for your practice. Pierre Luigi Latuada, that's you. I'm sorry, sir, I didn't get to meet you earlier. And lastly, Mark Hadge. That's you, that's you. That's it, we are all here. Let me just distribute some of these microphones. There you are, my dear. There you are. And here's the tech team. Fantastic. I'm sure this panel is going to be very, very, very interesting, because we are all about body positivity. One more? All right. So the stage is yours.
Hello. Very good afternoon to all of you. I would like to welcome all my esteemed panelists on the stage for the next session. The panel discussion on the topic about body positivity and health. And the topic says body positivity and health, embracing self-acceptance without compromising well-being. I am Dr. Mohita Shrivastava, and I am the moderator for this panel discussion. Now I would request our esteemed panelists to introduce themselves and their area of expertise. 1 minute each.
Hello to everyone. I am Pierluigi Lattuada from Milan, Italy. I am doctor and a psychotherapist and a PhD in behavioral studies. I create a methodology in transpersonal psychotherapy, and I teach this, and I deliver a degree to medical doctor and psychologist in psychotherapy. Thank you.
Hello, everybody. My name is Francis. You know it already, but my last name is IJsakkers. I'm from the Netherlands, and I'm the founder of a company for healthcare consultancy. And I work for over 40 years in the healthcare environment. So I'm still learning, and that's are the best days for me.
Hello, everyone. I think we met yesterday. Minerva Clara, MD. I'm the Chief Medical Officer for Imperial County Physician Medical Group. Also, I used to be Medical Director for a mental locked facility in our county.
Hi, everyone. This is Dr. Vipin Kumar. Just a thought came. It is so good to have a discussion on body positivity after such a calorific and scrumptious meal. Thanks to the organizers. Coming back to me, I am an infertility specialist and obstetrician and gynecologist working in Kuwait. And I specialize mostly, my interest is infertility, reproductive endocrinology, and adolescent health.
Hello, everyone. Is it a microphone kicking in? Yes. My name is Nell Pütter. I'm from Hamburg, Germany, and I'm founder of Confidence Academy, where we teach leaders and teams develop positive attitude and psychological capital with a system of confidence mindset and positive leadership. So my background is I have masters in international business, and then in the second half of my life I studied positive psychology. So this is how I try bringing these two into one sweet spot.
Hello everyone, I'm Mark Haj, I'm from Lebanon. I'm a physical therapist and I hold master's degree in strength and conditioning. I'm the founder of Core Lab, a gym that caters programs and rehab programs for athletes and non-athletes. I'm thrilled to be here, share the stage with my fellow panelists and talk about body positivity and of course share my expertise in the field.
Thank you all of you for your introduction. I would like to welcome you all. And about myself, I am Dr. Mohita Srivastava. I'm a neuroscientist and a neuropsychologist by profession, and I'm the moderator for this panel. So without any further delay, I would like to begin this discussion. Before I would like to begin about body positivity and health, I would like to again quote an incident of my life about my son. He says, one day he came from his school and he says, "Mama, you look fat." So I said, "I am fat." Then he said, "You know, on the Mother's Day when all the moms were invited to the school, one of my friends told me, your mom looks fat. So how do you become thin? How do you become thin?" Then he went to his father. He asked it, "You always keep on doing dumbbells," and he's a gym freak. So going to gym and all, and you're not fat. Does that help to become thin? So he said, "Yes, why are you asking this question?" So he came to me and he told me that, "Mama, you also start going to gym." Okay? So this is what is body shaming. I mean, even the kids of 6-7 years old age, they are also aware about what is a good body, how does a good body look like, or what is being fat and being thin. So as we all are aware that the traditional or conventional perception or the impression of our body image usually poses certain expectations or norms or mental images about a slim, a body. If it's a slim body, then you're active, you are good looking, you are perfect, you are in shape. But do we really think that setting these kind of norms across the cultures are going to, they pose a certain kind of mental as well as physiological as well as the physical challenges among the population, among the general people? So, and to conform to these norms, it is generally thought an ideal body is a slim body. So this would potentially lead to pose challenges and limitations in both mental and physical well-being, and authentic self-expression and about the self-confidence. So body positivity and health are basically conflicting concepts, but they can complement each other when approached with a holistic mindset. So in this panel discussion, our panel discussion will explore the importance of body positivity and self-acceptance. So let's begin the panel discussion. I'm going to ask a general question about what do we understand about the body positivity. So my question goes to Mark, Nell, and Francis. Francis, please start.
Yes, if it's possible, I asked them to help me, but I would like to start with 4 lines of a song. When it's possible, please start it, and otherwise I sing it for you. Sing for us, my neighbor says. I don't think they have it, but the lines are from a song from John Legend. 'Cause all of me loves all of you. Love your curves and your edges, all your perfect imperfections. And that was why it was hitting me. It's a love song, of course, but it's about imperfections. And I think body positivity is not about imperfections, it's about self-acceptance. And I read a beautiful quote. It's about celebrating the body. And you only have one. So please try to be kind to your body. That's from my point of view.
Thank you. Nell, so now the question goes to you. What do you understand by the term body positivity, and why is it important for our well-being, overall well-being?
Well-being, yes, that's of course a very holistic approach. And first of all, thanks for sharing your story. I appreciate your opening up. Yeah, well-being, and it's of course doesn't only relate on our physical well-being, but it's also mental well-being and health well-being. And today we know, and there is a neuroscientist like you are, who already have hundreds of research and studies would confirm that all goes hand in hand. And well-being, of course, is mental well-being and also physical well-being. So I appreciate you talk about the weight, but actually the body positivity is about, okay, I'm too old, I'm too young. When you go to career, for example, well, I'm too young for this role, or I'm too short. Like in North Germany, where I come from, some women, they say, I'm too tall, I'm too big for everyone else. So it's like, it's about like anybody who says, my face is this or my face is that, and obviously there's external factors, and there are also internal factors. So being in a field of positive psychology, actually I would like to give you all a message to look at the internal as well. Because something external happens, we cannot change social media, we cannot change, we can of course say what we not agree with, but still look at the internal, what communication I'm having in my own head about my own body, but not only the body, because when there is negative communication inside my head about my body, then probably also I'm also thinking negative in some other aspects of my life.
Very good, Nell. Thank you for giving the audience a better and a wholesome understanding about the body positivity. Mark, same question goes to you. What do you understand by body positivity? And what do you think, how does it affect our overall well-being?
Thank you, first of all, and thank you for sharing your story. And I would like to share a story of my own as well. I was talking to you back then about, so I broke my elbow 3 months ago, and until now I still don't have a complete range of motion in my elbow. So I learned how to accept my elbow, how to accept my body the way it is now, for me to actually not look at the aesthetic, but actually just appreciate every degree I get with every physical therapy session I do, to every degree I gain is a positive, it creates a positive mindset in me. And for me, that is body positivity. Body positivity was when you accept your body and you accept who you are, not how you look. Accept the functions of your body. Accept that you are a strong individual, that you are able to do functions, that you're living, that you're breathing, that you're actually doing activities that you're doing as a human being. Not focusing on how the magazine shows, I don't know, a model who's done some crazy amount of surgery, like to look that fit, or someone who's gifted, or I don't know. But comparing yourself to another person is a wrong, I believe it's a wrong thing. So you have to accept who you are and work and keep working on your body. Now, as an expert in the field, I do have a lot of hands-on experience with this. Like, I have a lot of clients who come in here and just tell me, like, okay, Mark, I want to lose weight from now until 2 weeks because I want to look fit in a wedding dress. And this is absolutely ridiculous, because I tell them, like, why do you want it? Because she's like, yeah, I got a wedding dress that fits perfect, and this looked perfect on this celebrity. So this is where it's all wrong. And this is where we come in as professionals, to help people and like open their eyes that it's not only about how you look, it's how you feel, because it's about mental health, it's about well-being, it's about your body function rather than the way you look.
Thank you, Mark. Now, coming to you, Dr. Peer, you are a veteran medical doctor as well as a veteran psychologist. We would like to know your understanding of some common misconceptions prevalent in the society about body positivity or body shaming.
Yes, I will start by saying that body positivity is a movement or also a mindset that advocate the celebration, the acceptance, and the inclusivity of all bodies, all the shapes of bodies, and all types. And there are, we could say, 4 branches of psychology that take care of it. The social psychology, which study the cultural and the social problem linked with the shaming and linked with the attitude that create problem to the person that has different bodies. Then there is the positive psychology that try to help people to accept themselves and to have a positive attitude with your body. Then there is the media psychology that works for the communication, works for helping the information around the body positivity. Then there is the health psychology that helps, of course, the people to be in shape, to do fitness, and to better their body. But what is missing? Imagine, follow me, imagine a square, and imagine a circle around the square. The square is the body. The square is what there is on the stage, and the circle is the backstage. Our normal experience is we only see the appearance, we only see the evidence. But for all traditions, the evidence are illusions. There is something behind. From the appearance comes the essence. In psychology, we call it the self. So we could say, instead of speak of body positivity, we should speak of bodies positivities. Means the physical body, the energetical body, the emotional body, the mental body, and the spiritual body. In this way, we could call the self, I call this organismic self. So when we look to someone, we don't see only the shape of the body, but we see all the bodies. But to do this is not enough to say, I want to see you, accept you, or to look at a mirror and say, oh, I am fine. We need to shift in your state of consciousness. You need to master your inner experience, if you stay in our rational, ordinary mind, we only see the appearance. And we are judging ourselves. If we are judging ourselves, how we cannot judge you? To go beyond, so we should understand that the circuit of experience is feeling, acting, and doing. The more we keep together the feeling, the acting, and the doing, the more we are integral or holistic. If we are integral, we shift into consciousness and we go from the knowledge to the awareness. We become aware to see ourselves, to disidentify to our content, to our feeling, to our judgment, and see ourselves as a consciousness, to see ourselves as a self, and the self has no boundary, and the self is a subject with no space and no time. We can feel when I see you and I see me. I see you and I see me. Of course, there are the boundaries, but these boundaries are not something that differentiate or separate. These boundaries are bridges, that are doors that open the connection between me and you. In this case, we all are one. This is not just something new age. This is something that you see. The more you are integral and integrated, the more you master your inner experience, the more when you see a shape, a body, you see a soul, you see the story of this person, you see all the sweat, tear, and blood, and the work that the person did to come as it is. And if you are able to see this, to see you and to see the other in this way, you don't need to fight for accept. This is normal. So the self-acceptance is something that happens, is a collateral effect of being in contact with yourself and master all your bodies.
Thank you, Dr. Pierre. The next question goes to you both, Dr. Minerva and Dr. Pierre. Both of you are being medical doctors, and Dr. Minerva, you have been the director of medical psychiatry in US for almost more than 25 years. So we would like to know from both of you, what in your humble opinion are the common connection between mental health and body positivity? And how can improving your body image, contribute to a better mental health?
Well, I like to comment about that because there's a huge wave in California where I practice, in which actually the governor is making kids have the right to go and change their sex without having permission from their parents. We were taught in medical school that sex is really defined at birth and at age from 9 till adulthood. There is a secondary sexual characters. Those sexual characters are affected with socio-economical hormonal status. So if there is a defect in the hormonal development due to obesity or anything else, that definitely will make some problem in the progression. And if there is a socio-economical status, like the kid at the house sees the mom is a very tough one, he will become very much kind of like having that he is not a very successful in having his sexual character as a male, and so on. But the sad part of the situation is now the social media is encouraging that more than usual. And they're teaching the kids, like, come out of the closet. Come and tell the whole people that you are born to be different from the sex where you are. I frankly see it, satisfaction is an endless wealth. If you are satisfied with what you got, you are on the right track. And that happens at school and at home. Both of them direct the person from childhood to make him understand. First, this education, if the mom starts to see that there is a difference in the person accepting his identity, accepting his obesity, accepting everything else direction with school. But as mental health in California, I'll talk about it, it's really not accepted because the stigma stays with the person. Regardless of what happens, one incident of a person get drunk, for example, and end up in a mental hospital, it keeps harassing him or her for the rest of their life. Thank you.
Dr. Peer, what's your take on this question? How does body positivity contributes to practicing body positivity contributes to better mental health?
How contribute?
How does body positivity, practicing body positivity, contribute to better mental health?
As I told, to me, we should open the box and see, of course, we define something, body positivity, but we should open that box and see that body positivity is self-positivity. So it's connection with our true nature. We could say that any disease, any trouble with our body starts from to be far from ourselves. The more we reduce the distance with our true nature, the more we go beyond, and the more the problem of body positivity disappear into the follow your true nature. That is, of course, this follow true nature from the circle, from the backstage, appear on stage through, for example, be in shape, to do exercise, in master your emotion, in have a good mindset. But all these are manifestation of the core, the self. That is, I know I am in contact with my own rhythm. I am in contact with my true nature, which is, again, beyond any appearance, beyond any judgment on myself, beyond any maps I create. So we should name things, but also see that these names are the door to go beyond. So in this case, of course, we are speaking about body positivity, but don't stay close into this positivity is a window, is a door to speak about our self, because we are one.
Thank you. Thank you for your answers, both of your answers, Dr. Minerva, Dr. Peer, very enlightening indeed. I would also like to mention here, embracing your body positively not only improves your emotional well-being, but also reap cognitive benefits, like it reduces the cognitive distortions, the negative thought patterns that you often gel with because of your body image or body shaming. And it also helps one to discover and focus on their creative likings or pursuits if you embraces your body positively. For example, arts, music, sports, whatever one likes. And it allows individuals to focus on their thoughts and to focus their thoughts and energy on more fulfilling pursuits like related to their self-care, hobbies, and grooming, and goal-directed behavior. Now coming to you, Francis. As we're discussing before this session, you have talked about a real-life case about body shaming in your country, prior to this panel discussion. So that has been targeted by the social media in your country, right? So what, in your opinion, do you think that role of media and advertising play in perpetuating unrealistic, beauty standards, and how can we challenge these narratives?
Thank you for the question. First, I want to address that today the subtitle of the day is apparently a holistic view on things. I think it's good. From Peer, I learned we have bodies. From my neighbor, I learned there's also a gender perspective. Now we go to social media. Body positivity. On social media, everything is hashtag. And if you want to speak yourself about body positivity, it's #BOPO. I think if I listened very well to Pier, we have to say #BOPO's, but it's #BOPO. And I come from the Netherlands. And there is a television cook. And she started her career at a young age. And she was 55 kilograms. And she traveled all over the world to cook with chefs and so forth. And everything she cooked, she likes a lot. So she gained weight. Yeah, apparently. But she thought to herself, okay, #BOPO. And then I post pictures of myself. She had a contract with a lingerie brand. So she posted photos of herself, her perfect body of 90, 95 kilos in lingerie, #BOPO. What happened in the Netherlands was fat shaming, telling her she ate too much, telling her she was a fat pig. So this year she started to go on a diet. So then everybody was saying to her, it's not real. All the pictures you gave us, it's not real. But from a healthcare point, she has to lose weight because all her blood levels were not in order. She is, I think, my size. And then when you are 95 kilos, I think your blood levels are not so okay. And the body positivity vibe is about body acceptance, body appreciation, body love. So, wrap it up. Body celebration. And when your mind is set on you have a fantastic body, despite the kilos, it will help to look at a healthier point of view of your life, and it improves your well-being. And on the topic well-being, we are all in this audience, we are human beings. How about a well-being person? So I think we have to consider, when we look at another person from a holistic type of view, so what do I see? Is it only the body I see? Or do I see a person with lovely intentions? So that was my story about my country.
Thank you, Francis. Dr. Minerva, would you like to add on, answer this question?
Well, the social media really has a lot of impact in the United States now. It's a big wave of kind of like making things worse for kind of having control over kids. And actually, sadly, also you see the kids' cartoons. You know, they are talking about homosexuality and profanity, even kids who are like 4 or 5 years old. So I would say that there is a lot to be kind of corrected here. And unfortunately, there is a lot for the social media really need control. In the past, they used to have control over that, but now it's kind of like nothing is controlled. And unfortunately, also at schools, the teachers and principal and everybody is scared because of the legal system. Because if you try to discipline a kid, even the parents are scared to discipline the kids. You try to discipline the kid now has the right to call the police and say this or that, you know, is the father is just hit me or did that. The parents, they end up in jail. I'm not giving you fake stories, you know. And the kid, unfortunately, doesn't know what's his well-being. Then he ends up being in a foster care. And it's kind of like there is a lot of correction needs to be done. Hopefully, you know, by time things would be better. But I would say I'm one of the people that not happy about what's going on. But I had kids, and my kids, I managed to raise them, and I don't believe in hitting kids, but you just kind of like, you discipline them. You don't give them what they want, you know. But in the same time, it's a very tough situation to raise kids in the United States, especially being a physician. Me and my other father is a doctor too. So it's a different system than I see my relatives in France or Greece or other areas. They don't have the same system that we have. Thank you.
Thank you. Now coming to you, Dr. Vipin, you are being a gynecologist. And do you think that body positivity intersect with the concepts of health and wellness, and especially among the women after postpartum period or after delivering a child?
Actually, thank you for mentioning something about women. It's very important actually in this setting we are living in. So being a gynecologist, day in and day out, when we sit in the OPD or in the inpatient, what we see is women comes depressed or with low esteem. Reason, low acceptance in the society, among peers, in the house, in the family. Reason being abnormal body shape, size, bodily hair, acne, not living up to the expectations. So why does this happen? So I just tell to them, if someone says me, and I want a body of Arnold, and I work hard, but then I fail to achieve it, and I get depressed. Does it make sense? I think it doesn't. It is meaningless. The importance is we enjoy the strength that we gain through this process of helping ourselves into the society is more important than just criticizing of what we are being. So that is what the concept of body positivity a woman should embrace in. And as far as self-acceptance is considered, so again, there is an important quote I have heard somewhere, that the most powerful words we say are the words we say to ourselves. So if a lady accepts herself, the society will accept her through that. And for that, as all have been told about the holistic approach, how to follow that, and yes, it matters. Respect the diet we are going through, having physical activity, reading, being a learned person, which makes you happy, and that makes you more acceptable. So apart from these two, as you said, most important thing comes as well-being. It is very good to celebrate the body we have. It is good to be what we are. But in some context, it is very important to keep ourselves well or healthy. So in that context, if you ask me, if an adolescent girl, in matter boy also, comes with being shamed in the school to the family, or even shamed in the family by parents, grandparents or siblings, saying that she's fat, she needs maybe medical care for her genetic causes. She may be having hormonal imbalances. She may be having polycystic ovarian disease. The hair growth may be because of, again, testosterone. So these things need to be taken care of. So rather than shaming, it is important she understands that this can be taken care of in certain extent and I need help. So this we need to inculcate in them. Same if you see in a reproductive age group, a lady who wants to become pregnant, she's not conceiving. Again, she has been shamed for that thing. You can never become pregnant. And that again, she needs support. She needs to be investigated. And most important sensitive matter you said is about postpartum period. Because a lady is very delicate that time. She's very sensitive. What she needs is support from her partner, from the family. And sometimes we forget to give that. And Mohit, you know, there is a social stigma going on, which says that the most common reason the women become fat in this postpartum period is because of lack of discipline they have. They keep on sleeping with the child and sleeping and sleeping. Come on, actually a mother, hard-working mother of a newborn baby is nothing apart from to be called as a lazy. So that's the point of understanding, because these women can later on lead to so postpartum depressions, and which is actually take a big toll in her life. There have been suicidal cases which have happened to my patients also going through postpartum depression. So it is not a small topic of just being positive about my body. There are a lot of aspects to it, and I'm so thankful that everyone has brought different aspects. Thank you.
Thank you, and I think many of the women can relate to it very pragmatically, because this is what every woman somehow in their lifetime have experienced after delivering a child, right? And it's just not about PCOD or something, it's about most of the women after delivery or during delivery, they develop diabetes, they develop hypothyroid, you know, and these issues are also, they need to be addressed, and these might be causing, the change in their body shape, weight gain and all that stuff.
Very true.
Right? Mark, as Dr. Vipin had just discussed about this body positivity among women with certain medical conditions like PCOD, hypothyroid, or postpartum diabetes. In continuation to that, what do you think as a physical therapist are the ways to navigate societal pressures related to dieting, weight loss, and appearances without compromising our physical health and, of course, mental health?
There's a saying that I love is eat good, feel good. Okay? What does that mean? It's not the feel good foods, which are pizza, burgers, and like junk food. But it's important for someone to know what they're eating rather than counting only the calories. Because I read like a small article today in the morning. There are a group of students who care, teenagers, who care about the calories in and out rather than what they're actually eating. That's a very important matter, and that's a matter to be not to forget about. Okay.
Like restriction of calories.
Yeah, not prescription of calories.
Restriction.
Yeah, it's like you have to know what you're
Mindful
eating.
of
Mindful eating. Mindful
eating.
eating. Okay, if you want to say that. So it's important to have proper food, and when you eat well, I've experienced this firsthand, and I've experienced it with a lot of clients at my gym. When people start eating well, I'm eating a well-balanced meal, a meal that has all the macros, all important nutrients are in that meal, your body will automatically feel well. Okay, so that's as much as nutrition is as important as every other thing everyone mentioned here. So absolutely, it's not right to think that the easy way around is to take a shortcut. There is no shortcut.
Not sure, yes.
So you have to wait. It's like looking at like an Instagram reel of a model or a bodybuilder, like saying like, I want to do that, and they start advertising some sort of, I don't know, products that are not heard of, and you want to get shredded in 5 days, take this. And like, this is ridiculous. You know, it's sad that a lot of people follow that and believe that is absolutely true, where it's just they're ripping your money off. That's it. But following a good balanced diet, following a good balanced day, like knowing when you're going to sleep, knowing when you're going to eat, knowing when you're going to exercise. And I emphasize on exercising because like I don't have to say that, like I think everyone knows how important it is for mental health before getting to physical health as well.
Thank you, Ma. Nil, now the question goes to you. Your professional background talks about self-esteem, inner confidence, calm, right? So being an expert in that field, a leadership expert in that area, could you please shed light on strategies for practicing self-care, inner calm and confidence, particularly when it comes to body shaming and body image?
Right, so we're talking about the positivity, and what is the opposite of the positivity is actually
body shaming.
Negativity, that's right. So just maybe asking you people there, if there anyone who never, ever, ever in their whole life thought negative about themselves, just raise your hand. 1, 2, 3. 3 people in this room never, ever thought negative, which means the other ones, at least once, thought something, whatever, about themselves. And the thing is that half of our time we are thinking about, we're having this self-talk with ourselves. And this self-talk could be negative or it could be positive. And what kind of self-talk we have in our head is actually determined by there is something called nature, nurture. So there is DNA, which I'm born with, but also it's an upbringing. So thanks really a lot for mentioning this and the cultural issues women have, or even men have, and also social media. So all those schools we also heard today. So all of this affect our self-talk. And the thing is that whatever we had in our past, whatever our DNA is, we still can learn the positive self-talk. And it's just not a theory. I mean, there are many research already since 2 decades we have from positive psychology about learned optimism, which means we can learn whatever circumstances, internal, external, we can learn to think positive about ourselves, which means I can learn to trust myself, I can learn to accept my body and say, okay, I can walk, that's a gift already. Maybe I'm not a model, but I'm okay, you know, my body is functioning, what a gift. So already being grateful just for a little thing, I can see, I can breathe, my body just works, so that's already very good. And the thing is, with confidence, we say you could be calm and confident, not dependent on anyone or anything. Obviously, we have external world, but still there is this inner strength. Okay, I may have this shitstorm going on my Instagram account, but still I'm calm. I say, yes, well, I am 46 years old. I cannot look like 25. You know, that's true. Okay. You know, just having this calm and accepting. But obviously, there is a way. And someone told this today about those negative self-talk, like, okay, listen to them. And they are actually the door to something deeper you can find within yourselves.
Thank you, Nell. So finally, we have come to an end of our panel discussion, and I would like to thank you all, our esteemed panelists and very patient and thoughtful audience, you know, for making this discussion great. And just one last question to all of you. The key takeaway in one line for our audience. Pierre, I'll start with you. A one-liner.
I should say that duality is the most problem. For example, as the Gospel of St. Thomas said, nothing that comes from outside can affect you. So if you stay in the first attention, what if you blame me, I feel hurted, but actually you were the person that did something wrong, not me. So this is a challenge to me. I saw a story about Alexander the Great, that is one of the most great person in the world. He was a father of him, tried to kill him. Imagine, your father want to kill you, and he became the greater. So it's not what comes from outside. You have to go beyond the duality, fighting the problem. This is not a problem. To solve the problem dissolve, never solve. If you try to solve the problem, you give power to the problem. You should go in another place. You should see that this is a challenge, this is an ambush, and go beyond and say, this is you, not me. And in this way, you can takes the qualities inside to answer and to go beyond.
Thank you, Pierre. Francis, a one-liner, please.
Yeah, a one-liner is, I think, do not focus too much on numbers. The number of your scale, the number of your body mass and the index, because I'm at a certain age and I shrunk 2 centimeters. I weigh the same. What happens to my body mass index? It goes up. But I don't worry about it. So don't focus too much on the numbers. Be kind to yourself.
Thank you, Francis. Dr. Minerva?
Well, I would say again, satisfaction is an endless wealth. You have to be happy with what God have gave you. And if you accept what you have, you will always live happy. As a physician, I like to give time to my patients psychologically to make them accept their illnesses, and that is very important part of the treatment. That's all.
Dr. Vipin?
Okay, actually, there is a saying that there is no wrong way to have a body. There is always a different way to have a body. So we should accept that. And just last one thing, there is something called a concept of open dialogue. If you bring that concept in your family, among your peers, in your workplace, that itself solves most of the issues what goes around with body positivity. Thank you.
Nell?
I would like to add to all of this what already been said. Focus on building and nurturing a relationship with yourself. Because when you accept yourself, then whatever happening on the outside, it will be just happening.
Mark?
I would say something I tell my athletes and my clients as well. You're stronger than you think you are. Never underestimate yourself.
Thank you. And I would like to conclude by saying one-liner that there is no way to have, no wrong way to have a body. Express gratitude to the universe to keep you safe and alive. At least we are not ghosts. Thank you. Thank you.
Thank you.
Thank you.
Thank you so much to our wonderful panel. All I'm going to ask is that you all stand up, take a step to the front of the stage so we can get a lovely group photograph. If you can, yeah. We can step to the front so we don't get all the glasses and the bottles and mics and all things in the way. That's it, that's lovely. Let's give a round of applause for this amazing panel. And kudos to our moderator who kept everything flowing so well and keeping to the time limit. Thank you so much. You're very welcome. I think this one's mine. Yes, it's mine. All right, so I am happy to be introducing our next fire chat. Yes, our fire chat is coming up. So not so much a panel discussion, but we are going to be taking a deep dive into food insecurity. So imagine navigating the complexities of everyday life where the very foundation of our well-being, our access to nutritious food is not guaranteed. This is the reality of food insecurity, a pressing issue that leaves millions uncertain about their next meal, affecting not just their health, but their ability to thrive and succeed in society. Very good. So I would like to bring up 3 speakers who will be diving into food insecurity and the nutritional health, understanding the influence of social determinants and consumer well-being. I'm going to invite Dom, registered dietitian and personal trainer at Pentagram Health. Also inviting William Cook, MD, as well as Dr. Sushil Kumar. Thank you very much, gentlemen. Just pick up a microphone and the stage is yours.
Hi. Good evening to everyone. I am a biochemist, doctorate in biochemistry, and I am a founder of Diva Herbals Private Limited. What we do, we actually give healthy longevity in a more comfort and user-friendly manner. So we were talking about food insecurity. So reaching a food to everyone is one thing which we every time talk, but reaching a good quality food to everyone is very important thing. So in India, like we have our tradition using our herbal and natural resources. So what we are doing, we are harnessing the power of natural resources and optimizing the goodness of those herbs and natural resources by using modern technology. So we are trying to avoid all kind of chemical processing, preservatives which are going to give bad effect to your health. And then, so what we are thinking, we are just trying to make health as a second nature. And wellness should become a lifestyle. So instead of acquiring the wellness products without thinking about the products, without knowing about the products, and or going for one time for detox process or for any kind of wellness process, and then coming back again in the same way of managing your life, it is going for a short-term kind of prevention. So instead of making your daily life routine by using the products which can be used on a daily basis, like water or food. So this is the way we are working, and we have very important topic today to discuss. Dr. William and Dom is there, and we'll have a very casual chat on that. And our personal experience we are going to share with everyone. So this is my introduction. We are currently, we have our products on retail sectors. We are on online, Amazon and Flipkart. We are also exporting in some countries. We are here in Dubai planning to open our office. So we have some meetings and all. So we are expanding, and we are also working to develop a network of wellness experts. So we are meeting to lots of dietitians, preventive healthcare experts, and making a network so that we can make people aware about the products which we are going to bring in the market. So over to William.
Hey there. Dr. William Cook, practiced medicine in Indiana, in the heartland of the United States. And it's ironic, Indiana is known as being a farm country where food is very available. But the town that I practice medicine in, it's considered a food desert. And we have seen firsthand the result of what happens when people don't have access to their basic human and safety needs. Our life expectancy in the town where I went to practice medicine is about 10 years to 20 years lower than the rest of the state. In 2015, the area became well known as a center for the worst drug-fueled HIV outbreak in US history, directly related to poverty and drug use. And it all goes back to whether or not someone's basic human and safety needs are met. And as I said, it's ironic to think that Indiana is known as a farming state, to think that people are going hungry there. And there's 4 basic principles that I want to highlight related to food security as it relates to a social determinant of health, whether or not someone has access to health, because that's what we're here to talk about today is health. Oftentimes, you know, we see disease, the outpouring or the manifestation of consequences of what has happened to someone. And the 4 things I really want to highlight are whether or not the food is available to the people that we serve. Even if it's available, is it accessible to the people? Can they afford it? Can they travel to get it? And the third part is whether or not they can utilize that nutrition in food. Do they know how to prepare ingredients, how to prepare a meal? Is their body healthy enough to utilize the nutrition when they take it in? And the fourth one, it kind of goes over all three of the other ones, and that is whether or not those three aspects are secure or not. Is the availability of food and nutrition secure? Is their accessibility to the secure? And is the utilization of those things secure? Now, I believe that there are toxic conditions that are harming people in our communities, and this is just one way that we can intervene in someone's life to bring not just a relief from disease, but actually bring health to their life. Dom?
My name is Dom. I'm registered dietitian, nutritionist, personal trainer, mindful living coach. I have 4 university bachelor degrees, dozens of academic degrees, and a couple hundreds of certifications from field of health and nutrition, wellness, exercise. I help people build essential, sustainable nutrition, lifestyle skills, and habits so they can lose fat, build healthy, strong, and lean body. And we also do medical nutrition therapy and dynamic neuromuscular stabilization so we can prevent, treat, and cure acute and chronic illnesses, including autoimmune diseases. And here we're going to discuss how the food actually affects your health, and I'm going to share my story, personally, how I solved my health issues just by using food, proper, clean food.
Dom, you told me that physicians failed you. As a physician, that kind of hits home because we go to medical school to learn about diseases and how to prescribe medications, but that's not always the answer.
Yeah, that's true. I'm going to start with my story. When I was a child, I got hit by a truck. I went to the hospital. The surgeons cut off 13 centimeters of my skull just to see if something is damaged. There was no any damage. They didn't close it. They just patched up the skin, so I have skin missing. Later on in my life, I went to the hospital. They wanted to check if I have diabetes. I have hemophilia, and they placed brownilla in my hand, which is the needle that, as a hemophilic person, cannot be even near my body, even less in the body, which resulted in getting pseudo-aneurysm in my cubital region. After a week, I ended up in hospital with almost amputated hand because the aneurysm became 1 centimeter square, cubic, 1 centimeter cubic. I spent 13 months in compressive bandage because doctors didn't have courage to operate it because the situation was so bad. And it's caused by their own mistake because they didn't listen to me when I told them, I'm in pain, you cannot place me this needle, which is one of the problems because doctors are not listening to the patient. They're just following the protocols, what's written on the paper, how to do treatment. But if you are not engaging with the client, with the patient to see what's their opinion, do they have any complaints about the therapy that they're getting, that needs to be changed. And later on, I got yellow fever vaccine. 3 days later, I developed psoriasis and psoriatic arthritis. You can see that I have psoriasis here, here, and some other areas of my body. 5 months later, I ended up on wheelchair. I got prescribed 180 medications per week, 4 tropical creams, and 6 months of physical therapy per year. During that time, my situation was getting worse and worse because all of these medications had effect on my body. Physical therapy was A, B, C group of therapy, not individual physical therapy that I need because my arthritis went on the hips and the spine, so my spine ended up completely locked. I couldn't bend forward to tie my shoelaces. I couldn't lay on my back. And then I started to decide that doctors are not here to help you. They are just treating the symptoms. Nobody is addressing root cause and curing the problem of the root cause. I started to study nutrition. I finished multiple bachelor degrees in nutrition and associate degrees around the world. I studied psychology. I developed the Hero Nutrition System protocol of medical nutrition therapy. I removed arthritis from my body. Even inflammatory markers for arthritis in my body are non-existent anymore. Arthritis, which doctors are saying is autoimmune disease, no cure, nobody can cure it. Here's methotrexate, here's 10 milligrams, 20 milligrams, doesn't work. Here are injections of methotrexate and enjoy. I solved that just by changing my nutrition, because quality food is building block of your body. If you are eating healthy, your body will be healthy. If you are eating unhealthy, your body cannot be healthy, because you need micronutrients. On previous panel, people mentioned that you need macronutrients. You don't need macronutrients. You need micronutrients, minerals, vitamins, and trace elements for your body, because this is what actually builds the body. Macronutrients help, but they are building just bigger chunks. But usually, most of the diseases are caused by micronutrient deficiency. And when we address the actual root cause of the problem, which is macronutrient deficiency, we can actually start treating the health issues properly.
You are a fighter, huh? But I was going through William's profile, and I found he has a very unique way of managing their patients. So I have seen that you have got lots of award on that. You have something like team building solution for like community method to serve the poor people also. Then you have something not only physical cure, you also go ahead and do the mental and spiritual caring for your patient. So it's not in your profile, I found it's not a simple like ABCD, the protocol to follow as a doctor, but he just go ahead and do something else for the patient. So give some personalized care, you can say, to the patient. So can you give some examples like how you have done this with your patient?
Yeah, it's my belief that anytime one person of the team elevates themselves above the team, then we throw everything out of balance. And you know, Dom spoke, I think, very well to that. Sometimes physicians elevate themselves above the rest of the team.
Yeah.
And yeah, we're trained really well on pathology, disease, medications, those sorts of things, but we're honestly not trained all that well on the nutrition part, on the food and the mental part, the spiritual part. A lot of that's missing in our education, and we really need to rely on the expertise of those around us. And I want to highlight one member of the team that's often forgotten, and those are the people with lived experiences. Dom mentioned how physicians don't always listen. We don't always hear because we don't have those lived experiences. But if we bring people with lived experiences into our team, then they allow us to better understand our patients. In my area, you know, I never used drugs. I've never been homeless. I've never really gone without my basic human and safety needs being met. But a lot of my patients, they experience that on a daily basis. And so what we did was we reached out to the recovery community and we asked people with the lived experience of homelessness, of drug use, of being a sex worker to come work in the clinic and allow someone a safe place to come and share their story and allow us to hear them in a way that we may not have been able to hear before. And by working within a team approach, we're surrounding that person with the true care that they deserve. Because you know, medicine isn't the answer. It's really that human connection, digging down to the foundations of what it is to be human. And unless we honor that, we miss everything and the whole reason of being here in the first place.
Yeah. So do you face also the food insecurity challenges with your patient, and then how you resolve this?
Yeah, so I practice in Scott County, Indiana, and I go into it a lot more. I wrote a book called Canary in the Coal Mine. I go into it a lot more, and I welcome you to read that. I named it Canary in the Coal Mine because I do believe that there are toxic conditions harming people, and we need to pay attention to the canaries in the coal mines. But in our area where food insecurity is a real thing, we did several things. One, we partnered with a community organization to open a warm meal kitchen, you know, once a week where the community could come in without any sort of restrictions, no programming. It was just a safe place for people to gather and eat. At least once a week, they'd have a warm meal. And the other thing we did was we partnered with the schools, knowing that the children growing up never having access to fresh fruits and vegetables, even though they're in the middle of farmlands, they've never grown their own food. We partnered with the school to bring in food towers, which are basically towers, and you plant food in them. They grow right there in the classroom. The students learn how to provide the plants with the nutrition that the plant needs to be healthy, and they watch the plant grow. And they grow vegetables right there in the classroom with a curriculum around it. What is nutrition? What are those basic nutrients that every human really requires in order to be healthy? And then they bring their families in, and they have a meal, and they maybe for the first time a lot of the times experience having fresh vegetables prepared for them, teach them how to prepare them, that they are good to eat, and how to grow them at home. So those are some of the things that we did locally.
Do you have in-house expert like Dom with you to design around the food?
Yeah, unfortunately, we don't have a lot of expertise in the area. So we have been reaching out to try to bring in like a nutrition specialist. There's a community organization that has someone who is learning still. And then we've partnered with another organization who has a nutritionist that we're hoping would be available at least by telehealth, where we could bring the patient in. And even though the patient may not have broadband or cellular access to where they could meet with a nutritionist through telehealth, they could at least come into the clinic, and we could be able to provide that access to them that way.
So Dome has very unique way of designing the diet chart for your patient, I think.
Yes, I do.
Yeah.
I want to just add something about when William said about toxic effect. Who thinks that we are eating food? Hands up. We are not eating food. We are eating food like products. Food stopped being food more than 50 years ago. Because now everything is created just for mass production. There's no seeds in the fruits, vegetables. Everything is just created and farmed on wrong way. On same earth is same vegetables grown multiple years in a row. The earth is micronutrient depleted. They're just fertilizing for the things to grow. We are just getting one fraction of micronutrients that we are getting. That's why what Sushil said about his company, he's offering supplementation with these things, which is good thing. Because we have food, we have whole spectrum of the food. We can eat organic apple, or we can drink apple juice that we buy in the store.
A good example of that is in the United States. You've probably heard of Flint, Michigan, and the water crisis that occurred there. We often think about the United States as being the place that has the most resources in the world, but even there, sometimes the water can be toxic. And there's a whole generation of kids that were exposed to toxic water growing up, and that left them with a whole host of different diseases.
Correct.
And I know that your company really focuses on water.
We do that, yeah. So I was chatting today to one of the doctors. She was one of the panelists in the previous panel. And we were talking about the water, importance of water. But she was saying that, I just asked that why cancer cases are increasing. So she was saying that when she was young, one or two very rare cases of cancer used to come. Now, every time, like it's kind of flu. The reason when they try to find out is the water. So in water, there is a packaged drinking water. If you see the bottled water, there are some chemical inside, which if you drink it today as a fresh bottle, and then if you drink after some time, if the same bottle you are using, some reaction is there which is giving the free radical generation inside your body.
It's called plastic microtraces of the plastic. It gets absorbed in your bloodstream, and you have a problem with permanent plastic in your body.
So that's a major issues are there. Like we are also developing some health drink, we call, but the health drink is form of water. So in our case, we are taking just a natural water without any chemical processing. And then we are taking a herbs. Like you can say that mountain waters are coming, but every time you can't go to the mountain and get that water, right? But how mountain water is good. Once I was with my family towards Himalaya in India, and we were not buying any bottled water. So we were just collecting some water and drinking it. It was so good for our digestion. We were just having heavy food and just drinking those waters. So during that time, I felt that this kind of water has to be there everywhere. So, but how that water is good? Why we say that water is good? Because it coming through that mountain, there are minerals, there are herbs, it's coming through that, right? But as a scientist, we thought, okay, in herbs or plant source, every time you'll find some heavy metals, depending on what soil and what kind of area it is. If we use some modern technology to reduce the side effect, reduce the heavy metals effect, and increase the active ingredients effect in those herbs, like we call for digestion. Triphala is a herb. 3 herbs are there. We call Triphala in India. So it's very good for digestion, people say. But every time you can't take the huge quantity of Triphala and have it. You can't do that. So if you convert that using some technology with a minimum quantity in your water, it will clean your water also and give the functional effect of Triphala in your body. Similarly, ashwagandha, it's now globally people know about ashwagandha for immunity. So lots of herbs are there in India, traditional herbs, which we can optimize using modern. Our like forefathers used to do that. No? Like 50 years back, you said that the plant used to be actually food because very organic manner. No chemical fertilizers used to use that time.
Yeah, no insecticides, pesticides, herbicides,
Yeah, right.
and everything
So
sprayed on it that ends up in the fruits and you end up it in the body.
Right. So with the time, time is changing. No? So developing countries, now developed countries are there. So reaching food is very easy with this IT infrastructure. So lots of technology development. So we know how to reach the food, where to reach the food. Government is doing their own measures. And they are providing food to everywhere. So food insecurity is the way we talk about conventional way that it should reach to the people. We always talk awareness about the quality of the food, why we have to take that food, and why we should, how to measure that food has good quality is very important. So recently, I was just listening one of the interview. There is a doctor, Gladys McGray. She is as considered as mothers of holistic wellness. She is 103 years old and almost 45 minutes interview, very interesting interview. So when she was on 83, she was saying that in Afghanistan, the death of women is, the percentage of death of women is more than the world, anywhere in the world, especially during the pregnancy. So why it is like that? Because as a conservative country, they were not opening up to find out the way. Then she got the responsibility to go there and find out the root cause, why it is happening. She went there, she discussed with lots of people there. Nobody wanted to take their wife for the discussion. So she went and then she started discussing with the mothers. And then almost 30 lady, she brought in a room for 10 days. She started discussing with them why it is happening and how they just go for a week or during the pregnancy. So they started opening up, and what they were doing, they had lots of restriction of food –
'
during the pregnancy, which was very important for them. It's not they did not have money to buy it, or it's a very poor like society. It's not like that. But because of the cultural restriction, during the pregnancy, the delivery time, for 2 to 3 days, the restriction was to not have any food. So it's kind of hypocalcemia and anemia kind of issues they were facing, and the child and mothers both were dying. So it's a huge challenge. Then she explained about the importance of the food, the quality of the food, the quality of the nutrients to them. And within 6 months, everything changed. So it is very important with time, we have to think about this food insecurity or nutritional wellness for the society.
Yeah, there's not a medicine that could have impacted that community as much as just the education
Yes.
that was provided about nutrition. That's an incredible story.
Right.
I would love to hear from the audience
Yeah.
if you all have questions or comments.
You can use that mic, I think.
You know, my name is Vedant Pujari. I come from India. I'm a business lawyer. One of the things that I want to ask the panel, especially Dom, because you keep talking about the pesticides and things, which is true, which is what is, happening. But you see, we are 8 billion today, and 25% of us are staying below poverty line. We are very lucky. A few of us are here in InterContinental, and we can feed on good feasts. We have the luxury to talk about organic food. But organic food is expensive, okay? Now, with such kind of statistics, how do you think we can still, as Dr. Sushil said in the beginning, it's not just food security, but the quality of food that comes up. So what are your thoughts on this? How do we serve the entire world population, or maybe majority of it, with good food, without pesticides, organic food? Keeping the cost minimum and affordable.
Like when I was started to talk about the spectrum of the food, you have organic apple and you have organic juice that you bought in the store. You also have bio apple, eco apple, regular apple that you bought in the store, the apple that you blended in apple juice, and the apple juice. You have whole range of the foods to choose. We just need to educate people which is the best choice and tell them why. Because if we don't have access to the organic apples, but we have regular apples, regular apple is still better than drinking store-bought juice that's filled with sugars, preservatives, and other different chemicals. And we have enough land to grow the food, organic food. But that's not in interest of anybody. Because now it's interested to grow as much as food, throw away huge amounts of the food on specific areas, while we can export these foods and give them to other countries. For example, in Netherlands, it's good principle because I'm living over there. When something is going to expire in the store, it goes on huge discounts, so people can afford fresh vegetables that are going to expire today or tomorrow for 1/4 of the regular price. And that's the thing that even the countries overall need to implement. In restaurants, lots of food is being thrown away instead of giving it to the public kitchens so they can produce, like he said, couple meals, cooked meals for the people. We just need better management of the food because there's enough food currently being produced. Not organic, but if we start producing organic, we still have enough land and we still can produce enough organic food. Only thing, the problem is to find organic seeds now. Because Monsanto patented almost all seeds and you cannot grow it. United Kingdom had the fields burned because they used organic seeds that Monsanto didn't approve to be planted over there. So this is corporation influence on the food, the management, how we are getting the food on the table. You can always go buy to the farmer. It will still be healthier than one that you buy in the store that's mass produced. That's one of the options to get the healthier food. Yeah, it will be a bit more expensive than than in the store, but it won't be that much expensive like if you are just buying organic food.
I've heard mentioned a couple of times during the conference that food is medicine. It's really health, right? And if that is true, and we look at how much, the different nations that are represented here spend on healthcare every year, and we think about the stories, like Sushil mentioned a while ago, about how just a simple change in nutrition can impact children and pregnant women. You put those two things together, and maybe the answer is that we reallocate where the funding is going, and we reconceptualize what is healthcare. Is healthcare what's happening in hospitals? Or is healthcare what's happening when that child is born in a place where food is not available, accessible, or utilizable, or secure, right? And just think about how big the impact could be if all that money was shifted to the vital community factors that really impact health, like accessibility to food.
Yes, this is great, because today we listened about investment in different researchers in different things about genetics. Genetic diseases are 2 to 5% of all diseases. 95 to 98% of all diseases that people have are treated with the lifestyle change. It's preventable, treated, and curable. And if we shift the money from doing research for things that are treating 2% of the population on something that will help like 90% or more population, we are going to reduce cost of the healthcare, because we are not going to have that much sick people. But since some people here are investors in the pharmacy, we know that that will never happen, because the big pharma is a big problem. My life goal is to kick big pharma to curb, because if you can help the people without big pharma, you should be doing it.
Did you have a question?
I'd just like to make a comment. Food systems, something that I'm actively involved in my country. I come from the Philippines, a third world country, a developing nation. I just came from a conference in Nuremberg. I flew in early this morning, and they were talking a lot about organics, and they were talking about regenerative farming. And I had made a comment that I'm from the healthcare industry, and from my lens at least, I'd like to be able to shine the light on being able to manage the things that we actually measure, right? So when we talk about healthcare, it's about measuring nutrition. And in measuring nutrition, it could be fundamentally two things. If we measure deficiencies and we measure toxicities, then that's how we can drive policy. It takes a whole village to make people healthier. And it's by people like us having conversations with other sectors that we can really shine the light on what we need to pay attention to. And that's what I believe drives value-based healthcare. In the Philippines, we've driven the conversation to expand healthcare by first defining that what happens in the hospital is disease management. There's nothing wrong with it, except that it works much better when it has a foundation of primary care, which is led by a lens that underpins epigenetics and perhaps some biochemistry to understand nutrition. And so it takes a whole village, it takes multiple disciplines, and I think, having such a conference as this puts us in a kind of environment to have this kind of conversation and banter, and hopefully drive forward more meaningful systems and processes for driving better food security for everybody. Thank you.
Yeah, that's a great point. For example, how I do nutrition therapy for the patients and clients. I give them list of the blood tests, go to your doctor, bring me the results. Based on these blood tests, I know what's the situation in the body. I give them the diet chart. Tell me your lifestyle, everything. Do you have any health conditions? are you sleeping good? Like, give me like all your diagnosis, everything that you can about yourself. As much as information you give me, I can create better plan. I give them timetable, fill me the timetable with your schedule. When are you waking up? When do you usually have a breakfast? Do you exercise and when? When you go to sleep? And then based on all of these three information, I'm actually creating meal plan with them. They tell me, how much do you want for breakfast? 250 grams, 500 grams, 750 grams. You want each meal to have 1 kilogram? I will write you the 1 kilogram plan meal. I don't count calories because this is outdated. Whole fitness industry is using counting calories. Nobody is using toxic impact of the food, energy that food brings you, vibration that food brings you, and magnetic field that food brings you. Because it's not just one thing that you are getting from the food. You're getting a lot of different informations in your body with every bite. So each bite can heal you or kill you.
And our screen says the time's up.
Yeah. Thank you, William and Dom. So I think with changing of time, we need to think differently. So instead of only quantity, we can also think about quality. And most important thing is we should think about how to increase the awareness about the nutritional wellness. This is very important. And so now time is changing, and now people are talking about AI, artificial intelligence, and lots of IT tools are developing to enhance the awareness program. So government is already doing in some country. We should also follow in healthcare. Also, we can follow maybe data management of your patients. And for Tom, we also do some survey on a regular basis to find out which area, what kind of nutritional lacking is there. So in water or in food, how to manage that. So we have a research group of researchers, and every week we talk about the problems and gap in the society, which area and where, how to improve that by implementing some tool or technology. So I think in this way we can solve some issues on food insecurity, or we can make people aware about the nutritional wellness. Thank you.
I just want to give you something. Take a paper, because you have it on the table. Write down, every day I'm going to eat 8 different colored vegetables, 2 different fruits. I'm going to eat a couple feast of nuts and seeds. I'm going to eat 200 to 300 grams of oven baked on the greasy paper fish like sardines, tuna, and salmon. So it's important that it's oven baked and on the greasy paper, because that's the only way how omega-3 gets preserved while you are preparing the fish. Any other way destroys omega-3. So if you buy canned fish that they're marketing it's rich in omega-3, I can guarantee you if you go in the lab and test it, it has 0 omega-3 inside. And make sure to do this as much as you can, at least 80% of your time. And you will see that your health will drastically improve.
Thank you.
Thank you.
Thank you, gentlemen. If I can just ask you to take a step to the front of the stage so you can take a group picture. Yeah, your stage time's not over yet. Dom makes it sound so easy. Eat this, eat that, eat this, eat this, eat that. But then he forgets all the options that we have. You know, all the restaurants are coming up with these amazing things, and you just can't help yourself, can you? Yeah, he makes it sound so easy. Thank you, gentlemen.
Yeah, and one more thing. Don't eat grapefruit if you are on medications, because it's contraindicatory for all medications. But doctors never tell that to the patients.
Oh, wow. That was the mic drop of the session. I'd also like to share with you, I read a very interesting study about how microplastics are entering our diets without us even knowing. And through the experiment, they've calculated that we will consume a credit card amount in our lifetime. That is how much microplastics are currently in our food. And I find that particularly scary. I don't know about you. I find that very scary. All right, so we are ready for our next speaker. I am very excited about this because this just seems like it's coming from the future. It is a talk on how 8K imaging is revolutionizing and is the future of surgery. Please put your hands together for Dr. Hiroshi Shimamoto. This is your paper? Uh-huh. I almost took it. Do you want a handheld? Or do you want that? I'll bring you the paper as well.
Hello. Thank you. Good afternoon. Welcome to the speaker session. My name is Hiroshi Shimamoto from NHK Foundation. NHK is the Japanese Broadcasting Corporation. And it's my great honor to present our research here. Today I will talk about the future of surgery, how 8K imaging revolutionizing the field. This is a joint research between the National Cancer Center Hospital and NHK Foundation. Okay. Probably most people don't know what is 8K, so let me explain first. 8K is the highest video format for television. And the features are ultra high definition, fine gradation, and wide color gamut. So if you use 8K is the number of the horizontal pixels. So for a conventional HD TV, it has now 2K for 2,000 pixels on horizontal and 1,000 for vertical. So in total, 2 megapixels. For 4K UHD TV, it has the 4K for the horizontal and the 2,000 lines in the vertical, in total 8 megapixels. So 8K has 8K pixels for the horizontal and the 4K on the vertical, in total 33 megapixels. So 8K is 16 times rather more pixels than conventional HD TV. So, as you can see, the 8 megapixel 8K has a very much high quality for the video. So, if you see 8K image on a display, you can feel as if you are being there, or as if you are watching a real object. So as the 8K video system is an extremely powerful video system, we apply the 8K imaging, imaging technology for medical application. For medical application, 8K imaging enables high realism such as an texture of the membrane, and three-dimensionality such as the rise and fall of the body, and the naturalness of the color of blood vessels. We developed an 8K laparoscope and conducted 23 clinical trials of 8K laparoscopic colorectal cancer surgery at National Cancer Center Hospital. And the doctor's impressions were 8K laparoscope gives a realistic impression as if one were opening the abdomen and looking directly into the abdominal cavity, and even a three-dimensional impression. Another merit of 8K imaging for laparoscope surgery is bird eye view arrangement of laparoscope and the use of electronic zoom. For the current laparoscope system, such as 2K or 4K, the tip of laparoscope is placed close to the organ in order to observe the surgical site in detail. In that case, sometimes the lens is foggy by the oily smoke, or interference might be occurred between the surgical equipment or a big blind zone. But in our system, 8K laparoscope, placing an 8K laparoscope to overlook the surgical field and utilize electric zoom instead of physical move. In that case, it is free from oily smoke or interference or a big blind zone. Okay, we further extend the 8K laparoscope surgery system to the telementoring. Telementoring is a system that enables to support and advise surgeons from a remote site. And the endoscopic operation needs higher technique than open operation, but experienced doctors are unevenly distributed in that area. For example, there must be a hospital that, with a sufficient number of experienced surgeons, but unfortunately, of course, it also must be a hospital with the short of experienced surgeons. So in this case, 8K laparoscope image is transmitted to the telementoring room through the network with a video, and 8K video is displayed on the monitor. And there is an experienced doctor, and he can give support or advice to the unexperienced surgeons through the network and real time. So the doctor, unexperienced surgeons can do a much better operation. This is a schematic diagram of the 8K laparoscopic surgery system. The 8K camera image is displayed on the 8K monitor, and the surgeons see and do the operation with this 8K image. And at the same time, 8K image is encoded and transmitted to the telementoring site through the network. And the image is decoded and displayed on the 8K monitor. So the doctor in the telementoring room can see the detail of the surgeon image in the telemonitoring site, and give advice through the voice or annotation system. Annotation information will be back to the surgeon site and will be displayed on the monitor. And also the voice of that voice will be sent to the surgeons. Okay, this is the, some main parameters for the 8K laparoscope system. For the camera system, image sensor size is as small as 6 by 6 millimeters. Sorry. And the pixel count is enough that 4K, it has 4K by 4K. And the frame frequency is 60 Hertz. That will be commonly used for the broadcasting. And the camera's weight is as small as 210 grams. And the camera size is as small as this size. And the video output, we had 8K by 4K, so it means that 8K image and the magnified 4K image is displayed at the same time, side by side. For the network system, codec system, we use H.265. It is a commonly used codec system for the broadcasting. And the bit rate is 80 megabit per second. It is very important because if the bit rate is less than this number, the image might be degraded. So we have to keep more than this quantity. And the latency is also very important because if the latency is too much large, the communication between the surgeon and the telemonitoring room can't be no more continuous. So we tested and how much the latency will be acceptable, and it was 1.3 seconds. So we try to less than that numbers, and we now performing that the latency will be less than 0.6 seconds. And the network used fiber or 5G, and the protocol is UDP and RTP.
十分です。はい。そうしますと、こちら側に目を転じると、もう IMA がもうすごくきれいに。
This is an example of surgery experiment with telemetering conducted in 2021.
ここで切ってあげればもう十分ですよね。はい。そうするとここをまずちょんと開けちゃって、であとは下を消す。
Sorry, the advice is in Japanese, but this is the telementoring site, and the image of the endoscope is transmitted to the telementoring site, and the doctor can see the detail of the core operation image, and give advice to the less experienced doctors through the monitor and through the voice. Now, we are currently conducting clinical experiments on remote surgical support system using a high-speed, less latency network based on 5G network technology. And in near future, with 6G network, it will be ultra high speed. That will be more than 1 gigabit per second, not the megabit, but the gigabit per second. And extremely low latency, less than 1 millisecond, will be realized. So in that era, we don't need any compression anymore. So the 8K image will directly send to the target site, and latency will be almost zero. So the doctor can see the operating video image directly, and in that era, any surgeries and operations will be possible remotely and regardless their locations. So I sincerely hope that healthcare will become borderless in that area. So with technology. Okay. Thank you very much for your attention.
Thank you so much for that, Doctor. That was very, very insightful. And like I've said this before, the future is here. Thank you so much. So can you imagine operating here and it actually getting done in another part of the world? Like, it's a bit mind-boggling, isn't it? All right, so we are on to our next panel discussion. This one is going to include quite a few, 5 panelists and 1 moderator, and we are going to be tackling transforming hospital culture, promoting a proactive approach to real-time situation management. Why are we clapping? For me? Aw, you guys are cute. All right, so I would like to welcome the moderator of this session, Dr. Sumana Talakokula. Yes, I got it right. And the panelists are going to include Dr. Hitendra Singh Tanwar, Dr. Manikundan, as well as Paul Henderson, Sarah Heladi, and Lavina Lal. Yes, it's going to be a nice full stage, a very lovely full stage. Panelists, if you can just grab a microphone. You don't have to touch anything. They're all live. And there's enough for everybody. Perfect. Perfect, perfect, perfect. Great. Thank you, Doctor. The stage is yours.
Thank you. Hello, good afternoon, everyone. And I welcome today the panel discussion on the topic that's critical in a health landscape, transforming hospital culture, promoting a proactive approach to real-time situation management. I'm thrilled and honored for moderating this panel discussion, and I'm confident by end of this panel discussion, we'll gain some invaluable insights to take away. So I take this immense pleasure in moderating this panel discussion. I'm Dr. Sumana Talakokula, obstetrician and gynecologist with over 2 decades of experience in the medical field. After my graduation, post-graduation from India, I completed fellowship in gynecological endoscopy from Germany, alongside certifications in pharmacovigilance and healthcare management from IIM Trichy. I'm associated as the head of the OBGYN at SLG Hospitals and also a senior consultant at Apollo Hospitals, Hyderabad, India. I'm also associated with Maheshwara Medical College and LRD Super Speciality Hospitals as a CEO. I'm honored to be a part of the Health 2.0 conference in Dubai. With an unwavering commitment to excellence and a passion for advancing medical frontiers, I'm looking forward to contributing today's discussion, eager to share insights and collaborate towards transformative solutions. Here I am, Dr. Sumana Talakokula. Next, it's a great pleasure to introduce our esteemed panelists. A warm welcome to you all. Now, ladies and gentlemen, we are honored to welcome Dr. Manikandan Katrivel, an esteemed consultant in hepatobiliary surgery and liver transplant surgery at Royal Free London and Whittington's Health NHS Trust, and is also a COO and Program Director of Prep Medico, with a focus on liver transplantation, organ preservation, and minimally invasive hepatobiliary cancer surgery. As a co-founder of Prep Medico, he offers global medical education, opportunities in the FRCS mentorship programs endorsed by the Royal College of Surgeons, Edinburgh. I welcome to the panel Mr. Dr. Manikandan. Your insights and perspectives are eagerly anticipated as we engage in a meaningful dialogue. Now we have our distinguished panelist, Dr. Hitendra Tanwar. He is the Divisional Clinical Director for Urgent and Emergency Care at NHS England for East Kent Trust. He has background in acute medicine, endocrinology, and metabolic disorders, complemented by fellowships from esteemed institutions like Harvard Med Joslin Diabetes Institute and FRCP from Royal College of Physicians, London. He has been in healthcare for almost 2 decades, has been recognized with accolades as the British Citizen Award and Outstanding Global Leadership Award at the Health 2.0 conference. We are privileged to have you here, Dr. Tanwar, and I'm looking forward to your insights to enrich our panel discussion profoundly. Now, ladies and gentlemen, please allow me to introduce Lavina Lal, an esteemed professional with 15 years of extensive experience in nursing, quality management, patient experience, and hospital operations at Fortis Hospital in Mumbai. Specializing in leading accreditations from both national and international organizations. A hearty welcome to you, Lavina, and your presence adds immense value to our gathering. Dear panelists and audience, now I will introduce Mr. Paul R. Henderson, with over 26 years of experience in the US military health system. From humble beginnings in medical technical roles, Dr. Henderson has ascended to the executive suite, specializing in healthcare finance, budgeting, and accounting. Currently serving as the Chief Financial Officer at US Naval Hospital, Yokosuka, Japan. He oversees resource management for the second largest military treatment facility in Indo-Pacific region. Welcome, Mr. Paul. Look forward to your valuable contributions. Let's welcome Sarah Haleli. She is a Chief Commercial Officer and Head of the Academy at Health Optimizing in Italy, a leading medtech company utilizing 33 technologies to address health challenges at their root. With expertise in applying principles of physics to molecular levels and extensive experience in neurological and neuromusculoskeletal fields, she is dedicated to promoting intrinsic self-healing mechanisms and facilitating collaboration among the specialists. A warm welcome to the panel, Ms. Sarah. And now, let's embark this discussion together. Okay. Before we delve into our discussion, let's take a moment to set the stage. The healthcare landscape is evolving rapidly, and the hospitals are facing increasingly complex challenges. From patient safety to resource allocation, and the ability to manage situations in real time is paramount. Our panelists bring diverse expertise to the table, and today we are here to explore how hospitals can proactively transform their culture to better address these challenges. So let's start our questions. Are you ready? First question, Dr. Hitendra. Can you discuss examples of hospitals or healthcare organizations that have successfully implemented proactive approaches to situation management? And how has these initiatives improved patient safety and organizational performances?
Yeah, thank you, Suna. So I will give you a very basic example. So like you said, after pandemic, the things are not normal. So I think in UK, and I speak to my Indian colleague as well, that people are more conscious. We are talking everything now, and I was listening very keenly, diet and positivity, but still there are a lot of diseases which you need to treat in hospital. So what we saw in UK, that our ambulances conveyance were very high, and primary network, probably they are supporting very well, but still we could not cope. You can imagine 250 to 300 ambulances touching in 12 hours, and you know that we don't have doctors all over the world.
Mm-hmm.
And then we thought that, okay, it's a real-time situation, and we cannot leave our sick patient, in this ED crowds.
Mm-hmm.
So we changed our conventional approach to a proactive approach, and then we spoke to the other people, like stakeholders in NHS, like CCAM ambulances. These are the ambulances, paramedics, community leaders, clinical leads, GP network. And then we came up with a very nice idea, like why don't we just make a hub, next to the hospital, and we call it a single point of access, SPOA. And then we will tackle, all these calls. And obviously it's a, the world of, modern technology. So every ambulance call, they make the call 999, so we can track this call. We have a software to see that what is the background of the patient, what is the comorbidities, what is the situation at the moment, and we have this all body camera and everything. So we can do the ECG and some POCT, something very draconian, and then we just connect. So we decided to make a hub, which is called UEC Hub SPOA, and we are really lucky to run successfully this hub. So what change? The change is that when we take calls for ambulances, so I give you the real number, 45 to 50 ambulances. This means sick patient who's supposed to come in the UEC, and they wait for at least 17 hours. This is the current situation.
Oh.
So we treat them right there. We decide that we need to bring this ambulance to home hospital, or we just treat at home. And we successfully, I think the team is like ED consultant like us, who actually can triage quickly. Then we have a community frailty leads. We have a community same-day emergency care, like a pretty much a outpatient-based things, and they can reach home, which is called hospital at home. Then we spoke to the GP networking. Can we have a hot hour appointment? Like we can fix it when you close it. So it brought a big impact change. So how it affect our hospital and our more needy patient? If I am diverting 45 to 50 ambulances in a week, it means those ambulances are now rerouting to the acute emergency. Probably somebody dying, young person with aortic dissection, pulmonary embolism, massive heart attack, or any kind of a trauma. Second thing, these patients, when they are treated right at their home, they feel happy. We are not making them wait for 17 hours, in chairs, which is like a current crisis. And we are avoiding hospital-acquired infection. Suppose if it's a cancer patient on chemotherapy. So I can tell you, list of the advantages, but there's a simple approach. So we go to the hub, we assign the community frailty lead, one acute consultant or emergency consultant with the help of our GP partners. We treat them right there. And of course, if it is necessary, the ambulance will come. So that's a brilliant example. Go proactive with the help of these all telemedicine, camera, POCT, and embedding the technology in the modern science.
Yes. So the air ambulances and well-equipped ambulance with the GPS network is essential to take the patient safety.
Oh yes, definitely. So like when the call comes, we track it, okay? And this is a whole system. It's like a ambulance hub. So they have a very redefined system of tracking the patient, and then we can speak to the patient, we can speak to the GP one. And obviously it's like a full experts. So what we can do in hospital, we are doing, you can say simply as a pre-hospital medicine. Yeah?
That's nice explanation by Dr. Hitendra. Now we are towards Manikandan now. Dr. Manikandan, what are some common obstacles or challenges encountered when attempting to transform the hospital culture, and what strategies have you found effective in overcome these barriers?
Good evening, everyone, and thank you, Sumana, for your introduction. First of all, I think I need to give some idea to the audience what we are discussing, basically what is proactive and what is reactive, and why we are looking into a proactive approach. The simple difference is a reactive approach or a reactive scenario is you react after the event has happened. One of the biggest reactive approach which we all ended up in a shock is during the COVID first wave.
Absolutely.
So the whole world was shocked. We didn't know what to do. Lots of mortalities were mainly because of the failure of the system itself rather than the disease. The proactive approach is nothing but where we predict something to happen or we anticipate something or some disaster. I wouldn't want to put as a disaster, but some deviation from what is expected and plan things adequately in terms of resource allocation, manpower, policy, etc. This is called as a reactive approach. So COVID is one of the best example to know how a system could fail. Means the evolved systems like the systems in the UK, US also failed, and the developing systems and underdeveloped, everything got failed, mainly because we never anticipated. But even simple examples like, winter pressures for the bed. So in the UK, every year before the winter comes, we know that the hospital will be flooded with flu patients, and we will start anticipating and making sure that the bed capacity is increased, and we make sure that the staffs are adequately equipped. We speak to the agencies who provide us the additional staffs during those pressures, something like that. So that is one kind of a reactive, it's a proactive approach. The second proactive approach is simple vaccinations against flu. Planning the hospital beds on a Monday morning. You know, Monday morning is usually an easy day to handle compared to a Wednesday or a Friday where we will be having patients from the beginning. And also having frequent interdepartmental meetings to see where the hospital stands. This is all a kind of a dynamic, proactive approach which happens every day. Now, when we want to bring in a new system, so again, I would like to categorize the health system into a developed system like a UK and US, where there are plenty of policies and the strategies which happens continuously to anticipate or predict the problems and work on it. But there are certain developing systems in the world, in the developing countries, where people or the healthcare sector is so much used to the traditional methods of managing stuff. And when we want to bring in a new way of approaching certain things, for example, simple things like, making the documentation electronic from manual itself is a huge task in certain hospitals in making that policy. Yeah. So the biggest hindrance or a hurdle in making a proactive approach in a healthcare situation is a resistance from the people whom we want to make the change. So they are so much used to the comfortness of what they are doing, and any change which we want to bring in is going to mean they feel that it is affecting their comfortness and the resistance. The second important thing is understanding what we are trying to do. Okay? So when we want to bring in a change, if there is no effective communication on what is the outcome of a particular change which we want to bring in, it's never going to work. So in order to make this happen, there should be a strong introduction or an education on what we are trying to bring. And it's not just the words, but it will be better if we bring a successful model using a data telling that this has worked very well there, and given our population or our situation, I think this would work better. So we need to make the people from whom we want to change to understand what is the difference we are expecting. The third important thing is the communication. The problem, what happens is whenever we put forth a change which we want to bring in, because the healthcare system consists of different hierarchy of people, when the communication of information moves from hierarchy to hierarchy, it gets so much diluted. And as I told, whenever we are forced to a change, we always identify the negative aspects of it rather than the positive aspects. And people show so much hesitation to change these things. And finally comes the financial factors. Almost most of our healthcare sector anywhere in the world is overstretched, and we, at least in my opinion, we all work more than what is expected. And when we want to bring in a change, it needs an additional effort in terms of our working time, the resource allocation, finance, recruiting new people, and stuff like this. I think the resistance to change, communication barriers, and then lack of communication and the resource allocation are the most commonest hurdles which I think would prevent some change to happen.
Yes, absolutely. There is a now invention of the technology, maybe solve the issues, whatever you said, most probably will be in a positive note. Next, coming to Mr. Paul. Mr. Paul, hi. How can hospitals ensure that communication system value inputs from ground level workers and senior managers equally?
Thanks so much for the question. So working in Japan, I work in a very diverse environment. Number one, the military is there. We have Japanese nationals that work in the facility. And so there's kind of a different sense of how to communicate, so the culture communicates within that environment. And so one of the things that is critically important is for senior leadership to communicate that everyone's opinion is valuable and it's important. What we do at our facility is, we have a suggestion box where everyone who finds that there's an issue, they can bring that to bear and have our senior leadership actually consider that. And when they submit their suggestions, there's actually a requirement for what we call a triad, which is just the three senior most folks, to review those, and then they disposition them to the director who might provide a solution for that. And then it's either communicated to the individual if they want to be anonymous. In some cases, that's communicated to the masses if necessary or if that's proper. But there is a result that's provided, so to make sure that those issues are addressed. But once again, I think it's really on senior leadership to make sure that everyone in the facility, their opinion is valuable.
Yeah, absolutely. And I am adding to what you are saying. In a military system, you are working in a military hospital. So how healthcare technology and artificial intelligence is utilized in communications and in mode of data privacy and ethical concerns?
So although AI is actually an area that the military is advancing in, it's not really, at least at my facility just yet, an area that is actually widely used. And part of that has to do with the risk of information and also data. So it's actually an area that I know that the military is actually considering, but it hasn't made it to a wide use in the medical field just yet.
Okay, it's a good explanation, Mr. Paul. Now we'll move to Lavina. Lavina, how can you hospital leadership empower nurses and other frontline staff to take ownership of real-time situation management? And what role does culture play in this empowerment?
Very good evening to all of you, and thank you, Dr. Sumona, for the question. Before we delve into how do we empower the frontline staff, I would like to just elaborate a little bit on culture and how it is the driving force behind empowerment. So just using the word culture as an acronym, and I'll just quickly go through what each of these words stand for. So I would start by saying that C, the very start of culture, it starts with communication, and my fellow colleagues on this panel have already mentioned enough about it. You cannot communicate enough, because communication actually talks about the decisions of the board, the governing leadership, at multiple levels. So communication is definitely one of the most important components of a culture. U stands for understanding the needs of your frontline staff. You don't understand that, you're not going to plan anything accordingly. So first is, can you be those understanding people who will stipulate what kind of needs these frontline staffs require. L stands for leading by example. Paul here very correctly said it starts from the senior leadership. We are talking about the frontline workers, but the senior leaderships lead by example. They need to show, and empowerment is going to come from the senior leadership only. So lead by example. Coming back to T, T is teach teamwork. And I'm saying especially teach teamwork because unless you teach how teamwork has to be done, instead of just advising to work in a team, you have to teach how to work in a team. So teach teamwork to the frontline workers. Unless you teach them the teamwork, you won't be able to see any results coming up. So that's T. Again, U, have uninterrupted supplies. That's what I would say. If you want your frontline workers to stand up in a emergency situation, or in a disaster situation, or in a safety issue, or any kind of emerging issue that is coming up, you need to ensure that there is an uninterrupted supplies. Any kind of supplies, be it manpower, resources, as Dr. Manigandan here said about, any kind of. So uninterrupted supplies has to be in place. These are foundational blocks. Then we can come to empowerment. This is how you ensure that empowerment happens. R stands for being realistic with your expectations. So when I'm saying being realistic, it doesn't mean underestimate your frontline workers Also, don't overestimate your frontline workers. You are a CEO of a hospital, so there are some expectations by a CEO. At the same time, the frontline worker is supposed to deliver something on those borders. So have realistic expectations, set and empower them realistically. Do not cast the burden of the whole organization on them, but at the same time have realistic expectations. And build resilience, very important. I think one of the most truest characteristics we came post-COVID was we were resilient. We could come out of it and face with a better preparedness when the second wave hit us and the third wave hit us, and it kept hitting us and we kept coming back. So I think resilience is important. And last is E, any culture of an organization, especially right up to the last person, if somebody needs to understand that, it has to be empathy. If you can't show empathy to your frontline workers, you cannot empower them. They will not believe the empowerment is given to them. So basis these fundamental blocks, if you are empowering your staff, and I'm going to pick something from the military background of India, and if Paul has another view, he can definitely add to it. If there is a best example, what Indian military teaches about is delegation. They call it strategic corporal. It's a fantastic way of delegating responsibility to the next younger officer in command in lower ranks. So when there is a war situation or they're anticipating something or there is a problem, even if they're commanding officers somewhere else, the next in line will automatically assume their role. They're trained in it. They're not left to, just deciding on the spot. They're not put on a spot there. They're trained, empowered, written in a protocol, taught accordingly. So I think that's very key aspect of it. The second aspect parallel to military, which we can adopt here by empowering frontline staff, would be adaptability and to change. So change is going to happen. You cannot anticipate, there's what kind can happen, we will not know. 2005, when I came to Dubai for the first time, the tsunami hit. So it was a new thing happening. 2020, COVID hit. So we don't know what can happen, when can happen, so change. And the last, what I would say is persistence. We have to be persistent towards it. Perseverance is going to last. So these are 2-3 things which I feel can show empowerment in a true structure, which is not just talk of the light, but actually walk of the day. If we do all of this, I'm sure that our frontline workers could be much more proactive and approaching any kind of emergencies, any kind of change that happens.
Yeah. Teamwork enhances the efficiency of healthcare system. Okay. Now our pretty woman, Sarah. Sarah, now tell me, what is the real-time situation management in a hospital setting? And how does it differ from traditional approaches to situation management?
Good evening, good evening, everyone. Thank you for the question. Yes. So when we talk about management in a hospital, we can look at it in a good variety of aspects. I'm a physician, so I will address this question in a clinical setting. When we talk about real-time management in a clinical setting, it means, and we imply, that in hospital, on a daily basis, our doctors and physicians and everyone that works there has the ability and the instrument to make fast and effective decisions based on all the elements that they have at hand. And they can change. So it means what and how fast and how effective can we adapt to the situation, finding solutions in an emergency situation. And hospitals, that's what they do, right? That's what hospitals are for. They intake patients in an emergency situation. When a patient is not in an emergency, can go to GP, can go to a private consultancy. So the hospital is a place where these instruments that enable and empower doctors to make fast and effective decisions have to be implemented the most and fastest. And yet, we see from our statistical research that there is an average lack between 1, in the best cases, and 18 years of gap between technology, because now we're talking about implementation of these technologies and how they can really help us in the clinical setting, being produced and discovered and created and certified to being implemented in the hospital setting. And when I'm talking about, and 18 is the average, so we can get up to 30 years. And what brings it down to 1 year is usually what fit the box, the existing hospital box that we know being extremely rigid and unfortunately extremely limited. When it comes to technologies and the testing, to be able to help a patient in an effective way, it means that the doctors are capable of having enough pieces of the jigsaw puzzle to get to the core of the health challenges. I don't want to call it our healthcare system a disease care system, but it is true that we're actually addressing in most of the cases the consequences of what is actually happening behind the curtain that made it possible for the disease to develop in the first place. We today have technologies, and I say we do have them because I work with them on a daily basis. We have technologies that help us to extrapolate not just a much extensive amount of data of our patients, but in a much faster time, in shorter time window, and enable us to get to the core of health challenges, which means that the approach to our patient aims to fixing those health challenges by the root, and this is possible. The problem that we see today is how, and we need to discuss about this, how can we fasten the implementation of these technologies? How can we push from the inside, from our perspective, from who is working inside the hospital? How can we push to expand this box that is the hospital? Because it is not just about having a proactive approach, because this is what doctors do. They have a patient, they have to decide in real time, in that moment. But it is impossible today in a hospital to have a minute-by-minute extrapolation of data that I know are useful for me to make a serious decision. So what happened in hospital, as it was mentioned in one of the panel before, is that doctors have to rely on protocols. Because the data that they have at hand in a real-time situation are not enough, and they are not all the time pertinent and useful to understand what is causing those health challenges. So to reply to your question, I think that we do already have a real-time approach, but it looks like we don't, simply because we don't have the right tools to express that at its fullest. And I believe that the implementation of these technologies, especially in the diagnostic phase, will really enhance and empower our doctors in a hospital setting.
Yeah. For handling the acute emergencies, the traditional approach of management, the pyramidal hierarchy, now changes to the flat hierarchy. This enables the healthcare system handling the acute emergencies effectively and increase the patient safety and decrease the patient mortality and morbidity. Now, after a set of one round, next go to the second round to the Dr. Hitendra. Mr. Hitendra, as someone on the front lines of healthcare delivery, how do you perceive the impact of hospital culture on real-time situation management, especially during the critical scenarios like emergencies? How does hospital culture impact the effectiveness of emergency response efforts? And what strategies can be employed to promote a proactive approach?
No, that's a very good question. Our southeast, we are a coastal area next to the Dover. So we have a lot of emergencies, like anytime. If it could be weather related, it could be, drowning, English Channel. And not only this, I think we live in the world of uncertainty when it comes to the disaster. And last few years, we have been taught very well. So the hospital culture is really very important to prepare. The preparedness is the key. And it comes through the senior managers who are not experienced in these kind of a clinical situation. So a teamwork, I think you have spoken, my colleague, very well for the culture. So, and it's a really dire need to develop that hospital culture, not to act when the emergency is there, to prepare it. And during pandemics, not only the hospital, all the business, other people, they have learned it very well. And those who learned are surviving very well. And they survived actually.
Yeah.
And culture, I will not, but like you have done everything, but important thing is that a good approach to innovation, listen people, their ideas, concern, go to the ground root workers, see their ideas, be open about it. Let's embrace the new technology, proactive approach, and then make some kind of a rapid task group in the hospital with a good management. So for me, this is 365 days, prepare every day. So that should be embedded in your culture.
Yeah, true. Now, Dr. Manikandan. So, can you elaborate on the shift from reactive to proactive management in healthcare? What strategies or initiatives have you seen or implemented that successfully encourage this shift?
Yeah, I think for the need of time, I will keep it quite short. So, as I told before, when we want to bring in a change, obviously, the most important, the crucial bit is a leadership. So there should be a strong leader or a leading authority or a leading group which should come up with a firm proposal. Okay, and this is true for any kind of change which you want to bring in any sector. So once they come with the proposal, the next step they need to do is spreading the knowledge on why they want to bring this change. As I told, along with definitive data or the previous studies or research or some model which worked out very well elsewhere. And the third important thing is education. Yeah, before you implement it, as Lavina told, we cannot achieve a change overnight. Okay? We should have a strategic planning with an incremental goals. And again, these incremental goals should not be a fixed one. It should be a dynamic process, and we should review on our progress and try to change and address the needs. Again, this is any change which has been successful in one geographical location may not be successful in other areas. So we need to give importance to the local culture, local disease prevalence and various factors. So leadership, then educating the people, and then slowly bringing the change. Now and then audit what is happening and whether we are achieving the same kind of a result from what it has been successful before. If needed, do those changes now and then reach the goal. And most importantly, human beings would love to be rewarded. Okay, I think we should give some kind of an incentive when we try to bring in a change for them to proactively bring in a change. So I think these are all the various strategies, whatever the change we want to bring in whatever level of healthcare. I think this is how we approach. And there are plenty of examples, as I told before. I think Dr. Hitendra has clearly told how COVID had helped up to bring in a change. One best example is the ambulance crew resource allocations during the COVID. Yeah, that's what I want to tell. Thank you.
Okay, because we are running short of time, so let's conclude our session. Now the transformation is going to be a constant change that you will witness, and discussion is never ending. But our time together has come to an end. I had like to extend my sincere gratitude to our esteemed panelists for their invaluable insights and to our audience for their engagement. As we conclude, let's remember that transforming hospital culture to promote a proactive approach to real-time situation management is not just a necessity, but a shared responsibility. Together, we can make strides towards safer, more efficient healthcare delivery. And thank you all for being the part of this important discussion. And I wish you a wonderful day ahead.
Thank you very much for that panel. I'm just going to ask you all to take one step to the front of the stage so we can have a lovely group picture in front of the table. Yes, there you go. Fantastic. And let's give the panel another thunderous round of applause. Thank you so much for your insights and your valuable input in all your fields of expertise. Thank you very, very much. All right, everyone, it's time to gear up for our final discussion of the day. It is going to be a fireside chat, nurse staffing and workload. It is two critical factors that can make or break a patient's safety and nurse morale. So we're deep diving into the trenches to uncover fresh strategies and promise to revolutionize how we approach these challenges. I would like to invite three lovely ladies to the stage. First up, I would like to invite Colonel Madhumita Dal, Dr. Neeta Nagra, as well as Dr. Shruti Mohan. Please put your hands together for these lovely ladies. All right, ladies, the stage is yours.
Hi, everyone. So we'll start off with introductions. I'm Neeta Nagra. I'm a mental health nurse with over 17 years of experience in healthcare. In addition to that, I have a Doctor of Education in Leadership, and I've worked in various leadership roles in healthcare for over a decade. More recently, I've just founded my own leadership consultancy called Fit to Be Strong Leader, and essentially it focuses on empowering individuals to develop leadership competencies, specifically through my framework for self-mastering leadership. And I'll pass it over to Madhumita.
Thank you, Neeta. I'm Colonel Madhumita. I have done my nursing from Armed Forces Medical College, Pune, and I had been into Indian Army for 23 years. I have a total experience of 35 years plus, and currently I'm the nursing director in Rajiv Gandhi Cancer Institute and Research Center, Delhi.
Hello, everybody. I'm Dr. Shruti Mohan. I'm a Chief Quality Officer, Lotan Hospital and Canadian Medical Center. I'm a PhD in Healthcare Management, and my background is engineering. So you'll be wondering how engineering to a healthcare field. It's a wonderful journey. I have graduated from NHQ, Certified Professional in Healthcare Quality, and my entire experience lies in hospital commissioning, operational phase, doing policies and procedures for the hospital. Accreditation is my main strength, where I have worked with Joint Commission International, American standards, Australian standards, along with American and other healthcare standards. So here we are going to start the chat. So as a quality professional, I am here as an unbiased person from the nursing, because nursing is going to talk about workloads. So when they talk about workload as a person, apart from standing away from nursing team, I should be giving you an unbiased opinion. So let me have a question. I would like to ask Colonel Madhumita about what are the effective strategies that we can implement to resolve the challenges and staff nursing issues, workloads. What are the impediments that you face, and how can we resolve these issues?
Thank you, Shruti. Actually, we all know that nurses, they are the frontline workers, and no hospital can work without a nurse. And these nurses, they are always by the patient, at the bedside, 24/7. So obviously, if as a nurse, I'm a nurse. So as a nurse, if you want the patient to have a good quality care, then the nurse's workload has to be understood and the nursing staffing has to be understood. So there are various challenges. Few challenges I would like to quote. Number one is, like hospitals, you have, in hospitals we have multi-dimensional care. No hospital has a specific, until unless it's a super specialized hospital. Mostly all the hospitals have multi-dimensional care, and for that multi-dimensional care, you need specialized nurses. That means if a unit is a nephrology unit, then the nephrologist expects the nurse to have some skill related to nephrology, patient care. So, and it becomes very difficult to have skilled nurses with adequate competency to meet patient safety and patient care. Simultaneously, there are in the hospitals, you do not have fixed number of patients. Sometimes there will be patients, few patients in the wards, and sometimes the patients in ICUs, you may get too many number of patients. On the top of that, if you have a surge of patients coming in, then obviously the workload increases in the staffs and the patient care is compromised. Another challenge what we face is acute shortage of the nurses globally. As per WHO, there is 5.9 million shortage of nurses globally. So you can understand if there is acute shortage of nurses globally, the amount of workload a nurse can have and how the patient care can be compromised. Over to Nita to share your experience.
Thank you. So interestingly enough, you were talking about empowering nurses, and I was actually reading an article where they were talking about in the US, companies spent over $147 billion on training their employees and staff. However, there's very little return in investment. And the reason for that is because people join good organizations, however, they leave poor managers. And so I see this as being an issue in healthcare. I think the biggest issue actually is projection bias. So projection bias is essentially when individuals think that other people think and act or value the same things that they do. And if we look at who is in leadership in healthcare, majority of the individuals are either baby boomers or Generation X. And the reality is the workforce that we have now, which is Generation Y and Generation Z, have very different values. The other thing I'd like to point out is that the staffing models, I guess, staffing models and the way we created workload for nursing has changed. So we're dealing with more acute illnesses. We have more complex issues. As we heard earlier today, there's more toxins, there's more substances which are causing more complexity. There's technology now. In addition to that, the workforce has changed, the people have changed. The values of the people now are that they want to feel empowered. They want to have autonomy. They want to be respected. They want to have work-life balance, and they want to have meaningful work. And yet, we are still using the same old models to manage nurses and also staff nurses. So what we actually need to do is we need to look at what is the underlying cause. The underlying cause is the needs for nurses are not being met. So what we have to do if we really want to resolve these issues, we need to look at what the needs are for the nurses and meet those needs. So we need to change the way we, for example, staffing hours, those need to change. Is it actually safe and healthy for nurses to be working 40 to 44 hours a week? Is it healthy for them to be picking up overtime? There's a lot of different things we actually need to look at to determine if the strategies we actually have in place are effective, and then based off of those, moving forward, changing the way we do things so that we can actually meet the need for nurses. Shruti, I'll pass it to you.
Yeah, the thing is that you were talking about the models and you were adding on to the skilled nursing workforce. So when you talk about from this perspective, I would like to give you another perspective where the healthcare organization, it's high time that you need to change your policies and procedures. You need to think about onboarding, training the nurses, new nurses. When you train the new nurses, you should also establish an open communication with the existing nurses. You should understand the pain points from their perspective. Along with that, we should think about technology integration so that we can save most of our time. And we have 5 6 Sigma lean concept where we actually implement in the medication preparation areas so that we can consume lots of our time and dedicate to patient care. Here, one more thing I would like to remind you, especially all the healthcare leaders, CEO, COO, CFO, because you always think about the expense. Just think about a different reality or a future where nurses are no longer considered as an operational expense. They are not an operational expense, but think about there as an investment They are our investment for patient safety and exceptional outcome to provide a better patient care, and they are the one who is directly dealing with the patients. Yeah.
To add up to the strategy, I would like to say also, we all have to, as a leader, has to think and decide that what should be the nurse-patient ratios. There are nurse-patient regulations are there, and we should stick to the nurse-patient ratios. It has been proved that a nurse cannot take more than 5 to 6 patients in general wards. But in ICUs or in BMQ special units, the nurse-patient ratio has to be strictly monitored. And as per the regulations, if a patient is on ventilator, it has to be 1:1 ratio. If you really want to give a proper patient care, and non-ventilated patient, it has to be 1:2. The moment we compromise into nurse-patient ratio, the moment we compromise into processes, that is how the errors take place and patient safety, patient care is at stake. So, Neeta. Okay. So, Neeta, now I would like to ask you a question. That is, what are the initiative strategies we would like to implement to reduce the burnouts and promote wellness in nurses?
Great. So I'll just give the audience a bit of stats. A survey that was conducted in 2022 had, they had surveyed over 2,500 nurses, and over 75% of them indicated that they had burnout. In addition to that, they had asked what they would rate their general mental health and well-being as, with 1 being the lowest and 10 being the highest. And they rated their, I guess the average score was 5.8. And whereas previously, before COVID, it was about 8. So that shows that there's been a huge decline. And I think, once again, we need to go to the underlying factors. Nurses have probably one of the most challenging jobs in healthcare. They're faced with constant suffering. They're not only are patients suffering, but they're having to care for these individuals, and there's a lack of control. They can't control the outcomes of the patients. All they can do is really provide the care. And what ends up happening is, due to that lack of control, they end up dealing with aggression, not only from patients, but from one another. They end up, there's a whole bunch of literature that shows that nurses engage in horizontal violence, which is essentially bullying, and I would attribute that to a lack of control that nurses have. So one of the strategies that I've actually have started to implement is I've created an app. It's free for nurses globally, and it's going to be launched on April 1st. It's called NEW, which is Nurses Elevating Worldwide. And the intention of this app is, me being a nurse, I'm taking a pledge to empower other nurses. And what this app is going to do is it's going to enable nurses to connect globally and empower each other. There's going to be self-care, there's going to be a self-care resource kit, which is going to be accessible for nurses, and they're going to be able to use these self-care strategies on their breaks so that they can refill their inner resources on their shift, and they can go back out and really be the best version of themselves, because I think that's what's really lacking right now. Nurses are constantly caring for others, they're not caring for themselves, and they're not caring for one another. And so for me, it's really important that we're empowering one another to take care of ourselves and to take care of each other.
Yeah, I would like to add on that one of the key factors of accreditation for the organization is the support system. They will evaluate the support system of all the healthcare facility, how they promote their staff, empower staff, and how much they are considerate about the well-being of the staff. So we do have different activities that up to the staffs to promote their well-being, mental health. I think Madhumita have more to add on to this. Apart from that, what I would like to add on here is that it's very important that happy and healthy employees are more productive for an organization. When an accreditation surveyor or auditor comes to the hospital, the first thing they ask the staff is, are you really happy in your department? Why they ask this question? Because if they are happy means they are more productive, they will deliver the better care for the patients, and they have a good culture of safety in their department. They maintain a climate of positive environment where staffs are motivated to do more productive things. So apart from the well-being, one more thing which I want to mention here is try to implement a secondary victim program, because during the COVID times, especially during the sentinel events or patient death, the more psychological effect is being impacted on the people who are giving care, especially physicians, surgeons, nurses, who are directly involved with the patient. They have the psychological problem or emotional intelligence should be there to support them. We should counsel them, we have to investigate, and we have to make sure that we are not discussing about people. We are discussing about the problem and resolving it with correct action plan, not a punitive response to errors. Yeah. Over to you, Madhumita.
Thank you, Shruti. In relation to burnout, like the things what we practice in our hospital, I can see, is that we encourage the nurses. I have empowered my nurses. We have empowered the nurses to speak out. You know, if you see anything wrong, please speak out. That is one thing. Then we have an open door system. Any nurse, whether it's a junior most nurse or a senior nurse, can walk into my office at any part of the day during the working hours and come out with their problems and can share their problems, and we look into it and we try to solve it. That is one thing. Then appreciating nurses for their good work. You know, yesterday somebody was mentioning about gratitude. We don't acknowledge the hard work of the nurses. We should acknowledge the hard work of the nurses. We should appreciate for the good work what they are doing. Human being, errors will happen. But when a nurse is doing a good job, nobody is there to appreciate. So I would request everyone that please appreciate your nurses for whatever little work they are doing. They are trying to put their best. Little bit of appreciation will encourage them and they will do their best. Then celebrate birthdays. You know, in their departments, in their units, they can celebrate their birthdays. You can organize a one-day picnic for the nurses. All nurses cannot go together. But yes, majority of the nurses can go. So that is how you help them to express out their feelings, help them, and that is how you will be able to reduce their burnouts. Then another one thing is celebrating festivals. We do celebrate, you know, India is very rich in culture and festivals. So we try to celebrate all the festivals, whether it is Christmas, whether it is Diwali, whether it is Onam, whatever it is. We celebrate, and it is the nurses who participate, and that is how, you know, we encourage the nurses to have some social gatherings. Then one more thing we do is, being in the organization, we conduct exclusively nursing conference for our nurses. It is a 2 days exclusive nursing conference where the nurses are participating in the conference. They are the speakers, and it is globally nurses participate in our conference. So there are various methods. It is only as a leader, if you want, you can implement. That is what I would like to say.
Great. All right, so moving on to our last question, Shruti, could you please tell me what are some strategies that an organization can adopt to enhance patient safety in nursing?
That's a good question. So to enhance patient safety in nursing, we talked about lots of things right now here. Apart from that, we need to think about technology. Since we have lots of sessions here, discussions related to real-time data collection, healthcare management system, health information management system, data intelligence plays a key role here. There are lots of key performance indicators right now, which international benchmark, where we can really monitor the performance of the nurses. So there is one question that we usually ask the nurses. The thing is that, are you performing well in your department? Of course, you will say positively, yes. So how do you measure that? Because if you need to improve, you need to measure. You need to show the statistical evidence. So when we talk about the problems, let's start collecting the data. Let's turn into a real-time source where we can escalate this to the management. So when we have the data, we can identify the opportunities of improvements. So we do have quality improvement projects where we use different types of tools, Focus PDCA, Lean Six Sigma technology. During this, what is the benefit is that we can really see what is really happening in the department because process owners are there participating in the quality improvement project. So when we talk to the process owners, they are the one who really face the problems. So we can collect the data, we can analyze it, and we won't stop it once we achieve the target. We have to continuously monitor it. This is what I have to add on. One last thing here I want to mention is about safety huddles. This is a good practice which we implemented in our hospital and it was really successful. Initially, when we bring this concept, everybody was like, you know, in the early morning, you have to go up, you have to stand and talk. So they were like, why we are wasting our time? Why need to waste our time? But later on, we identified that 5 or 10 minutes chat between the leaders or the managers or the staff involved in the process have changed a lot. We really escalated lots of patient safety issues which the management didn't actually see. They saw it in the patient safety huddles and we could do quick decisions. So safety huddles, try to implement in all the healthcare organizations. You will feel the difference and you will feel that people are empowered, involved, and they are the key decision makers here.
Yeah, I agree with Shruti. The same thing is with our hospitals also. You know, in India, we have various accreditations for the hospitals. And one of the accreditation is your nursing excellence. If a hospital is having nursing excellence accreditation, then it is said that in this hospital, there are standardized procedures and all the processes are followed as per the standards laid. So quality indicators has to be monitored if you want to literally review the patient care and patient feedback. And the quality, it is not that there should not be any punitive action for any incidences happening, because the moment you have a punitive action, then no incidences will be reported. So it should be a free culture, free reporting system, where no punitive actions are there. One, we as a leaders have to look into the root cause analysis. We have to see where the processes have gone wrong and how to rectify those processes and implement the correct process. And simultaneously, you should involve the nurses into policy making, because nurses are at the bedside, they know what is good and what is wrong. So in policy making decisions, the nurses' involvement is very much required, and the management should, in our hospital, the management is very proactive and they ensure that the nursing department is there in all the committees and in all policy making procedures. So that is one culture the organization should try to develop. And simultaneously, the organization should encourage education, ongoing education and training program. Because it is very difficult to get skilled nurses. Mostly you will have freshers who are coming into the hospital. So if you do not have proper education system, proper training system, then you will not be able to train the nurses.
Thank you. Yeah. So just kind of building off a couple of points that you had both stated. So Shruti, starting off with you, you said that healthcare needs to be more proactive in integrating technology. However, I think one of the biggest issues is, and one of the panels earlier had mentioned this, we are behind in implementing technology in healthcare. And one of the reasons for that is, once again, I'm going to go to projection bias. The leaders that we have in healthcare are individuals who actually did not grow up in technology. So there's a lot of hesitancy to bring technology forward. For example, there's AI, and we could be using AI in a proactive, safe manner to reduce workload for nurses. However, there's hesitancy because it's something that's unknown. And of course, people do not like venturing down things that are unknown. However, it's important that we're being proactive and we're jumping on these issues. So I think in order for us to be able to integrate technology effectively into healthcare, leadership needs to really change their perspectives and also develop the competencies needed to lead the change. The second thing I'd like to discuss, which you were mentioning, Madhumita, is regarding involving nurses in policy making. Now, I didn't mention this, but I'm also a director for a hospital, and I have invited nurses to committees. And what I noticed was it's ineffective because nurses will attend, but they do not speak up because once again, as I mentioned before, they haven't been empowered. That hasn't been the culture. So they'll attend and they'll agree, basically like robots. So a strategy that I've actually started to implement is I've created decentralized working groups where I'm providing nurses with the best current evidence-based practice. I'm providing them with the accreditation standards. I'm providing them with the problem. And I'm saying, you find the solution. And so they're actually working based off of all of the information. They're finding the solutions because they know what the issues are, and they're responsible for rolling out the implementation of their solution and evaluating to see the effectiveness of it. I think that's how we're really going to be able to empower nurses, is by giving them their power back and utilizing their strengths. And I guess that brings us to a wrap for our discussion. I guess we have about 5 minutes, so I'd like to open it up to the audience to see if there's any questions.
Just a quick question. So I think you've spoken about the whole aspect of both the physical and emotional well-being of nurses within a hospital ecosystem. But as you're seeing, there's a significant emergence of home health care. And especially in a construct, and I think for last 6 years, 7 years, I've been working in that field, primarily trying to see how we can bring in both advanced nursing into home health for setting up a home ICU kind of a situation. Now, how do you extend, or what practices do you believe technology can play and processes can play to bring in more safety to a work environment of nature? That's my question.
So to answer your question, if you have to have a home healthcare system where an extended ICU can be there, again the question comes to a skilled nurse, right? The nurse has to be properly trained, and we have to look into the credential of the nurse and how skillful the nurse is. If the nurse is not skilled, then the adequate training can be given in a hospital scenario, and then the nurse can be deployed in a home setup, in a home scenario where she can give patient care. So everything is related to skill and competency, and obviously the exposure that a nurse gets in a hospital is to be considered.
That's a quick question.
Yeah, adding on to the processes that you were talking about, I think the question is not completed. Can I complete?
Yeah, you can complete.
Yeah, because he was asking a second part about the processes that we can implement for home care services. Of course, there are standards related to home care services, especially Joint Commission International Accreditation Standards have about 65 criteria that talks about home care services, how we can monitor, how we can see that our staff goes there, document, and we can ensure the psychological safety of the staff who goes there, because we are not there, we are not directly involved there. We don't know how the patient reacts. The patient may be aggressive. We don't know what the situation and how they will support the staff. So there are certain standards that we can follow, and we have policies and procedures in place to make sure that staff goes there, staff safety is concerned. Apart from that, they deliver high quality of care and safe care delivery is done. Is that fine? Understood?
Just a quick question. That was a very thought-provoking session. Thank you. So in the UK, we have ample opportunity for nursing, let's say senior nurses to become director of nursing. And when I discuss with the director of nursing, their perspective becomes drift away. So you are right, absolutely. If you work with the nurses, especially in emergency department, you can feel that, the burnout. But my question to you is that, because you mentioned that when you invite them, they don't speak up, which is true. Yeah. So why don't we develop a leadership among them, and then we have some seasoned nursing leadership to make a policy And why do they change when they reach a good position and they just become suddenly, we start working in silos then? That's the question.
Yeah, so that's a great point. And I mean, I was talking to Madhumita about this earlier. I think the way it's traditionally happened in nursing, and I'd actually say in healthcare, is you're a good nurse, so you'll make a good manager, you'll make a good leader. But the skill set and competencies needed to be a leader or a manager is completely different than being a nurse or a doctor or any other healthcare worker. And so I think what we need to do is we need to start investing in nurses, doctors, any healthcare professional. If we want them to be leaders, we need to start teaching them leadership competencies. And actually, sometimes it's counterintuitive because people, to be a direct care provider, you need to be very empathetic, and so some people don't like conflict management or conflict resolution. And so some people actually may not, even though they're good nurses, they may not make good managers just because that's just not part of their personality where they want to be able to actively be dealing with conflict. So I think part of the issue is individuals aren't actually given the opportunity to develop the competencies. They're just kind of thrown into these positions. And then when they're thrown into the position, the culture is already that you have to be a certain way. So in order to maintain status quo or to maintain their status in that position, they conform rather than really authentically embracing who they are and being able to build up on their competencies.
To add to your question, sir, it is like empowering the nurse. You said once a person reaches to a leadership place, then she forgets everything. So it's not, it is the question of empowering. You empower the leader, you empower her. So you will see the changes that she tries to bring out in the junior. You have to involve her into the decision makings. So when you involve into the decision makings, then she will try to change. She will try to bring, the changes what we are expecting to reduce the burnouts and all. So it is, again, a question comes again to the end is invest in nursing, acknowledging nursing, investing in nursing, that is required. Otherwise, a time will come when there will be acute shortage of nurses and the hospitals, God forbid, the hospitals will run without nurses. So it is until unless we invest on nurses, we empower them, we allow them to participate in policy makings, we allow them to have decision makings, things will not improve.
Adding on to this, there is a tool from HRQ, Patient Safety Culture Survey Tool. Anybody have been using this? This is a really good tool. Try to implement it in your hospital because there are nurses who are very shy. Even if you empower them, you encourage them, they don't want to come and speak up in the limelight. So we use this tool to get the perspective of the nurses, and we use the challenges turn into opportunities.
All right, our time is up. Thank you so much, everyone. Really appreciate the questions, and it was a very engaging audience, so thank you.
Thank you so much.
Wonderful. Ladies, that was amazing. Please take a step forward on the stage so we can get a lovely group picture. Another round of applause for these lovely ladies. Thank you so much. To the unsung heroes, right? The nursing staff. Oh yes, can't do anything without those wonderful nurses. Now we transition to the much anticipated recognition session, and we are very much only 8 minutes behind. So kudos to everyone. Thank you so much to all our speakers, our panelists, and everyone who's been on the stage to give their valuable expertise. So I would also like to say that Health 2.0 Conference proudly acknowledges the remarkable efforts of the healthcare professionals globally, and it's time to celebrate these pioneers with exceptional roles in transforming the health industry. To present these awards, I'd like to welcome Mr. Klaus Willemsen, CTO of Codebase. Thank you for being here, sir. If you can just be on the other side of the stage. That's it, Klaus Willemsen. Fantastic. So, are we ready for this? I know this is what you've been waiting for. Yes or yes? All right, okay. I know you're there. I know you're there. So, for our very first award, I would like to say this is for the Outstanding Leadership Award. I would like to invite Tushar Srivastava, CEO of Connect HEOR, as a visionary leader in health economics and outcomes research with a career spanning over a decade across various sectors, including pharmaceuticals, policy making. Tushar also dedicates himself to nurturing future leaders in healthcare analytics and research. Yes, let's try get the background of Health 2.0. Come forward to the stage. Forward, forward, forward. Yeah, perfect. It's always only the first one, right? The example is set, and now everyone just follows suit. Congratulations, Tushar. Of course.
Thanks for the recognition. Really appreciate it. I would like to just acknowledge the fact that healthcare, like the healthcare journey has never been easy, and it will never be. But I would just like to thanks everyone, and would like to say that congratulations to all of us who are at the forefront of this particular journey, and kind of a huge round of applause for all of us here. So thank you.
Thanks, Tushar, and congratulations. Up next, for Outstanding Organization Award, we wouldn't be here without this gentleman, Dr. Ali Tanazli. My mistake. I've said your name like 7 times and I still messed it up. Lifespan GmbH aims to provide people with the best possible knowledge about their health. To do this, under Dr. Ali Tanazli's guidance, they gather experience about the risks, diseases, and therapies development. Another one under the belt for you, sir. Congratulations. Thank you, Dr. Ali. Up next, for Outstanding Leadership Award, I'd like to welcome to the stage Amit Saraswat. Mr. Amit stands as a beacon of innovation and leadership within the technological realm, steering Q-Line innovations with unparalleled expertise and the foresight as its executive director. His adequateness and conceptualizing, designing, and implementing new ideas has led to the creation of pioneering solutions, including state-of-the-art oxygen concentrator, an indigenous RNA tray filling machine, and cost-effective electrolyte analyzer, each a testament to his commitment to innovation.
Everything has been told about myself, but I would like to tell that in India, we are having a very good team of fluidics, mechanics, electronics, and software engineers, where we are developing the indigenous analyzers. We have a tie-up with 3 European companies, and we are developing the instruments for them: clinical chemistry, hematology, coagulation. We have a strength of developing any imaginable analyzer from scratch to whatever you dream we can produce in the reality. So that's our core strength, and we are always open for the joint venture. You can search for our company. It's POCT Group in India. Thank you.
Thank you very much, sir. Continuing with the Outstanding Leadership Award, I'd like to welcome Chiara Cantone to the stage. Chiara, who is from Piemonte, Italy, is a distinguished sports physiotherapist, golf teacher, wellness consultant, and director of Physio Golf Marbella. Having relocated to Spain 18 years ago, she specializes in golf and health, co-funding Europe's premier healthy golf academy.
Well, thank you very much to everybody. We are all here to improve the quality of life of people, but who is helping us? I mean, we all have a mindset that is a visionary mindset. We all had a vision, and nowadays you have made your vision a reality. So I'm sure that all of you had a lot of failures. That normally has a negative aspect, but is very important to improve. So who is helping you during these tough times? Because today we are all nicely dressed, happy, with lots of rewards, but I'm sure you had, like myself, tough times. So I just want to thank you so much, because listen to you, you have helped my burning desire to be even bigger. As these kind ladies said, I'm working in a man's field. Do you know what this means? So, and I have a very revolutionary project. I have a golf wellness academy, so my approach is holistic. So it's completely another way of seeing the world of golf. So thank you very much, because I know that dreams can come true. And I want to thank a special person today that is here in this room. And she is my hero, because only in a few days she became even better than my community manager, learning how to make videos and take pictures that you know that nowadays we have to be on socials all the time. So I would like to have a picture with her as well and share the prize with her. So Mama, come on the stage.
Aww. A lovely moment to capture forever. What was the $1 million idea we had yesterday to say 3 little words? I love you. That's right. That's love right there. That is love on a different level. That was beautiful. Thank you so much, Chiara. All right, next up for Outstanding Leadership Award, I'd like to invite Elvan Sener, an advanced level exercise specialist and medical exercise specialist at Pro Nucleus. Elvan collaborates with medical professionals to address over 60 special diseases, enhancing the quality of life for individuals with specific medical conditions. A round of applause. A master trainer and educator at Fitness Academy in Turkey, Elvan aspires to establish her own team of high-quality trainers and therapists, aiming to become a renowned brand in medical exercise and lifestyle coaching right here in the UAE. All right, up next for, again, Outstanding Leadership Award, I'd like to present this to Dr. Hitendra Singh Tanwar. Dr. Hitendra Tanwar, a distinguished medical professional with over 3 decades of experience, holds key roles as Divisional Clinical Director, Urgent and Emergency Care at NHS England in the UK, Chief Consultant and Educational Lead at William Harvey Hospital in Kent, UK. He's been awarded the world's most prestigious fellowship from the Royal College of Physicians in London for his national and international work in the field of clinical medicine. Thank you, Doctor. Congratulations. Up next for Outstanding Leadership Award, I'd like to present this to Jesus Suarez. Jesus, are you in the room? I guess not. Jesus Suarez? Nope. All right, moving on again. Oh, we're moving on to a different type of award now. This is for Young Leadership Award. I'd like to invite Mr. Khalid Mohammed Al-Mahaiza, Associate Consultant at the Ascend Solutions. Dr. Khalid Al-Mahaiza is a distinguished professional recognized for his expertise in project management and strategic planning. His notable contributions include leading and participating in national level projects, reflecting his capacity to influence and drive significant initiatives. His entrepreneurial endeavors in the healthcare and F&B sectors further illustrate his strategic acumen and industry versatility. Wait. Take your moment, sir. Come forward. Great. Thank you. Yes, of course.
Thank you all. It's a pleasure to be with you all in this special event for me. I'm truly humbled and honored to be receiving this award. I would like to say this award is not just a personal recognition. It's a reflection of a collective passion and hard work of many people who inspired me to keep pushing and defining new boundaries that I once think it will never be achievable. The credit and gratitude goes to my mentors, colleagues, and my supportive family over there. Thank you. I would like, as I'm accepting this award, I'm reminded of a quote that I live by, which reads, "You are the greatest project you will ever work on. Restart, reset, refocus. As many time as you need. Just do not give up." If you allow me, I would like to call my partner, my mentor, my father, Dr. Mohammed Al-Mahaiza, on stage. I want to have a picture with him. He is the guy. Because of him, I'm the man. I'm what am I right now. He make me the entrepreneur, the associate consultant. Thank you. Will never be enough for him.
This is the future, ladies and gentlemen. Once again, Mr. Khalid has won the award, Health 2.0 Conference for Young Leadership Award. Shukran. Up next for the Health 2.0 Conference Outstanding Leadership Award, I'd like to invite Lizette Guzman. Lizette Guzman, are you in the room? I guess not. We'll be moving on. This lady is in the room. For Outstanding Leadership Awards, Colonel Madhumita Dal. Colonel Madhumita Dal, yes, keep it going. She was on the stage not too long ago. She retired from the Indian Army, currently serves as the nursing director at the Rajiv Gandhi Cancer Institute and Research Center in Delhi. With experience of over 34 years and distinguished military career spanning 23 years, she holds certifications in pediatric nursing, intensive care nursing, infection control and prevention, and NABH accreditation standards for hospitals, just to name a few.
Good evening, ladies and gentlemen. Thank you. I would like to thank the organizing team for giving this platform. And I would like to thank all my mentors throughout my career, my boss, who had been a very positive man and had always motivated me to participate in all the things. And of course, I have a lovely, beautiful nursing team in Rajiv Gandhi Cancer Institute. Their support, their love has always motivated me to achieve and do good. So a sincere thank to my beautiful nursing team, and obviously my family members. I would request my husband to be on stage, Colonel Yadav, because his contribution towards my career has been immense. We both were in service, and I could not have achieved this without my husband's support and my children's support. I have a daughter and a son. They had been in the journey, in my ups and downs, and always been there with me. Thank you, thank you, thank you very much.
Congratulations.
Thank you.
Thank you, Colonel.
Poem for her. May I? Yes. Okay. Just
A special request.
Okay, good evening, ladies and gentlemen. I was also in the Indian Army for more than 25 years. I'm a helicopter pilot, and for past 15 years, I've been flying now as a commercial pilot in the Indian subcontinent. I also write blogs, poems, and stories on my blog. And to dedicate her success here, I've written a small poem in Hindi, which is our national language. Okay. It's called Nabam Sprasham Deeptam. Touch the sky with glory. तू बन पतंग आकाश को मैं धरा से जुड़ा डोर हूँ तेरी मस्त पवन अंबर में उड़ मैं खुश हूँ तू पतंग है मेरी तुम गगन चूम कर बतलाना कैसा है शिखर ये दिखलाना क्या फलक अभी भी बाकी है पापा डोर फिरकी में काफ़ी है जरा ढील को और बढ़ा देना माँ को और हवा देना पतंग जरा चढ़ा देना हम नीचे रहकर देखेंगे आसमान कहाँ तक बाकी है माँ में हिम्मत अभी बहुत बाकी है हम दूर तलक उन्हें भेजेंगे ढील भी पूरी देंगे पर याद हमें है कृष्ण की बात अर्जुन भी सुन विस्माया था दूर कहीं तक चले जाना पर याद रहे प्रेम बंधन है हमारे साथ जितनी हर्षित हो तुम नभ छूकर हम सब आह्लादित यह कहकर देखो पतंग हमारी सबसे न्यारी सबसे ऊंची दिखती है मानो बाजी जैसे है हमने मारी थैंक यू The essence of this is that if you have family support like a kite in the sky, the kite can go as high as possible, but if it is attached to the roots, the root is your parents, your family, your children, and this system surrounding you. It can let you go as high as possible if you remain attached to them. Thank you.
That was lovely. Took a little bit of a sidestep there, but let's get back on track. Up next for Outstanding Organization Award, I'd like to ask Dr. Manikandan Kartivil to come up on stage and accept this award for Prep Medico. It's an online platform that offers high-quality training, mentorship, and guidance to doctors who aim for memberships and fellowships of the UK Royal Colleges. It's a community of experienced faculty, physicians, and surgeons who have excelled in mentoring and teaching doctors who aim for academic excellence.
I'll quickly finish. Thank you, Health 2.0 organizers, for honoring our firm with the Excellent Outstanding Organization Award. As she told, this is a firm which was created by a group of surgeons in the UK, mainly to help surgeons and mentor them for clearing their membership and fellowship exams of the Royal College. But the success of this program, the gates of Prep Medico is open, and I take this opportunity to invite anyone in the healthcare who are passionate towards teaching and mentoring to join hands with us or collaborate with us, and let us together take the healthcare to a next level globally. Thank you.
Thank you very much. Up next for the Health 2.0 Conference Outstanding Leadership Award, Dr. Marika Krons. Dr. Marika, are you in the room? No. Again, Outstanding Leadership Award, I'd like to invite Mirko Colombo. Mirko? Mirko Colombo is the owner of Colombo Personal Health Coaching, specializes in health coaching and possesses extensive expertise in aiding individuals in weight loss and improving health disorders. Within 24 years of experience, he has formulated the Colombo Method, a comprehensive 360-degree approach to achieving healthy weight throughout a person's re-education. Thank you, Mirko. Congratulations. Up next for the Health 2.0 Conference Visionaries Award, I would like to welcome back to the stage Dr. Nita Nagra. Nita Nagar is the founder of Fit to Be Strong Leader, is a distinguished thought leader, author, and educator whose diverse educational background and extensive experience have positioned her at the forefront of leadership development.
Thank you so much, Health 2.0, for this award. As many of you may have seen, I'm a very passionate person. And in addition to that, I also have quite radical ideas. So I'd like to thank my family and my friends for always supporting my radical ideas. And that is actually what led me to opening or starting my own business. It's because I have a vision, and essentially my vision is that we'll have a world of self-mastering leaders. My philosophy is that you can't lead others until you effectively lead yourself. So my vision is that one day we'll have individuals who are effectively leading themselves and then leading others, so we can have a world where we won't be having the issues that we have currently. So thank you, everyone.
Thank you so much, and congratulations, Doctor. Up next for Outstanding Leadership Award, I'd like to invite Pallav Kanderwal to the stage. Pallav is the CEO of RL Ventures, had developed a keen interest in entrepreneurship early on and opened his first outlet at 22 years old. And then opening multiple stores later, he then ran multiple retail pharmacy outlets, paralleling to running his family-managed business of distribution of pharmaceutical products in Central MP.
Of course, I'll take this opportunity. As an entrepreneur, I have everything that I am today is because of my parents. And you guys all made me a little emotional because my parents are not here with me. My family isn't here, my lovely wife, my 2 kids back home. So this is for you guys, my team, and my friends. So thank you so much. Thank you.
Thank you. Health 2.0 Conference Outstanding Leadership Award. I'd like to present this award to Pascal Derrien. Pascal, are you in the room? Up next for, again, Outstanding Leadership Award. I know this gentleman is definitely in the room. Paul Henderson, PhD. Dr. Paul Henderson, CFO at NH Yokosuka, has diverse educational background with degrees in administration of justice, criminal justice, forensics, and public policy and administration. His ascent in the U.S. Navy culminated in a senior role as a healthcare administrator and medical service corps officer. His 26-year career is distinguished by multiple awards, including 3 Navy Commendation Medals and 4 Navy Marine Corps Achievement Medals, and of course, this one right now, Outstanding Leadership Award.
Well, I'd like to thank Health 2.0 for this opportunity, and I'd like to give a special thanks, of course, to my wife for all of her support. Wouldn't be here without her, so thanks again.
Thanks, Dr. Paul. Health 2.0 Conference Outstanding Leadership Award would welcome back to the stage Dr. Pier Luigi Latuada, MD, PsyD, PhD, and is a medical doctor, psychologist, and psychotherapist, and CEO of Integral Transpersonal Institute. He is the president of Euritas Global Transpersonal Network and director of Training School in Transpersonal Psychotherapy, recognized by MIUR, and the Advanced Training of Transpersonal Counseling.
Just to thank the organizers and all of you, but also I would like to thank all the workers behind, because I went here in Dubai, I saw all this beauty, and seeing these skyscrapers, I thought to all the people that work to create all these, and nobody knows and nobody speaks of them. So thanks to all the persons that are behind and let this happen. Thank you.
Grazie. Up next for Health 2.0 Conference Outstanding Organization Award, I would like to call up Rafid Healthcare Supplies, LLC, Ajay Punjabi. A highly accomplished, forward-thinking CIPS, ethical procurement certified, keenly commercially driven, organized sourcing, procurement, and supply chain professional with expertise in overseeing highly complex, cross-country, multi-million-dollar procurement and supply chain projects, actively making positive contributions to the bottom line of the organizations.
Thank you so much for the honor. Rafid, as the region-based group purchasing organization under Pure Health, covering everything, sourcing, distribution, we are dedicating in improving the healthcare and the in UAE, and we are really happy and appreciate the acknowledgement for our effort. Thank you so much.
Thank you. Up next for Outstanding Leadership Award, I'd like to welcome back to the stage Sarah Halali. Sarah Halali's journey so far stands as a testament to her rapid and dynamic career progression. 4 years ago, Health Optimizing, a company using an extensive pool, state-of-the-art technologies to resolve health challenges at their roots. They headhunted her. This transition catapulted her into a position of head of Health Optimization Academy, simultaneously leading to the flagship clinic in Norway and holding the prestigious role of the company's CCO. Sarah's swift rise demonstrates her expertise, leadership, and commitment to leveraging cutting-edge technologies and for transforming advancement in medical practices.
Thank you so much for this award and recognition. And thank you for the beautiful presentation and introduction. Here with me today, I have the founder, Thomas Axnes of Health Optimizing, which I would like to share this with.
Come on stage.
Yeah, if you can, please.
Take a photo together, yeah?
So during my journey in healthcare, I was really all the time searching for a better solution to feel that I was accomplishing my mission in helping people in a better way and in a much more profound way. And this really took a leap when I met Health Optimizing, and especially its founder, Thomas, who I want to thank for all the work that he has put in the previous 20 to 25 years to develop our methodologies and the combination of all the technologies and protocols that we use today, and that really make me feel on a daily basis that I can help people to seriously overcome their health challenges. So, thank you, Thomas.
Thank you. Up next for Outstanding Organization Award, I'd like to welcome Shanak Shah to the stage. Shanak Shah, president of Saptak Foundation, has launched his own non-governmental organization, which is an NGO, to encourage different musicians and artists from pan-India to collaborate with his NGO and participate in different events. His goal is to promote young artists and musicians to let them gain global exposure and showcase their talents. Now, Mr. Shanak has sent to me his appreciation speech, so I'm going to be saying his speech on his behalf. So I will be talking as if I was him. So, hello everyone, good afternoon. My name is Shanak Shah. I want to thank Health 2.0 Conference for giving me this opportunity to be here. I am from India, Gujarat. My organization, Saptak World, is one of the pioneers in delivering NCLEX coaching from Asia. I would like just to give you a brief little bit about NCLEX. Is a National Council licensure examination. It's used by the state boards of nursing to determine whether the candidates are ready to start participating as an entry-level nurse. We offer personalized coaching for NCLEX with a wide range of materials and services. My team and I have been working in the industry for the past 12 years and have gained experience in this field. I am working with nurses from all around the world, and I can offer NCLEX coaching globally. My goal is to promote NCLEX furthermore and create awareness for coming generations of nurses. Through this conference, I would like to be connected with upcoming nurse schools, nursing labs, hospitals. With the rising number of potential nurses registering to become nurses, it is important to create a wholesome environment where nurses are encouraged and supported to pursue their dreams. Subtech World aims to provide end-to-end support to all the nurses and potential nurses with the NCLEX coaching worldwide with flexible training and coaching facilities. Thank you. I did good? All right, up next for Outstanding Leadership Award, I'd like to invite Shumaila Imtiaz in the room. Shumaila? There she is. Shumaila Imtiaz, Wellness and Nutrition Coach at the Nutri Clinic by Miss Kalm, is a dedicated wellness coach, leadership expert, and author who loves making life better for others. Specializing in a mindset transformation, she channels her positive energy and fun-loving spirit into empowering clients to overcome mental blocks and prioritize self-care and embrace healthier habits. Thank you. For Outstanding Leadership Award, I met this lovely lady yesterday, and I'd like to welcome Stephanie Bush to the stage. She is the founder and chief marketing nerd of Nerd and Chic Marketing. She draws from her 20 and more years of experience across 3 continents. Her commitment to equality, diversity, inclusion, and accessible healthcare serves as the foundation for her empathetic and responsible approach. Congratulations. Health 2.0 Conference Outstanding Organization Award. I'd like to call Dr. Sushil Kumar to the stage for DWA Herbals as a preventative healthcare and research-oriented company established and supported by renowned medical practitioners, scientists, and IP attorneys. With Dr. Kumar as its founder, DWA Herbals is dedicated to providing healthy longevity by focusing its research on free radicals, nanoparticles, and antioxidants. Solo photo.
Thank you, everyone.
I like that. Thank you, Doctor. Our next award for Outstanding Leadership, I'd like to invite Thomas Askew. Thomas, are you here in the room? No. Up next for Outstanding Leadership Award, I met this gentleman yesterday, Utkarsh Churastia. Utkarsh is the founder of Black Leo Meds, which is an investment group based in India. Through Black Leo Meds, Utkarsh seeks to participate in the decision-making process of the industry as a whole. He is also the co-founder of We Care Network, LLC, a pioneer in the medical staffing and workforce management.
Well, I would like to thank Health 2.0, every team member, especially Yashasvi. I signed up last minute and she helped me out, so thank you for that. Next up, I'm really glad to have this opportunity. I mean, to be surrounded by such entrepreneurs, especially young entrepreneurs that are doing amazing things. I got to connect with them. It was a great opportunity. Thank you, Health 2.0. And lastly, well, like everyone else, I was also lucky enough to be supported by my family, so I really want to thank them at the end. Thank you so much.
Thank you. Health 2.0 Conference Outstanding Leadership Award goes to Dr. Vipin Kumar. He can come back to the stage. He's a dynamic young physician with academic excellence, proven by his I can't say. Wait, stand by. I lost my words. With a career of 2 gold medals and his facilitation by the health minister and ex-president of India as an obstetrician and gynecologist at Daman Health Assurance Hospitals Company, Kuwait. He has been a known figure in every place he's worked. He is known as the patient's doctor for his communication skills, his attitude towards his patients, and most for his ability to make his patients feel empowered.
Thank you so much. So this award is for all the women out there and the womanhood and the multitasking they do, which includes my wife too. And a round of applause for her for doing a great job for the whole day.
Thank you so much. Oh, that's nice. Thank you. For Outstanding Leadership Award, I'd like to welcome Dr. William Cook to the stage. In 2004, Dr. William Cook opened Foundations Family Medicine WellCare Community Health in the area of southern Indiana that hasn't had stable healthcare since the 1970s. Over in the last 20 years, he's expanded comprehensive services to this underserved area. In recognition to his leadership in the fields of healthcare and addiction, he has served on several advisory boards and was awarded the first ever Physician Pillar of Excellence Award by the Addiction Policy Forum. Health 2.0 Conference would like to award Outstanding Leadership to Dr. Yasuhiro Suzuki. Yasuhiro Suzuki is Associate Professor at the Nagoya University, collaborated with Reiko Suzuki, a tactile designer and beautician, and developed the Tactile Score. It is an algorithm for describing, manipulating, and distributing tactile information. Yasuhiro is also founded in the Japanese Tactile Association, composed of top executives from AI companies and academia in various fields, to certify and evaluate tactile DX technology for quality assurance. You're very welcome. Up next for the Outstanding Leadership Award, I'd like to invite Yoshihito Takahashi, professor at Senshu University. He's experienced chairman of the Asian Market Economics Association, director of the Japan Competitive Intelligence Society, special member of the Japan New Business Council Federation, expert member in the Ministry of Education's Intellectual Cluster Creation Project, expert advisor of the Japan Science and Technology Agency, chair of the Designated Managers Selection and Evaluation Committee of Yokohama City. He also served as a strategic advisor at NeuroSyntech, a biotechnology venture in Silicon Valley in the USA.
Thank you very much. I'm very grateful for this award. Thank you very much.
You're so welcome. All right, folks, we've made it. We've made it. It's the last award. And I'd like to welcome to the stage for Outstanding Organization Award, Zia Al-Hassan Saqib. Bioscan AI offers autonomous solutions for early detection and conditions such as vision-threatening diabetic retinopathy, muscular edema, and life-threatening chronic kidney disease, cardiovascular diseases, and breast cancer. Led by the founder and CEO, Zia Al-Hassan Saqib, an innovation leverages image analysis, computer vision, and AI packed as software as a medical device, which is a SAMD, and hosted on a cloud to provide fast, accurate, and actionable assessments.
First thing to say that Dr. Zia is not able to come here to Dubai. I am his co-founder and CMO of the company. And just before getting this award, 10 minutes before, I came to know that we have almost crossed 10,000, like we have predicted and prevented 10,000 patients from getting diabetic retinopathy, and it leads to blindness. So just 10 minutes before. And yeah, and last thing, that's my quote, that it's the time to revolutionize healthcare diagnostics by democratizing it and by detecting these systemic diseases like heart disease, kidney disease, diabetic retinopathy within seconds using AI. And we are looking for collaborations, and we are happy to get guidance. As a 21-year-old, under this roof, I have got so much to learn about this healthcare industry. And yeah, thank you.
Thank you so much. All right, we have one final edition award. It's literally just been thrown at me. Give me a short second. I'd like to invite for Outstanding Leadership Award, Shruti Mohan. Dr. Shruti Mohan is the Chief Quality Officer at Lotan Hospital and Canadian Medical Center, is highly qualified healthcare practitioner with over 10 years of experience in accredited healthcare organizations in Kuwait. Dr. Mohan has a strong background in quality assurance, risk management, and regulatory clinical informatics. She has played pivotal roles in JCI and ACHSI accreditation processes, demonstrating expertise in quality improvement, patient safety, accreditation, and operational excellence.
Thank you to Point0 Health Conference for giving me this opportunity. Thank you so much for your efforts. Your background work is amazing. And receiving this prestigious award is a remarkable journey in my career. Thanks to Almighty God. I would like to thank my beloved parents over there, seeing through life, and thanks to my husband and little kids who were really understanding and adjusting all throughout my journey, pursuing my dreams. Here, I would like to share one small step. Every day, you feel like there are lots of hurdles, challenges, people, talks. Forget about that. Kaizen methodology. This is one of the successful methodology that you can adopt in your life. Do something, small steps, manifest your vision, and one day you will reach there. Thank you so much.
Thank you. A final round of applause for Mr. Klaus Willemsen. Stood the test of time. And now I would like all of my award winners to come onto the stage so we can take a nice group photo. So bring your awards. We're going to have a lovely group photo. And for those of you who don't know how to receive your photos, there is a QR code in the lobby. All you have to do is scan the QR code. It's going to prompt you for your WhatsApp number. And it's also going to ask you to take a selfie because AI today is just incredible. Come on up as I'm talking. You don't have to worry. You can just listen as I'm talking. Okay, so what's going to happen is they're going to ask you to take a selfie of yourself, and what it does is the AI will detect your face and it'll bring up a personalized photo gallery of all the pictures that you are in. If you happen to not find the photo that you're particularly looking for, you can go through the 10 million photos that were taken from all the photographers around all the conferences. All right, let's squish in a little more. Let's squish in, be shoulder to shoulder. Get it closer, get closer. We're all family here. Everyone take a step forward. More, 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 more. The projection is giving you a line across your head. I don't think you want that photo. Step forward. Dr. Paul, could you step forward? Yes, there we go. Another round of applause for all our award winners. Congratulations, everybody. Yes, there's only one set of stairs. Please don't jump off the stage. Even there are 1,000 doctors in the room. I feel very safe. I feel the safest with all the doctors in the room and all their expertise. So once again, congratulations to all the award winners. Your dedication and hard work is truly commendable, and we wish you the best of luck to continue on your remarkable journeys. As we wrap for day 2 of the Health 2.0 conference, let's not let the learning and network stop here. This evening presents a wonderful opportunity to engage further in insightful conversations, dive deeper into delivery discussions, and explore the wealth of innovations and ideas showcased in our exhibition booths. We also want to extend our heartfelt gratitude to everyone here. Being such an engaging and wonderful audience, your participation has made these 2 days incredibly fruitful and inspiring. And of course, a special thanks to our bronze sponsor, Lifespin GmbH. Your partnership is invaluable to us. Now, before signing out for the day, I want to share that our US and Dubai editions are shaping up to be quite full. So if you are still looking for panel discussions or exhibition booths, I would suggest you make your way over to our exhibition booth and have a chat to Jatin Sidhu for more information so that you don't miss out. I look forward to seeing you all again tomorrow for the final and exciting day. Let's make most of tonight's networking hour and continue to build connections that'll drive forward healthcare innovation.